morning, distinguished delegates. Welcome to the final day of work of Committee A. Before we start our discussion this morning, I would like us to adopt the draft of the fourth report of Committee A. I therefore give the floor to our rapporteur, Mr. Basimbwa, who will read the report in question. Mr. Basimbwa, the floor is yours.
Thank you, Chair. Committee A held its 9th and 10th meetings on 22nd May 2026, chaired by Dr. Timur Sultangaziev of Kazakhstan, Mr. Fernando Israel Espinoza Oliveira of Mexico, and Mr. Ibrahim Nishan Ahmed of Maldives. It was decided to recommend to the 79th World Health Assembly the adoption of the attached 4 resolutions and 2 decisions relating to the following agenda items. Provide health. 12, a review of and update on matters considered by the Executive Board. 12.4, universal health coverage. 1 resolution entitled Precision Medicine, a path towards targeted, personalized and equitable care. 1 resolution entitled Strengthening equitable access to diagnostic personalized equitable care. 1 resolution entitled Strengthening equitable access to diagnostic imaging through teleradiology. 1 resolution entitled Reducing the burden of stroke, strengthening prevention, acute care, rehabilitation and health system readiness. 1 resolution entitled Advancing Smart, Efficient Pharmacovigilance as an Essential Tool for Robust, Sustainable, Resilient and Responsive Health Systems for Everyone, Everywhere. Draft Global Strategy for Integrated Emergency Critical and Operative Care 2026-2035. 1 decision, increasing availability, ethical access and oversight of transplantation of human cells, tissues, and organs. 1 decision. Thank you, Chair.
Thank you, Mr. Basimbwa. I understand the committee is willing to adopt this report as read out. Are there any objections? I see none. The report is adopted. We will now reopen the grouping of the following agenda item under Provide Health. Subitem 12.5, Primary Health Care, and Subitem 12.A, Report of the Expert Advisory Group on the WHO Global Code of Practice on International Recruitment of Health Personnel. The relevant documents are A79/5, A79/5 at 3, and A79/5 at 5. Yesterday afternoon, we completed the member state interventions for this grouping of agenda sub-items. Several non-state actors in official relation with WHO have requested the floor on this agenda item. I now have the pleasure in giving the floor to International Federation of Medical Students Associations.
Honorable Chairperson, esteemed delegates, strong primary health care is central to UHC and resilient health systems. Yet, it cannot exist without a well-supported and equitably distributed workforce. Considering the review of the WHO Global Code of Practice, we call for increased investment in ethical recruitment alongside retention and domestic training. A resilient PHC system also depends on sustainable and dignified working conditions. Health workers face high rates of anxiety, depression, and burnout driven by heavy workloads, understaffing, long hours, emotional strain, and limited support. Ensuring fair conditions, adequate staffing, occupational safety, and access to mental health support is essential to protect and retain the workforce. There is no primary health care without people, and no resilient system without those who sustain it. Thank you.
Thank you. I now give the floor to International Lactation Consultant Association.
Thank you, Chair. ILCA recognizes primary health care as the foundation for achieving equitable universal health coverage worldwide. Today, the global health workforce is under unprecedented strain. Reduced funding, workforce shortages, burnout, and chronic underinvestment are placing increasing pressure on fragile health systems and threatening equitable access to care. Resilient primary healthcare systems must include strong maternal, newborn, and child health services. Integrating lactation consultants into multidisciplinary teams strengthens support for families and helps protect and sustain breastfeeding across hospital and community settings. Skilled lactation care increases breastfeeding rates, improves families' experiences, and reduces healthcare costs associated with preventable infections and non-communicable diseases. Investing in the lactation workforce strengthens population health, primary healthcare systems, and health system resilience. I thank you.
Thank you. I now invite International Pharmaceutical Federation.
Honorable Chair, distinguished delegates, I'm speaking for the International Pharmaceutical Federation, member of the World Health Professions Alliance, representing 47 million dentists, nurses, pharmacists, physicians, and physiotherapists. We commend the Executive Board's decision to support the EAG's report, fully endorse its recommendations to strengthen the code, and suggest prioritization of resources for it. However, we are concerned that this will not be enough to stem the growing tide of active recruitment and the harm being done to essential health services in under-resourced regions. We urge member states to require, rather than encourage, high-income countries to make targeted co-investments in the health workforce and health systems in source countries. Thank you for your attention.
Thank you. I now invite International Pharmaceutical Students Federation.
Honorable Chair, distinguished delegates, the International Pharmaceutical Students Federation, representing over 600,000 members, recognizes strong primary healthcare systems and a sustainable health workforce as essential to achieving UHC. As highlighted in the draft resolution on the World Health Organization Global Code of Practice, member states are encouraged to strengthen sustainable workforce policies, improve data sharing on international student exchanges, and support mutually beneficial healthcare partnerships. Through IPSF Student Exchange Program, facilitating over 1,000 on-site and 10,000 online exchanges annually, we advance collaboration and the sharing of skills among future health professionals. IPSF encourages investment in youth-inclusive workforce development and resilient people-centered healthcare systems, recognizing the global health workforce as one community working towards health for all. Thank you.
Thank you. I now give the floor to Medical Women's International Association.
Thank you, Chair. The Medical Women's International Association brings 106 years of leadership experience in women's health and the rights of female medical professionals. We reaffirm that strong primary health care and a sustainable health workforce are foundations of UHC. Persistent underinvestment in primary health care disproportionately affects women, children, and vulnerable populations. We also welcome the Expert Advisory Group's report and reaffirm that the ethical recruitment of health personnel is essential, particularly in countries facing critical workforce shortages. The WHO Global Code of Practice should reflect that women comprise 67% of the global health and social workforce and require specific protection measures to ensure equitable employment, decent working conditions, and safeguarding rights, especially in emergency and fragile settings. We stand ready to collaborate in advancing these efforts. Thank you, Chair.
Thank you. I now invite Medicus Mundi International Network Health for All.
This statement is supported by the People's Health Movement. We welcome the review of the Global Code of Practice, and we reaffirm its relevance amid deepening global health workforce inequities and continued cross-border recruitment. However, voluntary norms are insufficient. Binding, accountability, and reparative measures are needed to prevent exploitative recruitment practices and to address shortages in workers' countries of origin that intensify reliance on underpaid and overburdened community health workers, the majority of whom are women. Debt burdens and neoliberal conditionalities have driven disinvestment in health worker training and recruitment in developing countries, contributing to migration to high-income countries. Additionally, illicit financial flows and tax evasion erode domestic financing for health in the majority world. Chair, health justice demands tax justice, debt cancellation, and sustained public investment. We therefore call on member states and the WHO to engage constructively in the negotiations for a United Nations Framework Convention on International Tax Cooperation. Thank you.
Thank you. I now give the floor to Public Services International.
PSI welcomes the report of the Expert Advisory Group and the reiterated support of the EB for the Code of Practice. We urge member states to ensure that additional text to renew the implementation of the code involves more stringent application of WHO Health Workforce Support and Safeguard List, as well as measures to stop the systematic exploitation of migrant health workers. This requires strict regulation of the activities of recruitment companies to ensure fair and ethical migration. Bilateral agreements and co-investment programs must also be transparent and involve tripartite negotiations in both the source and destination countries. Health worker rights and the reduction of regional health inequities must be at the heart of implementing the code. Thank you, Chair.
Thank you. I now invite Rare Diseases International.
Thank you, Honourable Chair and esteemed delegates. We welcome the report and stress that primary health care must better serve the over 300 million people living with a rare disease, particularly in low and middle income countries. Primary care is often the first point of contact with the health system, yet many people face fragmented or absent care pathways, delayed diagnosis and limited referral systems, worsening health outcomes and impacts on their mental well-being. Strong, people-centered primary care can facilitate early recognition, care coordination, and continuity across the life course. We call on member states to embed rare diseases in primary healthcare strategies, strengthen referral networks, and invest in training and digital tools to support frontline providers, to build inclusive pathways, particularly in limited resource settings, and advance universal health coverage. Thank you.
Thank you. I now give the floor to Women Delivery.
Thank you, Chair. I'm making the statement on behalf of Arrow, Women Deliver, and the Kaleidoscope Collective. A quality, accessible, affordable primary healthcare committed to social justice, equity, solidarity, and participation for everyone, particularly women and girls, serves as the foundation for a dignified quality of life. Re-emphasizing the declaration of Astana, we urge member states to build, invest, and expand in sustainable primary healthcare that includes providing and prioritizing services around adolescent health and comprehensive sexual and reproductive health. Invest in capacity building and compensation of health workforce at PHCs so that services are delivered in the most respectful, equitable, and safe manner to guarantee quality health outcomes and ensure access for all people. Thank you, Chair.
Thank you. Wonka Association, you have the floor.
Thank you, Chair. Primary health care is the foundation of resilient and equitable health systems, and family doctors are at its core. Strong evidence shows that continuity, coordination, and comprehensiveness deliver better outcomes, patient safety, and stronger communities across the life course. These are the hallmarks of person-centered family medicine. The World Organization of Family Doctors, WONCA, shares the board concern over persistent underinvestment in primary health care. This gap is felt most acutely in the severe and worsening global shortage of family doctors, which threatens progress on universal health coverage, especially in underserved communities. WONCA calls on WHO and member states to invest in family medicine training, workforce development, specialty recognition, and fair working conditions. Promote ethical international recruitment standards and to strengthen community-based primary care as the backbone of resilient health systems. Thank you.
Thank you. I now invite World Federation of Chiropractic.
Honorable Chair, distinguished delegates, the World Federation of Chiropractic and the World Rehabilitation Alliance stress that rehabilitation must be fully integrated into primary care to achieve universal health coverage and people-centered systems. As highlighted in the Director General's report, strong primary health care underpins integrated care across the life course. Yet, rehabilitation remains insufficiently embedded, leaving millions without timely, appropriate, affordable services. Integration enables early identification of functional needs, coordinated referrals, and continuity of care, reducing avoidable hospitalizations and long-term limitations. We call for deliberate action, inclusion and essential health services packages, a competent workforce, sustainable financing, functioning data and health information systems, and effective referral pathways. Rehabilitation is foundational to resilient, equitable PHC. Thank you.
Thank you. I now invite World Federation of Neurology.
Right. Honorable Chair and distinguished delegates, the World Federation of Neurology highly supports the commitment of member states to advance primary health care, which, however, remains unevenly accessible across populations. Primary health care is crucial for timely diagnosis of potentially disabling conditions and indispensable for implementing prevention measures. We urge the implementation of the WHO Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders to prepare PHC frameworks to address the high prevalence of neurological conditions and comorbidities. The WFN maintains that effective, sustainable healthcare systems need primary care practitioners equipped with practical neurological training, diagnostic tools, and referral pathways. The WFN is committed to supporting its member states in raising this workforce capacity with an emphasis on under-resourced parts of the world. Thank you.
Thank you. Thank you to all distinguished delegates. We have now concluded the list of statements. I now give the floor to the Secretariat, Dr. Pukala, WHO Regional Director for the Western Pacific.
Thank you, Chair. Good morning, Excellencies, colleagues, ladies and gentlemen. Primary health care remains the most equitable and most effective pathway to universal health coverage. At the 158th Executive Board, we reaffirm that PHC is not only the foundation of resilient health systems, but also a platform for stronger international cooperation. Since then, we have seen encouraging progress across all regions. In Africa, WHO support has enabled countries to expand implementation of essential health services packages and strengthen national quality strategies alongside a significant increase in the density of skilled health workers. In the Americas, countries continue to advance PHC transformation tailored to local needs, supported through strong partnerships, including with multilateral development banks. In Europe, PHC has become a central pillar of the regional program of work and cross-regional collaboration, including with the Western Pacific region, and is helping to demonstrate practical models of PHC delivery. In the Eastern Mediterranean region, PHC is being strengthened as the backbone of emergency-ready and shock-resilient system, particularly in humanitarian settings. In Southeast Asia, countries are transitioning from disease-specific programs to comprehensive life course approaches supported by regional platforms for learning and collaboration. And in the Western Pacific, transformative primary health care is at the heart of our regional agenda. Through country-led demonstration sites, we are testing new service delivery models and harnessing digital innovation to accelerate progress toward UHC. Honorable Chair, while we can be proud of these achievements, the challenge remains clear. primary health care remains underfunded and under-prioritized. Millions of people still lack access to essential services. Inequities persist, both within and between countries. So the question is not whether PHT works. We know it does. The question is whether we are prepared to invest in it consistently, sufficiently, and sustainably. To move forward, we must act together in 4 key areas. First, strengthen international solidarity with predictable and sustainable financing. Second, harness digital transformation, ensuring safe, ethical, and equitable use of technologies, including artificial intelligence. Third, reorient health systems in line with the Lusaka Agenda, placing PHC at the center. And finally, invest in leadership to drive primary healthcare transformation. Chair, on behalf of my fellow regional directors, I reaffirm WHO commitment to support countries in achieving health for all. And this will only be possible when primary healthcare is truly at the heart of every health system, for every person, everywhere. I thank you.
Thank you, Dr. Piukala. I shall now give the floor to Dr. Nakatani, Assistant Director General, Health Systems, Access and Data.
Thank you, Chair. Thank you, Member States, for your strong message. We faced uneven progress and the health financing crisis. We must sustain and deepen our commitment to implement the primary healthcare approach and investment of the health workforce. PHC remains the most efficient and effective pathway to the UHC. Member States highlighted experience the PHC-oriented health systems meeting the community's needs with integrated services across the life course in tackling diseases and in health emergencies. Investing in the health workers is the crucial foundation. It contributes also to inclusive economic growth and global health security. We welcome the resolutions focused on the sustainable and ethical mobility of the health personnel. The cause update based on the expert advisory group recommendations is affirmation of the solidarity and collaboration through the voluntary instruments. I thank Bangladesh, Germany, Pakistan, and the Philippines for co-facilitating the resolution and the member states' constructive engagement. The resolution's implementations must deliver mutual and proportional benefits for source and destination countries. We encourage all countries to view co-investment as win-win. We have provisionally updated the support and safeguards list. We will soon invite member states to indicate what their desired flexibilities, including for both listed and unlisted countries, to indicate if safeguards measures are needed or not. We continue our wider efforts to strengthening the health workforce. As member states raised, WHO Academy now includes all our work on health workforce into one place, a crucial single platform for supporting this agenda. We think as the global center of excellence for the health workforce strengthening and learning. We value your support and partnership to ensure its success, such as the UHC partnership and the PHC coalition. I thank Kazakhstan for your leadership. Workforce is one essential part of the strengthening the health systems based on PHC. We have the crucial opportunity to further advancing the PHC, the UN General Assembly high-level meeting on UHC next year. We look forward to working with member states to fully seize this momentum. Thank you, Chair.
Thank you, Dr. Nakatani. Is the committee ready to note the reports pertaining to this discussion as contained in document A79/5? The reports are noted. Is the committee ready to approve the draft resolution entitled WHO Global Code of Practice on the International Recruitment of Health Personnel contained in document A79/5 add 3? I see no objections. The resolution is approved. This grouping of agenda item is now closed. We will now take up the grouping of the following agenda item under Provide Health. Sub-item 12.7, substandard and falsified medical products, and sub-item 12.9, draft updated global action plan on antimicrobial resistance. The relevant documents are A79/5 and A79/5 add 2. Under sub-item 12.9, we are invited to consider the draft decision recommended by the Executive Board in decision EB 158, contained in document EB 158/2026/rec/1. I will now open the floor for discussions. Would those delegates wishing to speak, please press the microphone button now. I now give the floor to Cyprus, followed by Senegal.
Chair, I have the honor of speaking on behalf of the European Union and its 27 member states. Antimicrobial resistance remains a serious global health threat, transcends sectors and disciplines, and affects us all. We welcome the draft updated Global Action Plan on AMR and its important aims to accelerate and strengthen national, regional, and global responses to the AMR crisis. The updated GAP is a clear deliverable from the commitments made at the UN high-level meeting in 2024, and it provides precious guidance for addressing AMR collectively. It provides valuable guidance for us as member states in the national work. Let us continue to deliver on the commitments made in 2024 in the upcoming years. We particularly welcome that the environmental sector is now also a strong component in the Global Action Plan, along with other updates made to ensure knowledge-based global work, both across and within sectors. With the recent update, the quadripartite WHO, UNEP, WHO, and FAO can continue their important work to curb AMR. It is essential to foster innovation. We stress the importance of respecting international intellectual property rules and their key principle on voluntary technology transfer on mutually agreed terms. We can only effectively address AMR through sustained national action grounded in the One Health approach, reinforced by strong international cooperation. The EU and its member states are committed to this crucial collaboration to face collectively the challenge of AMR. Thank you.
Thank you, Cyprus. And now I give the floor to Senegal, followed by United Kingdom.
Merci. Thank you, Chair. Senegal aligns itself with the statement on substandard and falsified medical products delivered by Rwanda on behalf of the African Group. In a context marked by avoidable deaths linked to contaminated medical products and diagnostic failures with serious consequences, Senegal believes that the fight against substandard medical products is an absolute public health priority and health security priority. In accordance with guidance from Resolution EB 158/16, our country has engaged in deep structural reform of its pharmaceutical regulatory system. The adoption of Law 2023-06 has given Senegal a robust criminal framework, severely criminalizing all forms of traffic of falsified medical products, including on informal markets and digital platforms, and to establish an institutional architecture that covers the entire life cycle of medical products. Senegal achieved in 2024 maturity level 3 of the WHO's global benchmarking tool, and it has engaged with great resolve towards level 4 through a post-commercial surveillance based on risks, digitalizing import control, and progressively deploying serialization. And this action relies on a firmly multisectoral approach, mobilizing health authorities, security forces, justice, customs, health professionals, and civil society, including through establishing a national committee to combat the illicit traffic of medical products. We are aware that this fight cannot be fought alone, and so we call for stronger regional cooperation, the interoperability of traceability systems, the effective sharing of vigilance data, so that we can upscale detection technologies and risk communication strategies. We reaffirm our willingness to contribute actively to the work of the mechanism of member states and to share our experience so that we can have equitable access to safe, effective and quality medical products. Thank you.
Thank you, Senegal. I now invite United Kingdom, followed by Saudi Arabia.
Thank you, Chair. The UK supports the adoption of updated Global Action Plan on antimicrobial resistance. Revising the GAP was an important commitment that emerged from the 2024 high-level meeting to accelerate global action on AMR. Today's adoption reflects a milestone towards the implementation of the political declaration. We thank the WHO for considering UK feedback. This includes renewed ambition in strengthening governance and embedding the One Health principles. We support the revised guidance on surveillance, access and innovation, alongside recognition of the importance of sustainable financing and capacity building. There are opportunities to strengthen the GAP with clearer measures on monitoring and evaluation and explicit guidance on AMR in conflict settings. On AMR-related technologies, the UK holds that the most effective and sustainable technology transfer occurs under voluntary, collaborative partnerships that are built on trust. We would like to take this opportunity to note that we interpret the Global Action Plan to specifically encourage the promotion of technology transfer by member states. The UK remains committed to the promotion of voluntary and mutually agreed technology transfer to build trusted relationships. We remain focused on action to address antimicrobial resistance. The UK stands ready to work with the quadripartite and member states to implement the GAP. On item 12.7, the UK welcomes the report and thanks the Secretariat and member states for the continued work. We support the member state mechanism's shift to a more strategic phase and endorse the Focus 2026-27 work plan. We encourage WHO to prioritise regulatory system strengthening, better data quality and practical, adaptable tools for member states. We also underline the importance of multi-sectoral cooperation to address unregulated distribution channels. Thank you.
Thank you, United Kingdom. I now invite Saudi Arabia, followed by Thailand.
سيد الرئيس، تؤكد المملكة العربية السعودية دعمها لجهود منظمة الصحة.
Thank you, Chair. We support WHO's efforts to deal with substandard and falsified medical products. It's important to build capacities, particularly at a laboratory level, and we need to adopt technologies for early detection and to strengthen international cooperation and exchange information on medical products. With regard to the draft updated Global Action Plan on AMR, we would like to thank the Secretariat for this plan and to deal with this global health issue. We support the goals of this draft updated Global Action Plan on AMR by strengthening the One Health approach and to deal with this challenge that knows no borders. We support the quadripartite for the implementation of the Health Animal Environment Programme. They need resources in order to have a real impact, particularly in contexts where resources are limited. The Kingdom of Saudi Arabia has organized a ministerial high-level conference to focus on AMR and we did so in November of 2024, this conference led to the Jeddah Declaration with commitments to strengthen cooperation between different sectors and to share best practices in order to implement national plans. We reaffirm our commitment to work with all partners in order to combat the issue of AMR at the national, regional, and international level, so as to protect human, animal, and environmental health. Thank you.
Thank you, Saudi Arabia. I now invite Thailand, followed by Japan.
Thank you, Chair. As it remains an issue Thailand prioritizes, we would like to propose 2 points. First, we emphasize the importance of strengthening the role of NRA focal points in enhancing interagency coordination with relevant stakeholders, including private sector, in order to respond to these threats in a timely manner. Second, Thailand underscored the importance of strengthening the capacity of national laboratories, particularly in the analysis and testing of API, to enhance the ability to detect, monitor, and respond effectively to SF. Regarding AMR, we support the updated Global Action Plan on AMR. Over the past decade of implementing the GAP and National Action Plan AMR, experience from many countries, including Thailand, have demonstrated that strong government mechanisms under the One Health approach are essential for the effective implementation of AMR policy and strategies. However, the effectiveness of AMR governance at national level may fluctuate over time in response to changing policy priorities and transition in leadership, thereby constraining sustained progress toward national and global AMR targets. To address this challenge, there is a need to strengthen global governance mechanisms as a means of reinforcing and sustaining national AMR efforts. Strong global mechanisms can help maintain political commitment, accountability, multi-sectoral coordination, and sustainable financing, particularly during periods when national policy attention or institutional support may weaken. Thailand believes that strong and mutually reinforcing linkage between national and global governance are critical to sustaining momentum in addressing AMR. Thank you, Chair.
Thank you, Thailand. I now invite Japan, followed by Nigeria.
Thank you, Chair. It has been more than 10 years since the previous action plan was adopted. In light of changes in the environment surrounding AMR countermeasures, we, Japan, highly appreciate the formulation of the revised draft. Addressing AMR requires coordinated action, not only in the health sector, but across multiple related fields such as agriculture, environment, animal health, and food. Compared with the previous action plan, this revised draft promotes a broader One Health approach, and we highly value this aspect as well. It is important to ensure that progress in addressing this issue will be made with the understanding of all stakeholders, following thorough discussions, not only within the WHO, but also among other organizations of the quadripartite. Furthermore, the establishment of the Independent Panel on Evidence for Action Against AMR, as mentioned in the Action Plan, is an extremely important framework that will strengthen the scientific basis for policy making and is recognized as indispensable for countries to implement effective and sustainable AMR countermeasures. We request that the Secretariat proceed with thorough preparations and consult with Member States at an appropriate timing. Finally, AMR countermeasures cannot be achieved by a single country alone. We support a unified response by Member States based on evidence-based policies and international collaboration, and Japan remains committed to continuing its efforts on AMR countermeasures. Thank you.
Thank you, Japan. I now give the floor to Nigeria, followed by Tunisia.
Thank you, Chair. Nigeria aligns with the statement delivered on behalf of the African region. We welcome the Director General's report on substandard and falsified medical products. These products endanger lives, erode trust in health systems, and threaten universal health coverage. Through ongoing reforms, we have strengthened our response, achieved WHO Global Benchmarking Tool Maturity Level 3 for medicines and vaccines. Regulatory inspections have risen, and seizures have increased through better intelligence and inter-agency collaboration. We remain concerned about contaminated excipients and unsafe online sales. Nigeria supports the prioritized activity for 2026 to 2027, especially detection technologies, risk communication, and securing high-level excipient supply chains. We urge the WHO to continue supporting regulatory strengthening, laboratory capacity, and interoperable traceability, and we call for stronger partnerships with technology and companies. On antimicrobial resistance, Nigeria welcomes the updated Global Action Plan and commends the Quadripartite Organization. AMR remains a daily challenge across our hospital, farms, and communities. GLASS reporting and genomic sequencing have expanded, and antimicrobial use in the animal sector continues to decline. We have also begun wastewater surveillance in major cities. We call for greater support for local manufacturing and diagnostics, expanded financing, and stronger integration of climate resilience. The 5th high-level ministerial conference on AMR in Abuja, taking place in June, will advance these commitments through local action, and an invitation is extended to all. I thank you.
Thank you, Nigeria. I now invite Tunisia, followed by Italy.
شكرا سيد الرئيس. ترحب تونس بالجهود المبذولة.
Thank you, Chair. We would like to commend the efforts for the mechanism on substandard and falsified medical products. For us, it is important to face this challenge, particularly for global health, and it is important to improve surveillance at the national level and to take measures in this area. Tunisia has adopted a comprehensive approach with strict legislative laws on importing and distributing such medical products. We have also adopted laws on importing medicines to control supply chains. We also have an authority for medicines under the Ministry of Health, and we are following up on these products to see whether they are of the right quality or not. We participate in WHO mechanisms, including the WHO portal, and we have signed the Medicrime agreement. We also have a national program on surveillance after the distribution of products. In terms of the draft updated Global Action Plan on AMR, we are satisfied with this action plan, and we reaffirm our support to the resolution of the Executive Board. We call for the adoption of this decision. It is important to strengthen prevention, and we have reviewed our national plan on AMR for 2026 to 2030, so as to be in accordance with WHO guidance. We reaffirm that success in this area requires the adoption of practical approaches that can be measured while strengthening international cooperation so that we have fairer and more flexible health systems for all. Thank you.
Thank you, Tunisia. I now give the floor to Italy, followed by Mexico.
Thank you, Chair. Italy aligns itself with the statement delivered on behalf of the EU and its member states, welcomes the updated Global Action Plan on Antimicrobial Resistance 2026-2036, and commends the inclusive consultative process led by WHO in collaboration with the Quadripartite Alliance since 2015. The new plan reflects the urgency of AMR as a growing and global health, economic and development threat. Italy strongly supports the plan's One Health approach and its emphasis on prevention, including adequate infection prevention and control, strengthened regulatory frameworks and laboratory capacities, water, sanitation and hygiene, and reinforced biosecurity in agri-food systems. We particularly highlight the need to integrate the environmental dimensions of AMR and to scale up surveillance system, including through digital innovation. We support national and global commitments to sustainable financing, accountability, and research and development, alongside equitable access to existing and new tools. Italy reiterates the importance of sustainable financing and of a collaborative approach that ensures benefits for the disadvantaged and vulnerable populations. Italy remains committed to advancing coordinated multi-sectoral action to mitigate AMR and to support the effective implementation of the updated Global Action Plan. I thank you.
Thank you, Italy. I now invite Mexico, followed by India.
Gracias, President. Thank you, Chair. The updated Global Action Plan comes at a pivotal moment. The estimates contained in the document are quite clear. Without urgent action, AMR could cause up to 39 million deaths by 2050. It is proportionately affecting low and middle-income countries. And Mexico shares the concern and wishes to share the following tangible experiences. Since 2024, we have been strengthening our epidemiological surveillance system for infections in healthcare facilities with updated indicators, dynamic analysis platforms, and Sentinel unit assessments. We also share the concern in the plan on environmental surveillance and the lack of it, and we believe that it's vital to incorporate genome and environmental monitoring into national systems. On the appropriate use of antimicrobials, Mexico is regulating the sale of antimicrobials under prescription, and we have strategies for greater awareness in the agricultural sector with incentives for sustainable production beyond the medical language that is often used within the sector. Mexico authorized the use of doxycycline for post-exposure prophylaxis as a combined prevention from STDs. And that is evidence-based, but it requires monitoring mechanisms to prevent resistance associated with its use. We encourage member states to guarantee specific financing for national plans on AMR, because the plan suggests that only 10% of countries have that at the moment. Thank you very much.
Thank you, Mexico. I now invite India, followed by China.
Thank you, Chair. India aligns with the Director General's report and appreciates the progress achieved under the member state mechanism on substandard and falsified medical products despite resource constraints. India supports the MSM as a member state-driven platform for global coordination, information exchange, and regulatory strengthening, and endorses the streamlined 2026-2027 work plan. Through the Central Drug Standards Control Organization, India has strengthened market surveillance, risk-based inspections, drug testing laboratories, and digital initiatives. The Not of Standard Quality dashboard further enhances transparency through regular drug alerts. India recommends that the MSM remains practical, implementation-oriented, and focus on capacity building, while WHO should enhance technical assistance for regulatory digitalization, regional cooperation, and oversight of high-risk excipient supply chains. Chair, India acknowledges antimicrobial resistance as a major global public health challenge. India aligns with the overarching objectives of the updated Global Action Plan and is committed to implementing activities which are consistent with national priorities articulated under country's National Action Plan on AMR. India's National Action Plan on AMR 2.0, launched in 2025, adopts a One Health approach which strengthens surveillance, infection prevention and control, antimicrobial stewardship, and intersectoral coordination. India stresses that cross-sectoral actions, particularly in the environment sector, should be evidence-based, phased, and proportionate, while prioritizing urgent action to reduce the human health burden of AMR. Thank you.
Thank you, India. I now give the floor to China, followed by Kenya.
Mr. Chair, delegates, China thanks the DG and the Secretariat for the report and commends the Secretariat for its considerable efforts in coordinating the fight against the SFMPs and addressing AMR. The issue of SFMPs is becoming increasingly serious along with the globalized supply chain and growing online sales. China agrees that the global regulatory authority should strengthen international cooperation of the regulatory systems of each country within their legal frameworks. We note that the member states' mechanism continue to face challenges in terms of financial sustainability, the regulation of cross-border online sales, and capacity building for for law enforcement in low-income countries. China is ready to keep engaged in the work of member states' mechanism and suggests the Secretariat to develop a diversified and sustainable funding model, expedite developing guidance on coordinated regulation of cross-border sale via internet, and strengthen targeted technical support for low-income countries. On the question of MR, it has become a major global public health challenge. The Chinese government has attached great importance to it and established a comprehensive regulatory system over the entire supply chain, involving sectors of agriculture, environment, and health. We welcome the draft updated Global Action Plan 2026-2036, focusing on the One Health approach. But note that currently only 10% of states have allocated resources for national action plans, and that there remain significant gaps in environmental prevention and control, as well as in access to diagnostic tools in developing countries. China suggests the Secretariat to integrate the current multi-partner trust fund resources, establish a dedicated financing window for One Health approach, accelerate the development of uniform technical standards for environmental surveillance of AMR, and promote the building of a fair and reasonable technology transfer mechanism. China is willing to work with all parties jointly, safeguard the safety of global medical products, address public health challenges, and promote the building of a community of health for all. Thank you.
Thank you, China. I now give the floor to Kenya, followed by Togo.
Thank you, Chair. Kenya supports the report of the Director General and aligns itself with the statement delivered on behalf of the member states of the WHO region. On agenda item 12.7, Kenya appreciates the WHO Secretariat's report on substandard and falsified medical products. These products endanger lives and undermine trust in health systems. Kenya is finalizing its national action plan on substandard and falsified medical products and remains committed to collaboration with WHO and member states to ensure access to safe, effective, and quality-assured medical products for all. We support recommendations to strengthen regulatory systems, surveillance, detection technologies, and risk communication, and call for increased technical and financial support to build national capacity, including laboratory and traceability systems. We further emphasize the need for faster and more efficient assessment and approval processes for ML3 regulatory systems, in line with good manufacturing practices, particularly to support timely regulatory strengthening and access across the Afro region. On agenda item 12.9, Kenya reaffirms its commitment to implementing the WHO Global Action Plan on antimicrobial resistance through a strengthened One Health approach across the human, animal, and environmental sectors. Kenya has made significant progress in establishing governance structures, expanding surveillance, strengthening laboratory capacity, and advancing antimicrobial stewardship, infection prevention, and control. To accelerate progress, Kenya calls for enhanced global support for sustainable financing, capacity building, and technology transfer with a focus on strengthening AMR response systems. Kenya further emphasizes the importance of engaging communities in addressing both substandard and falsified medical products and antimicrobial resistance to strengthen awareness, ownership, and impact.
Thank you, Kenya. I now give the floor to Togo, followed by Chile.
Thank you, Chair. Togo aligns itself with a statement delivered on behalf of the African Group. We commend the Chair and the Member States of the mechanism for the progress made during their work. Togo notes the recurring challenges connected with obtaining sufficient financing to ensure the smooth functioning of the mechanism. Togo supports the recommendations designed to strengthen the effectiveness of the mechanism, for instance through action to improve member state participation and to ensure sustainable financing, and indeed other improvements. Togo has drawn up its national plan to combat substandard and falsified medical products for 2024-2027. And we have an interministerial committee, and we've been implementing the plan in spite of challenges in resource mobilization. Togo invites member states to attach greater priority to strengthening regulations to better combat the use of substandard and falsified medical products, and set up systems to clean up supply chains, nationally and regionally. Togo takes note of the report. Thank you very much, Chair.
Thank you, Togo. I now invite Chile, followed by United Arab Emirates.
Muchas gracias.
Many thanks, Chair. And Chile expresses thanks for the reports, and we welcome the work of the WHO and member states to deal with these challenges, which are inextricably linked. The aim is to protect people from unsafe medical products and contain antimicrobial resistance. For Chile, both are priorities because they have a direct impact on the patient safety and trust in health systems. With regard to substandard and falsified medical products, this is particularly important for our delegation because we are a member of the steering committee of the member state mechanism, and we will be chair in the period 2026-2027. And with that responsibility, our country wishes to reiterate its commitment to an inclusive, technical and results-based regulatory agenda, strengthening prevention, detection and response to these products. Chile thinks that it's a priority to advance with post-marketing surveillance based on risks, the detection of technologies, communication of risks and regulatory cooperation. We are concerned by the unregulated channels for sale. On AMR, we welcome the updated Global Action Plan and its strategic organization, multi-sectoral governance, the One Health approach, infection prevention, equitable access, and vaccines and diagnostics. And we believe that we need to incorporate the environmental dimension. Our country has participated actively in the review of the new plan, and we believe it's very important to update it. Chile believes that all of this needs to be dealt with in an integrated fashion. Medical products of safety and AMR are components of the same issue, and we reiterate our commitment to the reports and to the World Health Organization more generally. Thank you.
Thank you, Chile. I now give the floor to United Arab Emirates, followed by Sweden.
Thank you, Mr. Chair. The United Arab Emirates strongly
Thank you very much indeed.
Action Plan on Antimicrobial Resistance 2026-2036, recognizing AMR as a critical threat to health security, sustainable development and food security. The UAE welcomes the plan's expanded One Health approach, integrating human, animal, agriculture and environmental sectors. Our national AMR plan is supported across all ministries and sectors, ensuring coordinated cross-sectoral implementation. Since 2017, the UAE has maintained a national AMR surveillance system, enabling systematic data collection and evidence-based decision-making. AMR education is now embedded in undergraduate curricula across medicine, pharmacy, nursing, and veterinary sciences, laying the foundation for sustained behavioral shift needed to reduce antimicrobial misuse. WASH standards are implemented across all health facilities. Antimicrobial stewardship programs are in place. The UAE is committed to achieving the UN General Assembly 2024 target of a 10% reduction in AMR-associated mortality by 2030. And the collective effort this urgent challenge demands. Thank you, Mr. Chair.
Thank you, United Arab Emirates. I now invite Sweden, followed by Cuba.
Thank you, Chair. Sweden aligns with the statement made by the European Union and its member states. The global work to counteract antimicrobial resistance is a long-standing priority for Sweden. Last autumn, Sweden updated its strategy to curb antimicrobial resistance. The 10-year strategy sets long-term target and is implemented through an established intersectoral coordination mechanism. The work is guided by support from WHO, including the actionable roadmap on AMR for the WHO European region. We encourage others to use the existing support and tools to honor our shared commitments to develop, implement, and follow up national AMR action plans. A key focus of the updated strategy is prevention. This includes access to vaccines and vaccination programs, access to clean water and sanitation, infection prevention and control in healthcare and long-term care settings, but also in integration with broader public health initiatives. It is important to link AMR to other policy areas such as immunization, patient safety, and IPC. Sweden also contributes to global efforts through the development cooperation and research, including long-standing support to the AMR Multi-Party Trust Fund. We want to thank the quadripartite organizations for their work, consultations, and dialogue with member states. We thank UNEP and the other UN organizations for the consultations held throughout this last year and call for the timely establishment of the independent panel on evidence for action against antimicrobial resistance, a critical step to accelerate progress. Thank you.
Thank you, Sweden. I now invite Cuba, followed by Slovenia.
Señor Presidente.
Chairman, antimicrobial resistance is an emerging global phenomenon aggravated by the COVID-19 pandemic, and is recognized as one of the most serious health challenges of our time, and it requires urgent multi-sectoral action, including technology transfer, in order to achieve the SDGs. Cuba, as a member state, underscores the importance of continuing to advance with combating AMR under a One Health approach in accordance with the 6 strategic objectives of the new updated Global Action Plan. Since 2015, we have taken steps to adopt this approach within our governmental One Health program, within the National Health Strategy for Sustainable Development, adopted in 2021 at the very highest level in our country. The National Action Plan on AMR has just been updated and incorporates the new targets of the Global Action Plan, strengthening multi-sectoral governance, sustainable financing, and accountability to guarantee a coordinated response across sectors and levels. Cuba enjoys solid multi-sectoral governance, which has been recognized at the international level. However, we have financial limitations that make it difficult to implement and make it difficult to achieve sustainability. In spite of that, we are aware of the major public health problem of AMR, and according to the quadripartite approach, we have a national action plan through an intersectoral mechanism which will help us to improve response and strengthen control of this silent pandemic. Thank you.
Thank you, Cuba. I now give the floor to Slovenia, followed by Republic of Korea.
Thank you, Chair. Distinguished delegates, Slovenia aligns itself with the EU statement. Slovenia would like to commend DG to prioritize AMR in international cooperation and remind us all that the time has come to act to protect in future generations. It is a global problem that can only be solved if we all engage. Global surveillance system must be strengthened, and innovative solutions like linking human, animal and environmental health developed and implemented in line with the One Health approach. We therefore fully support the draft updated Global Action Plan on AMR. Thank you, Chair.
Thank you, Slovenia. I now give the floor to Republic of Korea, followed by Canada.
Thank you, Chair. The Republic of Korea would like to emphasize the importance of strengthening regulatory capacity for medical products. As a WHO-listed authorities, the Ministry of Food and Drug Safety provides professional training programs, both online and offline, for regulatory officials from developing countries through its Global Harmonization Center. Through this effort, we continue to support developing countries, enhancing their regulatory capacity, enabling them to independently monitor and address aseptic medical products. The ROK will continue to work closely with the WHO and member states to support the structural improvement to the MSM on aseptic medical products. The ROK supports the Global Action Plan on AMR 2026 to 2036. We welcome that the updated plan is aligned with the commitment set out in the UN Political Declaration of High-Level Meeting on AMR, and that it incorporates the integration of surveillance data, life cycle approach to antimicrobial management, including disposal and strengthening governance, as a distinct strategic objective. Building on the revised draft of the GAP, we have established a third National Action Plan on AMR 2026 to 2030. which promotes responsible antimicrobial use across all sectors and strengthens multi-sectoral governance. Guided by the GAP, the ROK will continue to strengthen its national AMR response and work closely with the WHO member state and partner organizations to address the global AMR crisis. Thank you.
Thank you, Republic of Korea. I now give the floor to Canada, followed by Central African Republic.
Merci.
Thank you. AMR is a growing global threat that requires coordinated and collaborative steps with a One Health approach, cooperation between member states, non-state actors, and the general population. And Canada wishes to express its gratitude to WHO and the Joint Secretariat of the Quadripartite Alliance for their considerable efforts in updating the Global Action Plan. And we believe that this will help harmonize efforts and help us to focus on areas where we can have a real impact. Canada is pleased to see that there is a greater priority attached to the environment in the updated plan, because a real One Health approach must take into account the environmental aspects of AMR. We welcome the new section on digital technologies, given their potential for strengthening AMR surveillance and the appropriate use of antimicrobials and improving data, ensuring more effective interventions. Canada welcomes the fact that this plan has 6 clear objectives with a clear roadmap. Canada is pleased to support the Global Action Plan on combating AMR, and we look forward to exchanging with partners, WHO and the organizations of the Quadripartite Secretariat for this collaboration to continue. Thank you.
Merci beaucoup, le Canada.
Thank you, Canada. And I give the floor to the Central African Republic, to be followed by Malaysia. Thank you, Chair. The Central African Republic wishes to thank the WHO Director General for his report on substandard and falsified medical products. In limited resource countries like the Central African Republic, the circulation of falsified and substandard products weakens access to quality healthcare and undermines the efforts that are being made to achieve UHC. The Central African Republic reiterates the need to strengthen national regulatory systems in order to guarantee the quality, security, and effectiveness of medical products made available to our populations. And we continue our efforts to strengthen the legal framework and the regulatory capacity so that our national control and surveillance authorities are strengthened. We also support strengthening international cooperation on data exchange and the exchange of good practices, and the establishment of effective surveillance mechanisms and early warning systems. The Central African Republic calls on WHO and financial technical partners to step up their support to countries, poorer countries especially, in order to build capacities and develop national regulatory systems on pharmaceuticals. Combating substandard and falsified medical products requires collective, coordinated, and sustainable action. And the Central African Republic remains committed to working with WHO and all member states in order to offer our peoples access to safe and quality medical products. Thank you.
Agradezco a la República Centroafricana.
I thank the Central African Republic, and I give the floor to Malaysia, to be followed by Brunei Darussalam.
Thank you, Chair. Regarding substandard and falsified medical products, Malaysia supports the streamlined 2026-2027 priorities on regulatory strengthening, supply chain integrity, and oversight of unregulated distribution channels, particularly for high-risk excipients. We remain concerned about supply chain vulnerabilities, including excipient contamination, and underscore the need for stronger technology-enabled oversight, data sharing, inspections, enforcement, and coordinated cross-border action to address online sales and informal markets. On AMR, Malaysia welcomes the DG's report and fully supports the adoption of the draft Global Action Plan on AMR 2026-2036. Malaysia reaffirms its One Health commitment through close collaboration with the quadripartite in implementing a multi-sectorial strategy. Malaysia is proud to be among the pilot countries selected for the National Landscaping Workshop to strengthen integrated AMR and antimicrobial utilization surveillance, while also advancing tiered hospital outbreak responses, updating national guidelines based on WIPRO guidance, and expanding pediatric antimicrobial stewardship nationwide. As Malaysia aligns its MyAP-AMR 2027-2031 with new global targets, we seek continued WHO and quadripartite support in strengthening digital real-time AMR and AMU surveillance, environmental wastewater surveillance, sustainable One Health financing, and evidence-based behavioral change strategies. Malaysia also reaffirms its commitment to global collaboration in combating AMR and ensuring access to safe, effective, and quality-assured medical products. Thank you.
Muchísimas gracias, Malasia.
Many thanks, Malaysia. Brunei Darussalam to be followed by Bahamas now.
Thank you, Chair. Brunei Darussalam thanks the Secretariat for this comprehensive report. On substandard and falsified medical products, Brunei's medicine safety framework integrates pre-market registration controls with post-marketing surveillance, border oversight, and risk-based market sampling. We maintain active risk communication through multiple platforms and collaborate with international authorities, including through WHO's Global Surveillance and Monitoring System. We reaffirm the importance of strengthening national regulatory system and international cooperation to address the growing risk posed by increasingly complex supply chains. Chair, Brunei Darussalam welcomes the updated Global Action Plan 2026 to 2036, particularly its emphasis on One Health, prevention-first approaches, and environmental dimensions of AMR. Our first National Action Plan on AMR established important foundations for multi-sectoral coordination, strengthened surveillance, infection prevention and control, antimicrobial stewardship, and nationwide awareness initiative. As we develop our second National Action Plan, we aim to advance a more integrated, data-driven, and system-wide One Health approach with stronger governance and implementation across sectors. We further stress that implementation pathways must remain flexible and responsive to national contexts and capacities, so that global commitments can translate into practical and equitable solutions on the ground. Brunei Darussalam reaffirms its commitment to working closely with WHO and partners to strengthen regulatory system, combat AMR, and safeguard access to safe, effective, and quality-assured medical products for all. Thank you.
I thank Brunei Darussalam and give the floor to Bahamas, followed by Ukraine.
Thank you, Chair. The Bahamas commends the WHO and the Secretariat for their continued leadership in addressing substandard and falsified medical products and antimicrobial resistance, and for advancing the work of the member state mechanism. We recognize the importance of strengthened surveillance, regulatory cooperation, and information sharing in protecting public health. Antimicrobial resistance remains a serious global threat. As a small island developing state, heavily reliant on imported medicines, the Bahamas remains vulnerable to supply chain disruptions, limited laboratory capacity, antimicrobial misuse, and the circulation of falsified and substandard medical products, including those through informal and online markets. In response, we are strengthening our regulatory framework through the development of a medical products bill and enhanced post-market surveillance systems. We continue to utilize VigiCaribe and participate actively in PAHO's pharmacovigilance network. We are also advancing antimicrobial stewardship, infection prevention and control mechanisms, and public education initiatives promoting responsible antibiotic use. Importantly, the Bahamas has enrolled in the WHO Global Antimicrobial Resistance and Use Surveillance System and is strengthening national surveillance and evidence-based decision-making. The Bahamas supports the decision and calls for expanded WHO technical assistance in laboratory strengthening, surveillance systems, risk communication, and workforce capacity building. I thank you.
Thank you, Bahamas. I now give the floor to Ukraine, followed by Tanzania.
Dear Chair, Ukraine thanks the Secretariat for the report and supports the updated Global Action Plan on Antimicrobial Resistance. IMR is one of the biggest global health threats. It affects human health, food system, economies, and health security. Ukraine supports a One Health approach, including strengthened surveillance, laboratory capacity, infection prevention and control, and responsible use of antimicrobials. Despite Russia's full-scale war against Ukraine, our country continues to strengthen work in IMR and protect the effectiveness of antimicrobials. At the same time, war creates serious additional risks. These include more infections, higher use of antimicrobials, and even pressure on health system. Ukraine are also concerned about substantial and falsified medical products, including antimicrobials. Such products threaten patient safety, reduce treatment effectiveness, and contribute to antimicrobial resistance. Therefore, stronger national regulatory system, better surveillance, and international information sharing are essential. We are also strict to important the sustainable financing, technical support, and capacity building, especially for the country affected by conflict and humanitarian crisis. Effective implementation on the Global Action Plan requires strong international cooperation and coordinating action. Ukraine highly values the coordinated role of WHO and remains committed to close cooperation with WHO and international partners in the global fight against antimicrobial resistance. I thank you.
Thank you, Ukraine. I now give the floor to Tanzania, followed by France.
Thank you, Chairperson. The United Republic of Tanzania is implementing the second National Action Plan on Antimicrobial Resistance from 2023 to 2028 under One Health approach, aligning with Global Antimicrobial Action Plan of 2015. We have established a centralized coordination mechanism to guide and oversee the implementation of AMR intervention in Tanzania. The country is implementing the 2024 United General Assembly political declaration by key targets and action by raising local funding to finance the National Action Plan, contributing to the global reduction of AMR-related death by 10% and achieving 70% utilization of antibiotics from the WHO Access Group. This is being done through strengthening AMR surveillance, laboratory capacity, and AMR detection, surveillance of antimicrobial use, strengthen infection prevention control, practice promoting immunization, improving water, sanitation, and hygiene services, and enhancing AMR awareness, education, and advocacy. We have established and implementing Universal Health Insurance Act to ensure that everyone has access to quality healthcare services, the initiative that is complemented by ongoing review of standard treatment guidelines and the National Essential Medicine List, which incorporate the WHO aware categorization for antibiotics, promoting their judicious use. In conclusion, Tanzania remains committed to supporting the fight against AMR by increasing domestic funding, accelerating the implementation, and monitoring the National Action Plan, sharing AMR data region and a global platform by strengthening collaboration with local, regional, and international AMR implementing. Having said that, United Republic of Tanzania support the adoption of Global Action Plan on antimicrobial resistance. Thank you.
Thank you, Tanzania. I now invite France, followed by Finland.
France aligns itself with the European Union statement delivered by Cyprus, and we share the concerns regarding the continued circulation of substandard and falsified medical products, and we call for a strengthening of regulatory systems, surveillance, and international cooperation. In France, the illegal medicines chain is very secure, and yet we continue to see the circulation of illegal products online, for instance, and that is why we need to have intensified surveillance activities. France welcomes the opportunity to participate actively in the member states' mechanism on this problem. With regard to AMR, France fully supports the updated Global Action Plan of the quadripartite, and we welcome the strengthening of the One Health approach, the environmental dimension, and the role of social and behavioral sciences. In that context, at the One Health Summit in Lyon in April, France launched an international pact to promote the appropriate use of antibiotics, and that brought together over 100 states around a single objective: to put an end to the inappropriate use of antimicrobials and guarantee access, sustainable access to treatments by 2030. It promotes the ban on the use of antimicrobials as growth promoters in livestock rearing, and we encourage all efforts aligned with the operational implementation of the plan, guided by WHO and the other quadripartite organizations in the years to come. Thank you.
Thank you, France. And now invite Finland, followed by Pakistan.
Thank you, Mr. Chair. Finland aligns with the statement made by EU and its member states and welcomes WHO, the second Global Action Plan on antimicrobial resistance for 2026-2036. Addressing the cross-border threat of antimicrobial resistance requires a strong One Health approach that integrates human, animal, and environmental sectors. We emphasize that effective implementation of this plan should reflect national context while prioritizing infection prevention, comprehensive vaccination program, and coordinated surveillance. Finland remains committed to the principle that antimicrobials must be available by prescription for both human and animal use. We support the 2030 global targets, including reducing antimicrobial-associated mortality, strengthening environmental waste management, and sustainable financing is critical to our collective success. Finland stands ready to accelerate the implementation of this vital framework. Thank you very much.
I thank the delegate from Finland. And now give the floor to delegate from Pakistan, followed by Brazil.
Thank you, Mr. Chair. Pakistan recognizes AMR as critical national priority and remains fully committed to the implementation of Global Action Plan on AMR with One Health approach. We are amongst one of the largest consumers of antibiotics globally, with increasing resistance even to broad-spectrum antimicrobials. The country has developed the updated National Action Plan 2.0, aligned with global guidance and incorporating lessons. The key priorities include awareness, surveillance, lab strengthening, IPC regulations, and phasing out antimicrobials for growth promotion animals and strengthening research. The country has been reporting to GLAS since 2017 through established AMR surveillance systems. The efforts are supported by establishment of National Reference Lab for AMR, performing genomic sequencing in both human and animal health sectors, with technical assistance from UK-based Fleming Fund. We emphasize the need for sustained international cooperation, technical support. On substandard and falsified medical products, Pakistan places priority on achieving WHO maturity level 3 for a functional, credible, efficient, and internationally trusted regulatory systems. For a country of 257 million, achieving ML3 is essential to ensure consistent access to safe, effective, and quality-assured medical products. Pakistan has significant pharmaceutical manufacturing base serving domestic needs, but there is a great potential to supply quality-assured medical products to cross-border markets. We seek WHO continued support to strengthen regulatory capacity, enabling RAP to effectively regulate a large market. With upcoming Gavi transition and rising vaccine cost, Pakistan prioritizing indigenous vaccine production. We see collaboration in improving capacity and competency to achieve WHO pre-qualification that locally produced vaccine meet global standards. We emphasize on.
I thank Pakistan. And now give the floor to Brazil, followed by Ireland.
Thank you, Chair. Substandard and falsified medicines threaten patient safety, erode public trust, and undermine universal health coverage. Brazil advocates for strengthening national regulatory system, enhancing international cooperation, and establishing robust surveillance and data sharing mechanisms. We urge target technical assistance for developing countries where regulatory capacity may be underfunded. A critical challenge is eradicating falsified products without stifling legitimate, affordable, generic medicines. Our regulatory framework must be precise, risk proportionate, and globally harmonized, aggressively targeting illicit networks while safeguarding streamlined pathways for quality-assured generics. Mr. Chair, Brazil fully endorses the updated Global Action Plan on antimicrobial resistance. AMR causes over 1 million deaths per year and threatens to reverse decades of medical progress. This revised plan provides a vital multi-sectoral roadmap grounded in a One Health approach, aligning with 2024 UN high-level meeting commitments. Brazil thanks the Secretariat for holding consultations on the question of technology transfer. For Brazil, meaningful tech transfer is essential for developing countries to achieve the global plan goals. We also welcome its 6 strategic objectives, including behavioral change, integrated surveillance, and focus on infection prevention. Brazil commits to embedding these priorities into our national strategy, strengthening systems and mobilizing financing, coordinated, accountable, and whole of society action is essential to preserve antimicrobial efficacy.
Time is up. I thank Brazil and invite to the floor Ireland, followed by Switzerland.
Honourable Chair, distinguished delegates, Ireland aligns with the statement delivered by Cyprus on behalf of the European Union and its 27 member states. We welcome the commitment expressed in the updated Global Action Plan to tackle antimicrobial resistance using the One Health approach. We share the expressed concern on the urgent global threat posed by AMR and how growing resistance threatens to reverse decades of progress in medicine, food production, environmental sustainability, and overall sustainable development. We support the political declaration made at the United Nations high-level meeting on AMR in New York in September 24, including the quantitative targets set out with regard to human health and the WHO's strategic and operational priorities to address drug-resistant bacterial infections in the human health sector. We agree that the updated action plan is a blueprint for addressing AMR globally. Reducing the inappropriate use of antimicrobial medicines, as well as preventing the transmission of infections and disease, is vital to stop the development and spread of resistant microorganisms. Chair, Ireland continues to deliver on its international commitments with regard to AMR, having published to date 3 national action plans. These plans have recognised the urgent and growing problem of AMR for human health worldwide and are aimed at implementing policies and actions to prevent, monitor and combat AMR across health, agriculture and environmental sectors. All 3 plans have been multi-sectoral and interdisciplinary and have adopted the One Health approach. The latest plan aligns with the 6 strategic objectives outlined in the updated action plan, and monitoring and implementation of these actions are ongoing. Finally, Chair, we look forward to the adoption of the Global Action Plan and stand ready to work with the quadripartite member states and the WHO to ensure its successful implementation. Thank you.
Thank you, Ireland. I now give the floor to Switzerland, followed by Barbados.
Monsieur le Président.
Chair, Switzerland supports the updated Global Action Plan on antimicrobial resistance, which strengthens the multi-sectoral approach and reflects recent international commitments. We promote a responsible use of antimicrobials in all sectors of care and livestock farming, as well as awareness raising and training work. Switzerland reaffirms its strong commitment to the One Health approach in accordance with our national strategy. Strengthening surveillance systems of antimicrobial resistance and use remain essential for measuring the impact of interventions and guiding decisions. Switzerland commends efforts to increase the quality and comparability of data submitted to the GLASS system. We also welcome the organization of a ministerial conference on this issue in Abuja, which marks an important step in the global mobilization given this increasing threat. It is vital to step up research and innovation, particularly for the development of new antimicrobials, diagnostics and vaccines. Switzerland also supports establishing mechanisms to follow up on progress achieved in the implementation of the action plan. These mechanisms must rely on measurable indicators in order to strengthen the accountability of member states. Thank you.
Thank you, Switzerland. I now give the floor to Barbados, followed by Germany.
Thank you so much, Chair. Barbados supports the draft Global Action Plan on Antimicrobial Resistance. We thank the Secretariat and PAHO for recognizing Barbados' investment in this area and being recently designated as a collaborating center for antimicrobial resistance through the Best DeSantis Public Health Laboratory. We strongly believe that IPC, a One Health approach, and public awareness and education are integral to resolving the issues on antimicrobial resistance. On the issue of substandard and falsified medical products, which remains a direct threat to patient safety, public trust, and integrity of our healthcare system, Barbados welcomes the continued global focus on this challenge. We acknowledge the work of the member state mechanism and the progress made through the recent outputs, including tools for addressing informal markets, involvement of working groups, and improving communication during substandard falsified product incidents. For Barbados, safeguarding public health by ensuring the quality and safety of medical products is a foundational mandate. We are currently in a transformative period as we operationalize the Barbados Medical Product Authority. This new product authority will be responsible for regulation of medical products for human use. We thank the Secretariat for the continuing involvement in supporting Barbados with respect to navigating the process of developing our own homegrown pharmaceutical industry. Thank you.
Thank you, Barbados. And now invite Germany, followed by Burundi.
Thank you, Chair. Germany aligns itself with the EU statement. AMR remains a serious global health threat. We therefore support the draft updated Global Action Plan, which strengthens national and global responses to the AMR crises. The updated GAP provides valuable guidance and measures for member states to translate into concrete action, reinforced by strong international cooperation while respecting national and international rules, which includes the key principle of voluntary technology transfer on mutually agreed terms. This is essential to foster innovation and progress to the AMR crises. AMR is a central priority for Germany's global health agenda. We therefore support further strengthening AMR governance structures together with the other quadripartite organizations. However, we remain concerned that the AMR department has several underfunded functions, such as norms and standards for surveillance, diagnostic capacities, and stewardship. This must be urgently addressed by WHO to ensure maximum impact in tackling AMR and strengthening health security. To support this work, Germany has announced an additional 25 million euros for WHO this year, with 1 million euro thereof to support the work on AMR. We expect that this additional funding is used to strengthen these important underfunded areas of surveillance, diagnostic capacities, as well as stewardship. Finally, we encourage stronger coordination of activities and country support with partners while fully leveraging the potential of the WHO Collaborating Center Network on AMR. Thank you very much.
Thank you, Germany. And now I invite Burundi, followed by Philippines.
Monsieur le Président.
Chair, Burundi would like to thank the Secretariat for the two reports presented. We believe that substandard and falsified medical products and AMR are two challenges closely linked which are a direct threat to global health security. Burundi supports efforts designed to strengthen national regulatory systems using an approach to harmonize practices. Efforts to improve the surveillance of supply chains, develop laboratory quality control capacities, strengthen regional and international cooperation against the circulation of these medicines. As part of such efforts, we are progressively developing a national complex of quality control laboratories using a collaborative approach in order to strengthen national analytical capacities, post-commercialization surveillance, and the rapid detection of falsified or substandard products. With regard to AMR, we support the updated action plan in accordance with the One Health approach. We underscore the importance of sustainable financing for low-income countries, technology transfer, harmonizing best practices, building national capacities, and equitable access to quality medicines. We reaffirm our commitment to collaborate with the WHO, other member states, and international partners in order to strengthen the security of medical products and effectively combat AMR. Thank you.
I thank Burundi and invite Philippines to take the floor, followed by Chad.
Thank you, Chair. The Philippines notes with appreciation the reports under Agenda Items 12.7 and 12.9 and expresses its gratitude to the quadripartite for their continued leadership in updating the Global Action Plan on Antimicrobial Resistance. We remain fully committed to advancing this agenda as reflected in the ongoing implementation of our third National Action Plan on AMR. The Philippines strongly supports the adoption of the updated Global Action Plan for 2026 to 2036. Its comprehensive, equity-driven, and multisectoral approach provides a robust framework for coordinated global action and for strengthening accountability across all levels of the response. To translate this plan into meaningful progress, all countries must have the capacity to implement its strategic objectives. In this regard, the Philippines underscores the importance of technology transfer, knowledge sharing, and scientific cooperation. Where countries face persistent gaps in access to AMR-related health products and technologies, the prioritized transfer of technology and know-how under relevant multilateral mechanisms should remain a practical and accessible option to support innovation and equitable implementation. We therefore support the request for the Director General to report on progress in implementing the updated Global Action Plan to future health assemblies. In conclusion, the Philippines reaffirms its commitment to working with all member states and partners towards strong, resilient, and equitable health systems capable of withstanding AMR and all other health threats. Thank you, Chair.
Thank you, Philippines. I now give the floor to Chad, followed by Mali.
Monsieur le Président.
Chair, distinguished delegates, Chad aligns itself with the statement delivered by Rwanda on behalf of the member states of the African region. Chad remains extremely concerned by the proliferation of falsified medical products and the progression of AMR, which are a double threat to public health and global health security, particularly in countries facing security, humanitarian, and persistent logistical issues. My delegation underscores the need to strengthen pharmaceutical regulatory systems, capacities for surveillance and laboratories, as well as international cooperation in accordance with the One Health approach. As part of such efforts, Chad has engaged in a process to ratify the Medicrime Convention of the Council of Europe in 2005, and we've established a national committee to combat falsified medical products in order to strengthen control across our country and to combat illicit trafficking networks. We also support the updated Global Action Plan on AMR, and we reaffirm our commitment to the sound use of antimicrobials, the prevention of infections, and equitable access to safe and quality medical products. However, these efforts require increased support. Chad calls for stronger international solidarity and sustainable financing mechanisms to assist countries with limited resources. Thank you.
Thank you, Chad. Dear delegates, I have a very short announcement to make. Today we will suspend our discussion at 12 for 1 hour. The WHO restaurant in this building will be open. And now I give the floor to Mali, followed by Netherlands.
Merci, Monsieur le Président.
Thank you, Chair. Mali aligns itself with the statement delivered by the African region on substandard and falsified medical products. This is a powerful tool for primary healthcare and UHC. To that end, deep reforms of the pharmaceutical sector are underway in Mali to strengthen control across the medical supply chain. We also welcome the updated Global Action Plan on Antimicrobial Resistance with its 6 points. This decade that is opening should not be one of repeated promises, but one that will lead to real equity in combating this silent pandemic. We are in our second action plan now, which has enabled us to establish a surveillance system for AMR. And so we need to, all data indicates that there is increased AMR, but there are multiple causes for this, and this is what we need to address in its entirety. We need equitable access and to study these laboratories and to look at communities that pay the highest price. We need to be able to rapidly detect resistant tuberculosis and research on AMR, which is the first cause of mortality, and we need greater innovation, particularly in diagnostics and the sound use of quality medicines. We also need greater regulation. We need to look for new. We need to integrate artificial intelligence and digital innovation. And we need to work on the basis of solidarity to ensure a world free of AMR. Thank you.
Thank you, Marley. I now give the floor to Netherlands, followed by Russian Federation.
Thank you, Chair. As the Netherlands, we align ourselves with the statement by Cyprus on behalf of the EU and its 27 member states. We all know it. Antimicrobial resistance, or AMR, transcends borders, but do we realize enough that it also transcends sectors and disciplines and affects all of us already today? Because AMR is not just a health issue, it is also a structural, economic and fiscal risk that weakens the foundations of our societies. Often framed as a long-term health threat with negative consequences expected by 2050, the reality is different. This crisis is already unfolding today. Framing it solely as impacting us in the future is not only outdated, but also dangerous, at times where immediate investment and action are critical to safeguard the health of humans, animals, the environment, food security, and economic stability. Despite international commitments and a growing global awareness of AMR in recent years, it remains a serious global health threat, reflecting differing capacities across low, middle, and high-income countries. Collective and national responsibility, as well as collaboration between countries supported by the WHO, is crucial. We strongly advocate for the quadripartite organizations to keep AMR as a key global priority. The 5th high-level ministerial conference on AMR in Abuja in Nigeria in June will also be key to take further steps in the fight against AMR. We can only effectively address AMR through sustained national action, grounded in the One Health approach, reinforced by strong international cooperation and collective responsibility. We therefore support the adoption of the updated Global Action Plan on AMR at this World Health Assembly, but also urge the updating, funding, and implementing of national action plans with a One Health approach. Thank you.
Thank you, Netherlands. I now give the floor to Russian Federation, followed by Nepal.
Thank you, Chair. We note that AMR is a growing global problem, and it is a serious threat to public health, food security, and global stability. We support the position of the WHO and the updated Global Action Plan on AMR. we note that Russia is implementing a strategy to prevent the spread of antimicrobial resistance up to the year 2030 on the basis of the principles of intersectoral and interdepartmental collaboration. Russia has initiated and since 2017 is implementing a regional project with the Food and Agriculture Organization of the UN to reduce the risks of spread of AMR microorganisms in food and agriculture, and we are planning to expand this and continue this project up to 2028. As part of this work, as part of the work of the Russian Reference Center of the FAO on AMR, we have established a regional laboratory network to study AMR in food and agriculture, with the participation of 17 organizations from 6 countries of the ECHO region. Russia supports further consolidation of the efforts of member states under the aegis of the WHO, and we call for ensuring sustainable financing, technical support, and development of platforms to exchange experience and data. Thank you.
And now I give the floor to Nepal, followed by Maldives.
Mr. President, AMR remains one of the gravest threats to global public health, economies, and sustainable development. It is a multi-sectoral challenge requiring urgent coordinated action through One Health approach. In Nepal alone, an estimated 6,400 deaths in 2019 were directly attributable to AMR, with another 23,200 associated with it. In response, we have developed a costed multi-sectoral National Action Plan 2024-28. We have established functional coordination mechanism, designated national focal agencies, and strengthened surveillance system, including annual reporting to global antimicrobial resistance and youth surveillance system. Mr. President, Nepal thanks the Secretariat for holding consultation on the question of technology transfer. We all welcome the updated Global Action Plan on AMR and its alignment with UNGA political declaration. However, implementation remains challenging for many countries due to limited financing, laboratory capacity, and regulatory gap. As we move ahead, we urge WHO to first strengthen One Health governance and regulatory system through normative and technical support, including bacteriology capacity building. Second, accelerate integrated AMR surveillance by supporting laboratory capacity and digital data system. Third, mobilize predictable long-term financing to help countries implement their national action plan. Nepal reaffirms its commitment to advancing coordinated multi-sectoral action on AMR and look forward to continued collaboration to safeguard global health. Thank you.
I thank Nepal. And now give the floor to Maldives, followed by Ethiopia.
Thank you, Chair. The Maldives welcomes the reports in the draft updated Global Health Action Plan on antimicrobial resistance. As a small island developing state reliant on imported medicine, the Maldives faces severe disproportionate vulnerabilities to substandard and falsified medical products. Securing our therapeutic supply chain is a matter of national priority. While we have strengthened regulatory oversight and post-market surveillance, monitoring complex global supply chains remain a critical challenge. The intersection of these two crises is where the danger lies. Weak regulatory systems and the infiltration of substandard antimicrobials directly accelerate the spread of resistant pathogens, threatening to unravel global health progress. Maldives is executing its National Action Plan on AMR through a One Health approach, focusing on integrated surveillance and stringent stewardship. However, national efforts cannot counter a borderless threat. In this regard, Maldives calls for 3 concrete actions. Targeted and sustained support. We urge the WHO and partners to provide predictable technical and financial assistance to strengthen regulatory and laboratory capacities in resource-constrained settings. Equitable access by design. Global frameworks must guarantee that the procurement of quality-assured diagnostics and essential antimicrobials is equitable, ensuring SIDS are never left behind. Operationalizing the SIDS priority. Global initiatives must move beyond acknowledging vulnerability to embedding explicit, measurable support mechanisms for small island nations. The Maldives remains fully committed to working with WHO and member states to transform this global action plan into decisive, coordinated reality. Thank you.
Thank you, Maldives. And now give the floor to Australia, followed by Ethiopia.
Chair, distinguished delegates, Australia notes the report on substandard and falsified medical products and reaffirms our strong commitment to combating the serious public health issue. The WHO member state mechanism remains essential for effective internal collaboration, ensuring that people everywhere have the access to safe and quality medicines. The mechanism plays a critical role in preventing, detecting and responding to the risks posed by substandard and falsified medical products which threaten the health and well-being of communities globally. We welcome the retention of the existing structure while streamlining working groups to enhance efficiency. Australia acknowledges the Secretariat's hard work in this space, recognising the resource constraints faced, and we support a focused and cost-effective approach to delivering the prioritised activities for 2026-27. Turning to antimicrobial resistance, Australia strongly supports the draft updated global plan on AMR and its adoption by this Assembly. We commend the WHO Secretariat for its efforts to refine this plan, including extensive and inclusive consultation. The adoption of the Global Action Plan is a crucial step towards realising the shared commitment made by all Member States under the UN General Assembly Political Declaration on AMR. I thank you.
Thank you, Australia. And I'll give the floor to Ethiopia, followed by Gambia.
Thank you, Mr. Chair. Ethiopia aligns with the African regional statement delivered by Rwanda. Ethiopia commends the Secretariat for the report on substandard and falsified medical products and commend the Steering Committee for the focused 2026-2027 work plan and the governance arrangements that preserve the intergovernmental accountability mechanism despite the challenges. Ethiopia is particularly alarmed by the emerging patterns of contaminated pharmaceutical excipients. Incidents occurring across multiple regions demonstrate that no country is insulated and that vulnerabilities in raw material supply chain translate directly into patient harm. Ethiopia has strengthened its national regulatory architecture through the Ethiopian Food and Drug Authority, which has achieved WHO Maturity Level 3, maintained ISO laboratory accreditation, and expanded post-market surveillance and digital product registration. However, there are limitations in subnational capacity, end-to-end traceability, cross-border monitoring, and on sustained regulatory enforcement. We therefore welcome the board's call for further technical and targeted capacity building support and stand ready to support coordinated regional action to align regulatory action. On agenda item 12.9, Ethiopia welcomes and supports the adoption of the updated Global Action Plan on antimicrobial resistance. Moving forward, sustained investment, research and innovation, and support for local manufacturing and regulatory system strengthening remain critical. Ethiopia calls for strengthened global commitment to accelerate the implementation of the Global Action Plan on AMR. I thank you.
Thank you, Ethiopia. And I'll give the floor to Gambia, followed by Libya.
Thank you, Mr. Chair. Under agenda number 12.9, the Gambia aligned itself with the statement on the updated Global Action Plan on AMR delivered by Rwanda on behalf of the Africa region. The Gambia welcomed the updated Global Action Plan on AMR. I reaffirm the Gambia's unwavering commitment to the fight against AMR. The comment of this updated Global Action Plan is timely as we prepare to transition from our first National Action Plan, which expires in 2027, to a more robust, evidence-driven second phase. While the global plan emphasizes a One Health approach, the Gambia has already institutionalized this through our multi-sectoral coordination committee. We recognize that AMR does not respect the boundaries between human health, animal health, and the environment. The new GAP calls for expanded antimicrobial stewardship, and the Gambia has already operationalized antimicrobial stewardship programs in our health facilities. As we begin the process of updating the AMR National Action Plan 2028-2033 period, the second global plan provides the framework needed to address these challenges using innovative strategies such as digital surveillance and genomic tracking. Under agenda number 12.3, the Gambia remains committed to safeguarding its population from substandard and falsified medical products through stronger regulations, effective enforcement, and partnership at national, regional, and global level. We take note of the report and look forward to continued engagement with the Secretariat and fellow member states to advance this critical agenda. I thank you all.
Thank you, Gambia. I now give the floor to Libya, followed by Panama.
السيد الرئيس أصحاب السعادة السيدات والسادة.
Chairman, Your Excellencies, ladies and gentlemen, Libya draws your attention to the efforts to combat substandard and falsified medical products and the issue of antimicrobial resistance. We face many challenges linked to the availability of medicines, scarcity and interrupted supply from certain countries. And those challenges have a direct impact on the continuity of care, on health expenditure, and they erode people's trust in the pharmaceutical system. That's why we call for strengthened international cooperation to reduce the cost of medicines and to improve detection mechanisms for falsified products. We must guarantee the quality of imported medical products. Countries also require technical support, particularly with regard to regulation and to quality control, traceability, and market surveillance. Libya has an active program for the surveillance of drug-resistant bacteria, and that program has identified certain strains that are of concern for public health, and it confirms the importance of strengthening laboratories, data collection, and the appropriate use of antimicrobials and infection prevention. In these areas, we need to continue to benefit from technical support, and we reiterate our commitment to the WHO and working with other member states to guarantee access to safe, efficacious and quality medicines to protect the health of our peoples for current and future generations. That can only be done with coordinated work. Thank you.
Thank you, Libya. I now invite Panama, followed by Turkey.
Gracias. Many thanks, Chair. And Panama wishes to express its thanks for the report and expresses its serious concern about the risks of substandard and falsified medical products for public health and the security of our health systems. We recognize that these products not only undermine the effectiveness of treatments, but they put patients' lives at risk. They erode trust in health systems, and they have a severe social and economic cost. We believe that it's a matter of priority to advance with three areas. Firstly, strengthen national regulatory authorities, guaranteeing strong regulatory frameworks. Secondly, strengthen international cooperation, including the early exchange of information, data, and warnings. And third, invest in technical capacity building, including surveillance strategies. We also underscore the importance of public awareness raising and the promotion of the use of these strategies to combat these products. On AMR, we recognize the threat of AMR as a critical threat for global health, and we have our own national AMR strategy under a One Health approach, promoting the link between animal, human, and environmental health. And we believe that it's vital to obtain sustainable financing for the implementation of this plan and strengthen international cooperation, knowledge transfer, particularly with support for lower resource countries. And we reiterate our commitment to working with WHO and member states to strengthen the supply of medical products that are safe and effective, and help to continue to combat AMR with coordinated action to protect the health of our peoples. Thank you.
Thank you, Panama. I now give the floor to Turkey, followed by Singapore.
Thank you, Chair. Turkey shares the concern regarding the ongoing risks posed by substandard and falsified medical products and underscores the importance of strengthening national regulatory systems and enhancing international cooperation, knowledge, and data sharing. To this end, Turkey closely follows a proactive and punitive policy regarding these products through EU-compliant standards, strict inspections, and a QR code-based digital product tracking system and pharmaceutical tracking system, together with severe penalties. At this point, Turkey is ready to share its national capacity and lessons learned with member states interested in developing both national and global capacity. Turkey welcomes the updated Global Action Plan on Antimicrobial Resistance for the period 2026-2036. In line with global health priorities, we recently prepared our National AMR Action Plan covering the period of 2026-2030. We have been taking concrete steps under the National AMR Action Plan to strengthen surveillance systems, promote the rational use of antimicrobials, prevent infections, and expand immunization programs. We underscore the critical importance of stronger international cooperation to address environmental drivers of antimicrobial resistance, including waste and wastewater management. Turkey stands ready to actively contribute to the effective implementation of the action plan. Thereby, Turkey supports the decision under the agenda item. Thank you.
Thank you, Turkey. I now invite Singapore, followed by Iran.
Chair, Singapore would like to express our appreciation to the quadripartite organizations for leading the update of the Global Action Plan on Antimicrobial Resistance. The revised GAP provides timely and renewed guidance to member states in operationalizing the commitments of the 2024 United Nations General Assembly Political Declaration on AMR, particularly through a strengthened One Health approach that further integrates the environment sector and reinforces the principle of prevention first. Strong One Health coordination and sustained international cooperation are critical to advancing the fight against the emergence of AMR, to reduce the burden of infections, and to preserve the effectiveness of antimicrobials for future generations. We therefore encourage all sectors and member states to continue working together in a spirit of partnership, solidarity, and shared responsibility to address this global challenge. In this regard, Singapore launched our second National Strategic Action Plan on AMR in 2025, reaffirming our commitment to sustain global collaboration. In our experience, One Health approaches have delivered tangible and synergistic benefits in combating AMR, enabling more integrated and effective responses. Through our One Health platform, we have enhanced surveillance, research, antimicrobial stewardship, and public awareness across sectors. Singapore remains firmly committed to continuing our close collaboration with member states and partners to collectively address the growing threat on AMR. Thank you.
Thank you, Singapore. I now invite Iran, followed by Colombia.
Thank you, Chair. Iran reaffirms that addressing antimicrobial resistance through an integrated One Health approach remains essential to protecting global health security and achieving UHC. We welcome the strengthened focus on infection prevention and control, sustainable behavior change, and environmental dimension within the updated AMR framework in line with the 2024 UN General Assembly Political Declaration. Iran remains committed to strengthening the integrated surveillance system, optimizing antimicrobial use, and advancing multi-sectoral coordination with One Health approach. However, sustaining progress requires predictable financial and technical support, particularly for countries affected by conflict, sanction, and regional instability, in which supply chain, laboratory capacity, and access to essential medicine and technologies may disrupt. Regarding standard and falsified medicine products, Iran has significantly strengthened its national regulatory system through robust pharmacovigilance, post-marketing surveillance, risk-based inspections, and implementation of track, trace, and marketing authorization systems for medicine. Iran also actively contributes to WHO surveillance platforms and promotes coordinated collaboration among health authorities, customs, law enforcement, and industry stakeholders. Chair, we believe growing challenges associated with unequal technical capacities among member states require stronger international cooperation, regulatory harmonization, technology transfer, and equitable access to detection surveillance tools. Therefore, Iran supports continued WHO efforts to strengthen governance, capacity building, data sharing, and practical implementation frameworks to effectively address AMR and substance.
Thank you, Iran. Dear delegates, I would like to remind you to please deliver your statement at normal speaking pace. Rapid delivery risk impeding clarity and accuracy in interpretation. Thank you. And now I invite Colombia, followed by Bangladesh.
Buenos días.
Good morning. Thank you, Chair. The quality, safety, and effectiveness of medical products and the capacity to respond to emerging threats constitute key elements in protecting public health and protecting trust in health systems. With regard to substandard and falsified medical products, Colombia continues to implement regulatory traceability and surveillance systems designed to protect our people and curb the risks associated with these products that can compromise treatments and health outcomes. With regard to AMR, Colombia fully supports the draft updated Global Action Plan. We believe that this type of resistance is a global threat, comparable in magnitude to other major challenges for humanity, including climate change, the effects of which require us to act urgently. The magnitude of the threat means that we need to translate global strategies into real capacities at national level, and we believe that the transfer of technologies connected with antimicrobial resistance, as we read in the Global Action Plan, constitutes a key element in strengthening local capacities, promoting research, widening access to diagnostic tools, and supporting the capacity of our health systems to prevent, detect, and respond to the threat. For Colombia, the magnitude and urgency of antimicrobial resistance requires tangible and sustainable results. This type of threat can't be dealt with only with mechanisms that are voluntary in nature, but it requires really that we translate these strategies into effective capacities because it's a challenge that affects everybody. Thank you.
Thank you, Colombia. I now give the floor to Bangladesh, followed by Indonesia.
Thank you, Mr. Chair. Bangladesh welcomes the draft updated Global Action Plan on antimicrobial resistance and appreciates the World Health Organization for advancing a coordinated global response. Antimicrobial resistance remains one of the most urgent global health and development threats. Bangladesh strongly supports a strengthened, actionable, and adequately financed global action plan grounded in the One Health approach, integrating human, animal, and environmental health sectors. Low and middle-income countries are disproportionately affected by AMR, with lack of awareness, dependence on informal practitioners for medication, and agricultural misuse remaining as common challenges. Recognizing the need for a holistic approach towards prevention of AMR, Bangladesh has undertaken initiatives for developing multi-sectoral collaboration among health, agricultural, and environmental sectors, and has undertaken awareness campaigns, targeted education programs, and surveillance efforts. WHO has been our important partner in all these initiatives. Bangladesh also continues to be a proactive contributor to the global surveillance data, as we have been regularly reporting to the global antimicrobial resistance and use surveillance system. Bangladesh emphasizes the urgent need for sustainable and predictable international financing and technical assistance to support the developing countries in scaling up research, diagnostics, and waste management. We emphasize the need for enhanced global efforts for ensuring access to affordable and quality diagnosis and appropriate treatment for infections, enhancing laboratory capacity and evidence generation to control AMR. Equally important is promoting responsible use through antimicrobial stewardship while ensuring equitable access. I thank you.
Thank you, Bangladesh. And I would like to invite Indonesia, followed by Dominican Republic.
Thank you, Chair. Distinguished delegates, Indonesia welcomes the Director General report and supports the updated Global Action Plan on antimicrobial resistance, as we know that AMR is now becoming an increasingly significant global health threat. But since bacteria doesn't respond to declaration only, we need to translate them into action. Indonesia now has established a national action plan on AMR with a One Health approach since 2017 and adopt WHO guidelines for AMR in human health with a people-centered approach in 2024. We have expanded antimicrobial stewardship programs, reinforced infection prevention, strengthened laboratories, and increased public awareness. Indonesia continues to strengthen our surveillance on AMR as well as antibiotics consumption on national level and conduct routine reports to GLAS. On substandard and falsified medical products, Indonesia supports and aligns with Director General reports and continue to strengthen regulatory oversight across the entire life cycle of health products. We have enacted in Law Number 17 of 2023 on Health and Government Regulation, Number 28 of 2024 to improve the detection of illegal and falsified products. In addition, Indonesia has achieved WHO-listed authority status for our national regulatory authority and remains committed to contributing to global regulatory strengthening through technical cooperation, information sharing, and capacity building. Thank you.
Thank you, Indonesia. I now give the floor to Dominican Republic, followed by Sudan.
Gracias, señor.
Thank you, Chair. The Dominican Republic reiterates its commitment to combating AMR and to strengthening international efforts to combat substandard and falsified medical products. We recognize that both of these challenges are growing threats to public health, patient safety, and the sustainability of health systems. We support the updated draft action plan on antimicrobial resistance promoted by WHO, and we particularly welcome strengthening the One Health approach. This promotes an integrated animal, human, and environmental health approach. We understand that current health threats require coordinated, multi-sectoral, and sustainable approaches, and we believe that it's vital to strengthen national surveillance systems, laboratory networks, and regulatory frameworks, promoting the appropriate use of antimicrobials. We need to strengthen infection prevention and control, and strengthen access to safe and effective and quality medical products. We recognize the progress that has been made by the member state mechanism on traceability and surveillance and in relation to capacity building, but there are associated risks to illegal trade on unregulated platforms and the technical challenges that many low and middle-income countries face in that regard. We underscore the key role of innovation, digital transformation, artificial intelligence, and research in strengthening the global response and improving health surveillance and accelerate evidence-based decision-making and protecting the effectiveness of antimicrobials for future generations. The Dominican Republic will continue to promote regional and international cooperation and strengthen its capacities.
Thank you, Dominican Republic. I now invite Sudan, followed by Zambia.
Assalamu alaikum wa rahmatullah. Excellencies, distinguished delegates, Sudan faces one of the most severe humanitarian specimen crises in which antimicrobial resistance is rapidly escalating within a fragile and overstretched health system. The ongoing war has severely disrupted the supply chain for medicine and laboratory reagents and reduced access to qualified healthcare workers and microbiology services. At the same time, Sudan continues to experience recurrent epidemics and infectious disease that drive increased and often irrational antimicrobial use. In the primary health care settings, studies have been shown that 71% of the prescribed antibiotics belong to the WHO watch category, frequently prescribed without adequate diagnostic confirmation. This condition created a dangerous environment for amplification and transmission of AMR from both communities and healthcare facilities. Despite this extraordinary challenge, Sudan remains committed to advancing global AMR agenda through One Health approach. Sudan has established a multi-sectoral AMR coordination mechanism and continuous implementation of its national action plan. However, Sudan cannot confront AMR alone while simultaneously respond toward displacement epidemics and health system collapse. Sustained international support is urgently needed, not only in emergency humanitarian settings, but also to the long-term investment to preserve its strength AMR system during crisis. Critical gaps remain in the laboratory infrastructure, antimicrobial susceptibility, surveillance integration, and the diagnostic workforce training and supply chain continuity and stewardship implementation. At the World Health Assembly, Sudan called for continued global support and investment in the fragile and war-affected setting. Sudan remains committed to contributing to the regional and global AMR efforts, and also we are looking ahead to Abuja 2026 to call for a stronger international partnership, increased investment in war-affecting and fragile settings. Thank you very much.
Thank you, Sudan. I now invite Zambia, followed by Nauru.
Chair, Zambia aligns itself with a statement and commends the World Health Organization for the updated Global Action Plan on antimicrobial resistance for 2026 to 2036. Antimicrobial resistance remains a critical threat to global health, food security, and sustained development. In Zambia, resistance to some commonly used antibiotics exceeds 80% in tertiary hospitals. More than 50% of prescriptions fall within the WHO watch category, while access antibiotics remains at approximately 30% below the global target. Zambia welcomes the updated Global Action Plan, particularly its emphasis on a One Health prevention-first approach, equity, and country-led implementation. Since 2017, Zambia has implemented a multi-sectoral national action plan on AMR. Zambia underscores the importance of strengthening integrated One Health surveillance systems across the human, animal, food, and environmental sector, supported by digital tools and real-time data. This should include intensified infection prevention measures such as WASH, vaccination, and biosecurity. Ensuring equitable access to quality-assured antimicrobials, diagnostics, and vaccine, alongside strengthened stewardship and regulatory frameworks, remains a priority. Zambia reaffirms its commitment to a coordinated, evidence-based One Health response to antimicrobial resistance. I thank you.
Thank you, Zambia. And now we invite Nauru, followed by Ghana.
Thank you, Chair. Nauru supports the draft updated Global Action Plan on antimicrobial resistance. AMR is a serious threat to effective treatment, patient safety, and health system resilience, particularly in small island settings where access to alternatives can be limited. We underscore the importance of antimicrobial stewardship, infection prevention and control, lab capacity, and surveillance systems that are practical and sustainable for small countries, consistent with the One Health approach outlined in the draft action plan. For small island countries, AMR responses must be realistic and implementable within limited workforce and resource settings. Building capacity in prescribing practices, public awareness, data collection, and laboratory services remain a key challenge for many vulnerable states. Nauru encourages WHO and partners to ensure that AMR action is not only globally ambitious, but also operationally realistic for countries with limited resources and workforce capacity. I thank you.
Thank you, Nauru. And now I invite Ghana, followed by New Zealand.
Thank you, Chair. Distinguished delegates, Ghana aligns with the statement delivered by Namibia on behalf of the African region on agenda items 12.7 and 12.9 on substandard and falsified medical products and antimicrobial resistance. Ghana remains deeply concerned about the growing threat posed by substandard and falsified medical products and by antimicrobial resistance, both of which undermine patient safety, weaken health systems, and threaten progress toward universal health coverage and sustainable development. These challenges disproportionately affect low and middle income countries and require urgent, coordinated global action. We welcome the continued emphasis on strengthening national regulatory systems, surveillance, laboratory capacity, and international cooperation. Ghana believes that strong and resilient regulatory authorities are essential to ensuring the safety, quality, and efficacy of medical products and to combating the circulation of falsified medicines across borders. Ghana also supports the updated Global Action Plan on antimicrobial resistance and reaffirms the importance of One Health approach that integrates human, animal, plant, and environmental health. We particularly emphasize the need to strengthen infection prevention and control, antimicrobial stewardship, vaccination, water, sanitation, and hygiene, and responsible use of antimicrobials across all sectors. We further underscore the importance of sustainable financing, strengthened data systems, research and innovation, and equitable access to quality-assured medicines, diagnostics, and vaccines. Technical support and capacity building for lower-income countries remain critical to effective implementation. Ghana reaffirms its commitment to working with WHO and partners to strengthen regulatory systems, combat substandard and falsified products, and accelerate coordinated action against antimicrobial resistance to protect current and future generations. I thank you, Chair.
Thank you, Ghana. And now I invite New Zealand.
Tēnā koutou katoa. Thank you, Chair. New Zealand welcomes the updated Global Action Plan on Antimicrobial Resistance and commends the Secretariat for advancing a strengthened One Health and implementation-focused framework. Antimicrobial resistance remains one of the most serious global health threats. We support the plan's emphasis on prevention, surveillance, stewardship and environmental action alongside clearer targets and accountability mechanisms. In New Zealand, we are developing a new national AMR strategy, jointly led by the Ministry of Health and the Ministry for Primary Industries, reflecting a One Health approach. Our work includes strengthened antimicrobial stewardship, enhanced surveillance and laboratory capability, and reduced inappropriate use across human and animal health. We are also investing in infection prevention, immunisation, and public awareness to reduce demand. Chair, AMR is a shared regional challenge in the Pacific, and addressing it is fundamental to regional health security. Pacific countries face structural constraints across surveillance, laboratory systems, and workforce capacity. These gaps must be addressed through sustained partnership. New Zealand is committed to working alongside our Pacific partners to strengthen capability, support locally led solutions, and ensure Pacific perspectives are reflected in global implementation. Colleagues, our ambition must be matched by capability. Effective implementation of this plan will require predictable and sustainable financing, practical support for countries, and access to tools and expertise. In this regard, we support strengthened international cooperation on capacity building and voluntary, mutually agreed technology transfer as essential enablers. Chair, the success of this plan will ultimately be judged by delivery. We must move with urgency from commitment to implementation. Ngā mihi nui, I thank you.
Thank you, New Zealand. Several non-state actors in official relation with WHO have requested the floor on this agenda item. According to the privileges conferred by the relationship with the World Health Organization, I have pleasure in giving the floor to the representative of World Medical Association.
Thank you, Chair. The World Medical Association recognises antimicrobial resistance as a critical threat to global health and universal health coverage. We welcome progress on the draft updated Global Action Plan and support its adoption at the 79th World Health Assembly. In line with the WMA statement on AMR, we urge Member States to strengthen stewardship across human, animal and environmental health sectors through a One Health approach. Robust surveillance, infection prevention and control, regulatory enforcement and laboratory capacity are essential alongside sustained financing. Equitable access to effective antimicrobials, diagnostics and vaccines must be ensured, particularly for vulnerable populations. The WMA emphasises workforce education and accountability to preserve antimicrobial efficacy for future generations. Thank you.
Thank you. I now give the floor to Drugs for Neglected Diseases Initiative.
Thank you, Chair. DNDi welcomes the new Global Action Plan on AMR, including the strategy's commitment to strengthen research and development and ensure equitable and sustainable access to new and existing treatments. We look forward to the inception of the Independent Panel for Evidence for Action Against AMR, which has the potential to strengthen evidence-based decision-making. AMR should be integrated into global health reform discussions to foster a comprehensive and equitable response that is the joint responsibility of countries, regional institutions, and international organizations. Finally, we note the importance of continued support for and the partnership with international health agencies addressing AMR, including not-for-profit initiatives such as GARD-P, which works to develop and make accessible antibiotic treatments for people in need worldwide. Thank you.
Thank you. And now I invite FDI World Dental Federation.
Honorable Chair, distinguished delegates, dentists prescribe approximately 10% of all antibiotics consumed by humans. Evidence shows that most of these prescriptions are unnecessary and could be reduced through effective oral disease prevention, management, and timely access to care. In this context, we welcome the recognition of quality oral health care under Strategic Objective 3 of the updated Global Action Plan, on antimicrobial resistance, and we strongly urge member states to ensure adequate funding for the implementation of national AMR action plans. FTI's Preventing AMR and Infections Task Team supports dental teams in strengthening understanding of AMR through targeted capacity building, communication, and advocacy initiatives. National dental associations can help advance all 6 strategic objectives of the action plan. Therefore, we urge member states to engage NDAs as they develop or align their national AMR plans and national oral health plans with the Global Action Plan. Thank you.
Thank you. And now I invite Global Healthcare Federation.
Chair, distinguished delegates, as a member of the private sector cluster of the UN Multi-Stakeholder Partnership Platform on AMR, GSCF welcomes the opportunity to provide input on the draft updated Global Action Plan ahead of its consideration at the 79th World Health Assembly. GSCF supports the inclusion of prevention first policy in the updated Global Action Plan. GSCF is concerned that the call in paragraph 40 to curtail over-the-counter sales does not differentiate between the regulated dispensing of non-prescription antimicrobials and the unregulated supply of prescription-only antimicrobials. We call for a rewording that clearly distinguishes these to avoid misinterpretation of the lawful, evidence-based self-care authorized by competent regulatory authorities. We also note the absence of any explicit reference to pharmacists in stewardship. We call for the inclusion of community health professionals, including pharmacists, as essential stewardship and equitable access champions in the AMR.
Thank you. And now I invite International Association for Dental Research.
IADR welcomes the continued work towards adoption of the updated Global Action Plan on Antimicrobial Resistance. Oral healthcare is an important setting for antimicrobial stewardship. Dental prescribing should be supported by oral disease prevention, infection prevention and control, and timely access to evidence-based clinical guidance. Including oral healthcare in national AMR action plans can help reduce inappropriate antimicrobial use, strengthen prescribing surveillance, and ensure equitable access. We call on member states to strengthen stewardship across all health professions, including oral health, invest in surveillance, laboratory capacity and regulatory systems, and support research for context-specific implementation. A One Health approach backed by sustainable financing is essential. I thank you for your attention.
Thank you. And now I invite International Association for Hospice and Palliative Care.
Respected Chair, AMR disproportionately affects the poorest and most vulnerable, especially people living with chronic illness, life-limiting conditions, and crisis. Access to appropriate and effective antimicrobials is also a critical component of palliative care, yet when these medicines fail or are unavailable, people often die in pain and without dignity, deepening preventable suffering. The updated GAP must recognize this connection between AMR, access to antimicrobials, and palliative care. We urge that the GAP place patient needs and equitable access to quality-assured health services at its center, including clear guidance on antimicrobial use in palliative care, access to essential medicines for pain and symptom relief, and training for healthcare workers managing infections. AMR strategies must ensure that when cure is no longer possible, people are not abandoned to suffer, and that palliative care organizations are fully included in AMR programs.
Thank you. I now invite International Pharmaceutical Students Federation.
Honorable Mesa, distinguidos delegados.
Distinguished delegates, Chair, our organization represents thousands of students around the world, and we recognize the importance of the issue of substandard and falsified medical products and the issue of AMR and the threat to public safety. We encourage member states to strengthen regulatory systems, promote the rational use of antimicrobials, and improve access to quality medicines. Young professionals and medical students play a key role in the stewardship of antimicrobials and in notifying suspect medical products and promoting safe pharmaceutical practices in communities. it's important to ensure that youth are engaged in surveillance procedures and provide equitable and safe access to all.
Thank you. And now I give the floor to International Federation of Medical Students Associations.
Esteemed delegates and honorable chairperson, we recognize AMR as a threat to routine care, surgical safety, and progress toward universal health coverage, undermining global health security, and welcome the updated Global Action Plan. We urge member states to operationalize the action plan through fully funded, accountable, and multi-sectoral national plans grounded into One Health approach. This includes national antimicrobial stewardship, surveillance systems, and equitable access to diagnostics and sustainable research. Additionally, integrating practical training on stewardship, infection prevention and control, and rational prescribing into health professionals' curricula is essential. Furthermore, youth engagement must also extend beyond consultation, and thus we ask for integrated, sustainable involvement of youth and healthcare students within national EMR and action plans. EMR action must move from awareness to accountability. Thank you.
Thank you. And now I invite International League Against Epilepsy.
Honorable Chair and distinguished delegates, addressing substandard and falsified medicines requires a multi-layered approach to protect patient safety and treatment effectiveness. These products can cause inconsistent dosing, breakthrough seizures, status epilepticus, increased toxicity, SUDEP risk, thereby all undermining the ICAP goals. We believe that three pillars are essential. One, regulatory oversight with need to strengthen national authorities, harmonize GMP, bioequivalent standards, ensure batch testing, and expand systems like the EMVS. Second, supply chain integrity by applying track and trace systems, follow the Interpol 6Ps, and create a global registry of suspect products. And lastly, third, education by informing clinicians, pharmacists, patients, and caregivers about the risks. We believe that efforts must balance safety with affordability to...
The time is up. Thank you. I now give the floor to International Federation of Pharmaceutical Manufacturers and Associations.
We welcome the timely update of the Global Action Plan on AMR, which provides a unique opportunity to take stock of progress to date and redouble efforts in addressing gaps ahead of the planned HLM on AMR in 2029. We are broadly supportive of the proposed strategic objectives and reiterate the urgent need to advance effective R&D incentives for antibiotics to address the growing burden of resistant infections. At the same time, we call on governments to work with industry in advancing sustainable access for antibiotics across different contexts, firmly grounded in a collaborative approach, including prioritizing the principle of voluntary and mutually agreed terms for technology transfer. AFMA has maintained a long-standing commitment to the issue of AMR, and we stand ready to work with the governments and other partners in advancing sustainable long-term solutions. Thank you.
Thank you. And now I invite International Pharmaceutical Federation.
Honorable Chair, distinguished delegates, substandard and falsified medical products are an unacceptable threat to global health, putting patients at risk and undermining healthcare systems. This threat is further intensified by the rapid proliferation of online drug sellers, increasing patients' exposure to SF medical products. Pharmacists are key health professionals in combating SF medical products as experts in medication management and as the final link in the pharmaceutical distribution chain. Pharmacists are uniquely positioned in educating and advising patients who have been exposed to them. Combating falsified medicine requires coordinated international action, which is why FIP works with the WHO and partners to create toolkits supporting both professional education and public awareness to prevent the use of SF medical products. Thank you for your attention.
Thank you. I now invite Knowledge Ecology International.
KAI is pleased that WHO negotiators eliminated problematic language on technology transfer in the Global Action Plan on Antimicrobial Resistance. Governments have a responsibility to regulate industry, which can include mandates on sharing access to intellectual property rights, data, biological resources, and manufacturing know-how. To illustrate state practice on this issue, KAI has published two relevant briefing notes, Briefing Note 24.2 and Briefing Note 24.3. These briefing notes illustrate the range of measures that can and are used to mandate the transfer of technology for medical products, including antimicrobial countermeasures. Thank you, Chair.
Thank you. And now I invite Medicines Sans Frontiers International.
MSF's urging member states to adopt and fully implement the updated Global Action Plan AMR and to deliver on the 2024 UN high-level commitments. In the context where MSF works, limited diagnostics and laboratory capacity undermines the ability to monitor resistance, guide treatment, and leave high-burden settings underrepresented in global data. Supporting IPC, WASH, and immunization, expanding access to diagnostics and antibiotics, and extending surveillance capacity in fragile and conflict-affected settings must be prioritized. Public and philanthropic R&D funding for diagnostics and antimicrobials must embed access and stewardship enabling conditions, including affordability, registration, diversifying manufacturing, and products for children, neonates, and crisis-affected populations. Additional unpredictable financing is urgently needed to implement these measures. Thank you.
I see one state member asking for the floor, Jamaica. The floor is yours.
Chair, Jamaica commends the WHO and quadripartite partners on the preparation of the draft updated Global Action Plan on antimicrobial resistance and the involvement of member states and stakeholders in the process. Jamaica acknowledges the urgency of this issue and fully supports the draft updated Global Action Plan, recognizing the inclusion of new evidence, the One Health approach, and sector-specific realities. Continued technical and financial support is needed for countries like Jamaica to strengthen laboratory systems, ensure equitable access to aware antibiotics, and integrate AMR strategies into primary health care and WASH efforts. Jamaica would like to recognize the work of the Caribbean Public Health Agency, PAHO, the Pandemic Fund, and the UK government in supporting the building of capacity for laboratory systems in the area of AMR. Jamaica is also partnering with UNICEF and others to assess and improve WASH in selected facilities. Efforts to update and implement the National AMR Action Plan will continue this year. A One Health Steering Committee has been established in the human health sector, and the National AMR Committee is being reinstated to support multi-sectoral coordination and advance the plan. Jamaica supports the Global AMR Action Plan, remains committed to updating and implementing the National Action Plan, and stands ready to collaborate with WHO and partners on practical regional solutions and that address AMR. Thank you.
Thank you, Jamaica. We resume with non-state actors. I'd like to invite Medical Women's International Associations.
Thank you, Chair. The Medical Women's International Association welcomes the historic progress achieved in elevating antimicrobial resistance on the global health agenda. However, high-level dialogue and expert consultations often overlook that the 4.7 million AMR-associated deaths are part of the 21 million sepsis-related deaths estimated during the pandemic year of 2021. Member states now have access to country-specific estimates on sepsis and AMR through the MICROM database developed by IHME and the University of Oxford. We reiterate that sepsis is the human face of AMR. Sepsis is the final common pathway to death. Therefore, AMR and sepsis policies and programs must be synergized. We stand ready to collaborate with member states and stakeholders to strengthen the necessary synergies. I thank you, Chair.
Thank you. And now I invite Medicus Mundi International, Network Health for All.
This statement is supported by the People's Health Movement. Factory farming is a core driver of the crisis of antimicrobial resistance. The Global Action Plan on AMR focuses primarily on behavior and neglects one of the chief contributors to AMR, the mass use of antibiotics enabling industrial livestock production, including for growth promotion and intensive farming practices. Corporations with direct financial interests in the continued overuse of antimicrobials cannot be treated as neutral partners in AMR policymaking. They have unavoidable conflicts of interest. Traditional diets worldwide did not include the enormous amounts of meat that we consume today. Factory farming has colonial and capitalist origins rooted in extraction and profit, not in feeding populations sustainably. To halt the crisis of AMR, we urgently need to decolonize our food systems and diets by supporting agroecology and food sovereignty instead of agribusiness and factory farming. Thank you.
Thank you. And now I invite MMV, Medicines for Malaria Venture.
Thank you, Chair. Anti-malaria drug resistance is part of the global antimicrobial resistance problem, and it is a threat to progress against malaria elimination. Emerging mutations have started reducing the treatment effectiveness, including in Africa, the hardest hit continent, and urgent action is needed. Medicines for Malaria Venture promotes a responsible stewardship of medicines, including multiple first-line therapies to extend the life of current medicines, and is developing with partners innovative tools, such as triple combinations, drugs with novel mechanisms of action, and transmission blocking approaches. We urge member states to support innovation, to support the WHO strategy to combat anti-malaria resistance in Africa, and we recommend the inclusion of the anti-malaria drug resistance in the updates of the Global Action Plan on antimicrobial resistance. Thank you.
Thank you. And now I invite Public Services International.
Honorable Chairperson, the people working in the industries that fuel AMR are being ignored. Meat and dairy workers across the supply chain are on the front lines of exposure to dangerous resistant pathogens, placing their health and that of their families and communities at risk. They labor under precarious conditions. AMR is not only a public health crisis, but an occupational health and labor rights issue. Yet responsibility is too often shifted onto workers themselves, rather than the industrial systems and employers that expose them to harm. What does a just transition look like for workers in the meat and dairy industries and the public authorities regulating them? Who protects workers from the risk of AMR? Who we call on member states to recognize AMR as a workplace hazard and implement strong occupational health and labor protection regulations against AMR. Thank you.
Thank you. And now I give the floor to Union for International Cancer Control.
Honorable Chair and distinguished delegates, UICC welcomes the review of the Global Action Plan on AMR and is concerned by the clinical overlap between cancer and AMR. Cancer patients remain disproportionately vulnerable to infections. So we recommend the following actions. Recognize the cancer community as a stakeholder in AMR awareness and behavioral change. Integrate AMR education into pre- and in-service training for oncology professionals. Foster collaboration between oncology and infectious diseases to monitor AMR and cancer outcomes, including infection rates and antimicrobial use. Promote standardized reporting aligned with national cancer and AMR surveillance. Strengthen IPC strategies and access to diagnostics and antimicrobials, particularly in outpatient oncology settings where cancer patients face elevated AMR risks. Include AMR in national cancer control plans and cancer care considered in NAP reviews. Thank you.
Thank you. I now invite United Nations Foundation.
Thank you, Chair. The United Nations Foundation supports the decision to approve the updated Global Action Plan on Antimicrobial Resistance. Coordinated through the Quadripartite Joint Secretariat, the plan provides an important framework for strengthened multilateral and multisectoral action on this urgent challenge. It is also an opportunity to scale proven approaches. Achieving the plan's objectives, however, will require increased political leadership and investment. AMR is among the most pressing challenges facing modern medicine, sustainable development, and human rights. Yet, progress on this agenda is too slow, and the gap between commitments and implementation could widen amid competing priorities and shrinking fiscal space. The alarming rise in resistance compels us to step into a new era of policy and partnership. We urge Member States to use this Assembly and upcoming milestones, including the ministerial meeting in Nigeria, to refocus and reinvigorate collective efforts to translate commitments to sustain financing and measurable accountability. Thank you.
Thank you. I now give the floor to Water Aid International.
Thank you, Chair. Distinguished delegates, research estimates effective prevention and control and antimicrobial stewardship can reduce the burden of AMR by 85%. Yet, 1 in 5 of all healthcare facilities lack basic water services, with women and girls bearing disproportionately higher burden of infection. Without water, sanitation, and hygiene, IPC is impossible. Investment in WASH in healthcare facilities is affordable, cost-effective, and essential to curbing the AMR crisis. AMR cannot be contained without the political will and financing required to achieve the target of 100% of countries having basic water, sanitation, and hygiene services in all healthcare facilities. If we are serious about tackling AMR, then we need to fund water, sanitation, and hygiene in all healthcare facilities urgently. Without this essential investment in basics of healthcare, we will not win this battle. Thank you, Mr. Chair.
Thank you. I now invite Wonka Association.
Distinguished Chair, honorable members, the World Organization of Family Doctors, WONCA, welcomes the global commitment to accelerate action on antimicrobial resistance. Primary care is the true frontline of antibiotic prescribing. Up to 80% of human antibiotic use occurs in the community, meaning family doctors are the primary gatekeepers of global stewardship. For us, AMR is not a distant threat. It is embedded in our daily clinical decisions. Effective stewardship requires managing the complex behavioral aspects of prescribing, including patient pressure, clinical uncertainty, and the need for rapid reassurance. Family doctors navigate these dynamics through trusted, longitudinal relationships. We combine diagnostic precision with clear patient communication to safely reduce unnecessary prescribing. WONCA urges member states to integrate AMR stewardship directly into primary care workflows, support family doctors with point-of-care diagnostics to reduce clinical uncertainty, and invest in public education to align community expectations with safe prescribing. Thank you.
Thank you. I now invite World Federation of Public Health Associations.
The World Federation of Public Health Associations welcomes the draft updated Global Action Plan on antimicrobial resistance. With 1 in 6 bacterial infections globally now resistant to first-line antibiotics, the growing crisis of antimicrobial resistance demands our immediate attention. To catalyse action, we call on member states to formally integrate young professionals into national AMR steering committees. As frontline practitioners and digitally immersed generation, young professionals are essential to driving behavioural change, innovation, and surveillance capacity required by the new Global Action Plan. We call on this Assembly to urgently adopt the updated Global Action Plan on antimicrobial resistance with use, inclusive governance, and adequately financed implementation. Thank you.
Thank you. I shall now give the floor to the Secretariat, Dr. Boeme, Officer in Charge, Southeast Asia region. The floor is yours.
Thank you, Chair. Distinguished delegates, I have the honor to deliver this Secretariat response on behalf of all WHO regions. Since the adoption of the Global Action Plan in 2015, Member States have strengthened surveillance, stewardship, infection prevention and control, and multi-sectoral coordination within a One Health framework. In the Southeast Asia region, the AMR roadmap and regional resolution adopted last year reflect strong political commitment and provide an important platform for implementation and accountability. However, progress remains uneven and not yet at the scale required. Gaps in equitable access to antimicrobials, diagnostics and vaccines, limited sustainable financing, and weak integration of AMR into health systems continue to constrain impact. Chair, the updated Global Action Plan aligned with the 2024 UN General Assembly political declaration on AMR, marks an important shift from commitment towards measurable implementation and accountability. We welcome the strong support expressed by Member States and the call for adoption of the updated plan. Strengthened global mechanisms, including the Quadripartite Joint Secretariat, the Global Leaders Group, the Multi-Stakeholder Partnership Platform, and the planned independent panel for evidence for action against AMR, provide an important opportunity to sustain political momentum and support coordinated global action. We encourage Member States to prioritize 4 areas. First, embedding AMR prevention and management within health systems and UHC efforts. Second, strengthening governance, accountability, and surveillance systems. Third, ensuring equitable access to quality-assured antimicrobials, diagnostics, and vaccines, including in fragile settings. And last, mobilizing adequate, sustainable financing for implementation and multi-sectoral support. Sustained political leadership will be essential to translate commitments into measurable impact. The Secretariat thanks Member States for their engagement and continued support. Thank you. Back to you, Chair.
Thank you very much. I shall now give the floor to Dr. Nakatani, Assistant Director General, Health Systems, Access and Data.
Thank you, Chair. Thank you very much, Member States, for sharing your efforts to safeguard public health from the substandard falsified medical products and supporting the updated Global Action Plan on AMR. These 2 agendas are closely related. Both are serious global threats on the health systems, economics, and the societies. Both reflect the same vision, where everyone can benefit from safe, effective, quality-assured medical products. There are direct links. Over half of substandard products reported to WHO are antimicrobials. These contribute to creating a new resistance. We note concerns raised by Member States regarding the continued high prevalence of the SF medical products and the ongoing need for collaboration with our technical guidance and support. We've also heard your comments on the relevance and the value and the finance needs of the Member States mechanism. We will continue to support it and implement the agreed reforms focusing the prioritized activities. Member States highlights how antimicrobial resistance already affects all countries. We must act for current and future generations. Updated Global Action Plan reinforces One Health approach. I thank Member States for sharing valuable inputs through the consultations. It points the way for mainstreaming AMR in health systems, health and food security, pandemic preparedness, climate and development agendas. As facing financial constraints, this is especially important to leverage resources and drive impact aligned to countries' priorities. Impact is our imperative. Under political declaration set ambitious targets. The updated action plan must guide investments and actions, and the independent panel will help ensure these are based on latest evidence. Thank you, our quadripartite partners, for shared work on the action plan as well as independent panel, and to support its implementation. And at the end, not least, I thank Nigeria for hosting 5th high-level ministerial meeting on AMR in next month. We look forward to advance further actions together. Thank you, Chair.
Thank you, Dr. Nakatani. Is the committee ready to note the reports pertaining to this discussion as contained in document A79/5? The reports are noted. Is the committee now ready to approve the draft decision entitled Draft Updated Global Action Plan on Antimicrobial Resistance, contained in decision EB 158/6? I see no objections. The decision is approved. This group of agenda item is now closed. Distinguished delegates, we have come to the end of our session. Committee A will reconvene at 1 o'clock. Before we break for lunch, I wish to remind you that the 7th and final plenary meeting of this Health Assembly will resume this afternoon immediately after the conclusion of the Committee A in the Assembly Hall. I look forward to seeing you at the plenary session for the adoption of the final report of Committee A and B and the closing of this Assembly. I'd like to repeat that Committee A will resume at 1 o'clock here. Thank you. Dear delegates, we should resume. We will now take up the grouping of the following agenda items under Provide Health. Sub-item 12.6, Health in the 2030 Agenda for Sustainable Development, and sub-item 12.10, Harmonization of Regulatory Approaches, Governance and Standards for Data, Digital Health and Artificial Intelligence in the Health Sector. The relevant document is A79/5. I will now open the floor for discussions. Would those delegates wishing to speak, please press the microphone button now. The microphone will open automatically when I call your delegation to take the floor. There is no need to touch the microphone button again, as this will remove you from the speakers list. I first give the floor to the delegate from Iran, followed by Congo.
Esteemed Chair, Your Excellencies, Director General, the Eastern Mediterranean region recognizes that health is a prerequisite for and an outcome of sustainable development. Achieving SDG 3 requires a strengthened multi-sectoral action and progress across other SDGs, including those related to poverty, education, gender equality, socio-economic development, and environmental sustainability. In this regard, the health in all policies approach remains essential. Countries in the region have continued to focus their effort on expanding equitable access to medical products, investing in resilient health workforce, and accelerating public health action in substance use. Persistent challenges include financial constraints, acute and protracted conflicts, environmental threats, and natural disasters, and disrupted health services, which require innovative approaches to sustain health service delivery, strengthen health system resilience, and secure sustainable financing for the health sector. We request WHO to continue supporting member states in advancing universal health coverage, strengthening health emergency preparedness and response, and health information systems. The region also aims to strengthen digital health landscapes through enhanced governance, norms and standards at all levels, while digitalizing health information systems. Our regional efforts align with the global digital transformation mandate by prioritizing governance, interoperability, and data standards. The Regional Digital Health Action Plan 2024 to 2028, released in October 2025, supports countries in adopting digital health technologies, accelerating progress towards universal health coverage and the SDGs through digital accountability. 16 countries have updated their national health information system plans, while 19 use ICD-10 and 6 are piloting ICD-11. The DHIS2 platform has expanded into fragile contexts and work continues with countries to establish national health observations for real-time monitoring. Member states have strengthened policies, expanded services, and fostered innovation, with 11 of 22 countries and territories have developing national digital health strategies or roadmaps. We urge member states to mandate private sector data integration through legal frameworks and develop interoperable digital health architecture blueprints. We call for aligned AI regulations and for institutional technical standards such as ICD 11.
Time is up. Thank you, Iran. I now give the floor to Maldives.
Thank you, Chair. Maldives has the honor to deliver this statement on behalf of the member states of the WHO Sierra region. The Southeast Asia region recognizes that data, digital health, and artificial intelligence are no longer future concepts. They are becoming essential components of resilient and people-centered health systems. Across our region, countries are accelerating digital transformation to expand access to care, strengthen service delivery, improve disease surveillance, and support progress towards universal health coverage. At the same time, we recognize that digital transformation must be guided by trust, equity, and strong governance. As digital technologies and artificial intelligence becomes more integrated into health systems, countries continue to face challenges related to interoperability, data protection, cybersecurity, ethical oversight, digital literacy, and unequal levels of infrastructure and technical capacity. Our region therefore supports stronger global cooperation on harmonized standards, governance frameworks, and regulatory approaches for data, digital health, and artificial intelligence in the health sector. However, these approaches must remain flexible and adaptable to national priorities, legal frameworks, and levels of digital maturity. Harmonization should promote interoperability and innovation while respecting national ownership and country context. We also recognize that digital transformation in health cannot happen in isolation. Foundational systems such as digital identity, secure data exchange, and trusted authentication mechanisms can enable more integrated and sustainable health services. This is especially important for small island and developing states within our region, where interoperable and shared approaches can help reduce duplication, optimize limited resources, and improve continuity of care across dispersed populations. The region further underscores the importance of protecting patient rights, ensuring transparency and accountability in AI systems, and building public confidence in the use of health data and emerging technologies. Sustainable financing, institutional capacity building, and continued technical cooperation will be essential to achieving long-term and equitable digital transformation. We appreciate the continued leadership of WHO in developing global norms and standards, convening partners, and supporting member states in translating global guidance into practical implementation. We encourage stronger regional collaboration and knowledge sharing to help countries build secure, interoperable, and people-centered digital health ecosystems. Thank you.
I thank Maldives. And now I give the floor to Democratic Republic of Congo, followed by United Arab Emirates.
Excellence. Your Excellencies, Ministers, Director General of the WHO, delegates, ladies and gentlemen, the member states of the African region of the WHO would like to congratulate the Director General for his report on the subject of sustainable development and the 2030 Agenda. Sustainable development needs robust and resilient health systems which are based on primary health care, but we face major challenges, in particular in terms of underfinancing of health systems and access to essential services. In 2026, we have invested a large amount of our work into the area, and MPOX showed many confirmed cases which showed that we needed to emphasize our primary healthcare services. The countries in the region welcomes the efforts of the WHO to help build capacity and strengthen health systems. The Africa region would also like to welcome the work for building primary health care and digital health to favor the sharing of good practice amongst member states. So we'd also like to thank the WHO and its partners for the constant support for African populations. Thank you very much.
Thank you, Congo. I now give the floor to United Arab Emirates, followed by Dominican Republic.
Thank you, Mr. Chair. The United Arab Emirates reaffirms its strong commitment to SDG 3 and to advancing health and well-being for all through resilient, integrated health systems, with the digital health and artificial intelligence as a key transformative drivers of performance, equity, and sustainability. Nationally, the UAE has embedded SDG 3 across its development agenda, demonstrating consistent progress in universal health coverage, maternal and child health immunization, communicable disease control, and the health system capacity. The UAE continues to strengthen primary health care, preventive services, early detection, and NCD response. The UAE has developed a national policy for smart health services and AI, guided by priorities on governance, partnerships, expanded digital health and AI use, smart infrastructure, workforce skills, cybersecurity, ethics, innovation, research, and health information system. In digital health, the UAE has built a future-ready ecosystem anchored in the Riayati Interoperable Health Records Platform, a national health data warehouse enabling real-time decision-making and AI-driven solutions spanning clinical support, genomics, and preventive care, all underpinned by the Federal Personal Data Protection Law and the Federal Law on the Use of Information and Communication Technology in the Health Fields. The UAE calls for global harmonization, ensure that digital health benefits reach all populations equitably. The UAE remains committed to working with WHO and member states to accelerate progress toward SDG 3 for all. Thank you.
I thank United Arab Emirates, and now give the floor to Dominican Republic, followed by Barbados.
Gracias, señor presidente.
Thank you, Chair. The Dominican Republic takes note of the reports linked to the 2030 Agenda for Sustainable Development and the harmonization of regulatory approaches, governance standards for data, digital health, and artificial intelligence in the health sector. These have a strategic joint goal to ensure that we have more resilient, integrated health systems that can respond to the growing global health needs. We understand the fact that there is not sufficient development, in particular when it comes to universal health coverage, NCDs, maternal and infant health, and capacity building in health systems. We think that this needs that we have to, first of all, strengthen governance of information and digital capacities in the health sector. So we call on, and we have a national program which is based on ensuring we have interoperability of databases and the use of data so we can have digital health systems. And we have a national architecture for health which integrates information systems. We also have strategic allies who are helping us progress so that this year we can have our first proof of concept of interoperability and working on digital health. This will help us to ensure that we validate the safe interchange of data and that we have a single health, digital health portal. This means that we are not just seeing them as digital tools, but strategic tools which help us to ensure that we have universal coverage and we reduce health inequalities. Thank you very much.
Thank you, Dominican Republic. I now invite Barbados, followed by Japan.
Mr. Chair, Barbados thanks the Secretariat for this comprehensive report and fully aligns with its assessment that the world remains significantly off track to achieve the health-related sustainable development goals by 2030. For small island developing states like Barbados, confronting an aging population, a high burden of non-communicable diseases, and constrained fiscal space, the consequences of this shortfall are not abstract. They are felt in limited health budgets, workforce pressures, and a climate of vulnerability that compounds every systemic challenge. At the national level, Barbados is making targeted investments in prevention-focused primary care, chronic disease management, and cancer screening. We are integrating health promotion more systematically into routine polyclinic care and advancing the digital transformation of our health system. Barbados is deeply concerned, however, about the disruption to demographic and health surveys across more than 40 member states. These instruments are critical for monitoring SDG progress, and their suspension, driven by reductions in official development assistance, exposes a fragility that SIDS cannot afford. Barbados calls on the Secretariat to develop financing mechanisms and technical cooperation models genuinely responsive to the vulnerabilities of SIDS, flexible, predictable, and concessional, and to prioritize shared digital platforms and pooled technical expertise to strengthen regional health data resilience. Thank you.
Thank you, Barbados. And now give the floor to Japan, followed by Chile.
Thank you, Chair. We take note with concern that many health-related SDG targets remain off track in achieving the 2030 agenda. At a time when global health faces unprecedented challenges, it is essential to return to the fundamental principle of the SDGs, leave no one behind, and to reinvigorate collective momentum among member states. In this regard, Japan reiterates the critical importance of achieving universal health coverage as a cornerstone for attaining health-related SDGs. We commend WHO's continued and tireless efforts in advancing the SDGs. Japan remains committed to supporting developing countries through the UHC Knowledge Hub established in collaboration with WHO and the World Bank. The UHC Knowledge Hub facilitates knowledge sharing on UHC and strengthens the capacities of both health and finance authorities, including those in low and middle-income countries, with a view to achieving UHC by 2030. Japan will continue to contribute to international efforts towards the realization of UHC. Japan also underscores the importance of promoting digitalization in the health sector, including the use of artificial intelligence, in particular in small island developing states, as well as in rural and underserved areas. The deployment of AI, supported by robust data infrastructure and sound governance frameworks, has a significant potential to improve the efficiency of health systems. Alongside global efforts, it is essential to establish country-level implementation frameworks tailored to national contexts, ensuring data governance, transparency, accountability, and due consideration for human rights and equity. Japan stands ready to support global efforts in.
Thank you, Japan. I now give the floor to Chile, followed by Papua New Guinea.
Gracias, señor presidente.
Thank you, Chair. Chile welcomes the report presented and values the work of the WHO. Our country recognized that progress towards the SDGs continues to be insufficient on a global level. From our national experience, we have driven policy aimed at strengthening public health and improving opportunities for care. We would like to highlight the recovery of the relevant population health indicators and the implementation of a universal immunization of nirsevimab for children with RSV and the oncological alert plan, which has helped to reduce waiting times. This shows that innovation, when it is aimed at with criteria of equity and evidence, can be helpful. In this context, Chile believes that the digital transformation of health can be seen as a facilitating condition, which helps to have more people-centered, resilient, and integrated health centers. Health data interoperability, digital health, and artificial intelligence must contribute to strengthen primary care, continuity of care, health surveillance, and ensuring that. Chile considers its priority to work with information systems that are sustainable and interoperable with common standards that can identify and secure data. So we believe that it's very important that we can safely trace people and that we really value the role of WHO in facilitating the convergence of international standards so that we can progress with digital capacity. Thank you.
Thank you, Chile. I now give the floor to China, followed by India.
Thank you, Mr. Chair, dear delegates. China supports the WHO's work in these two areas, and we hope that countries will develop medium and long-term strategic plans in the health sector to improve, achieve, and maintain health. We should make full use of cutting-edge technologies such as artificial intelligence. We should also strengthen health data and information systems and advance the achievement of the health-related sustainable development goals by 2030. Regarding the implementation of the Global Digital Health Strategy, China hopes that the organization will strengthen cooperation among member states in areas such as cutting-edge technology, R&D, open data sharing, capacity building, and privacy and data security protection. Efforts should be made to promote innovation in artificial intelligence application scenarios, strengthen digital health infrastructure, regulatory standards, data resources, industrial development, and security safeguards, and advance cross-border sharing and application of AI corpus. China is ready to engage in more international cooperation on the application of AI in pharmaceutical regulation to build a global regulatory framework that balances safety and innovation, while establishing a multi-stakeholder coordination mechanism and avoiding technological barriers so that digital technologies can better serve global medicine regulation and help safeguard the safety of public medication. China has always upheld an open and mutually beneficial approach, actively share its experience in health development. We are willing to work with all countries to accelerate digital health development and new infrastructure construction, thereby promoting global cooperation in digital health. Thank you, Mr. Chair.
Thank you, China. I now invite India, followed by France.
Thank you, Chair. India appreciates the WHO's leadership in presenting these critical agendas. As we strive towards the health-related SDGs by 2030, India has made steady progress across several indicators. Notable gains in maternal and child health, life expectancy, and service coverage underscore our commitment to equitable progress. To align sub-national strategies with global commitments, we have institutionalized SDGs within our program implementation plans. Furthermore, the PM Ayushman Bharat Health Infrastructure Mission is actively bridging critical gaps in infrastructure across rural and urban settings. Chair, India believes robust digital and data foundations are prerequisites for safe, effective health systems. Ayushman Bharat Digital Mission demonstrates the transformative potential of interoperable, citizen-centric digital public infrastructure for health. This ecosystem is supported by a comprehensive governance framework for establishing privacy, consent, and responsible data processing through the Digital Personal Data Protection Act 2023. India has launched the National Strategy for Artificial Intelligence in Healthcare, SAHI, for the responsible deployment of smart health initiatives to strengthen the country's AI ecosystem. To accelerate progress, India emphasizes prioritizing high-burden districts and vulnerable population and need for digitally enabled health systems capable of responding to emerging global health challenges. This calls for strengthening the commitment towards advancing safe, equitable, and people-centric digital health systems and sustainable financing mechanisms. India reaffirms its commitment to support the harmonization of regulatory approaches, governance framework, and standards to further strengthen the health framework. Thank you.
Thank you, India. I now invite France, followed by Panama.
Je vous remercie, Monsieur.
Thank you, Chair. I have the honor to deliver this statement on behalf of the member states of the Foreign Policy and Global Health Initiative, South Africa, Brazil, Indonesia, Norway, Senegal, Thailand, and France. As our group marks its 20th anniversary, we reaffirm our shared commitment to advancing global health through multilateral cooperation, equity, and solidarity, and doing so to reinforce and support WHO's central role in the global health architecture. Since the adoption of the 2007 Oslo Ministerial Declaration, we have sought to promote a vision of global health as both a fundamental human right and a key pillar of sustainable development, peace, and security. Today, the global health landscape is confronted with complex and interconnected challenges. Reduced development assistance, demographic and climate-related pressures, constrained fiscal space, growing health needs, protracted conflicts, and persistent economic disparities continue to place considerable strain on health systems. While important progress has been achieved in recent decades, the international community remains off track to meet several SDGs. In this context, the group remains a steadfast advocate of policy continuum, ensuring that our work in Geneva and New York directly contributes to the achievement of the SDG and GPW 14. Under the leadership of Brazil, we tackled diseases by social determinants of health. And our initiative this year is going to be working towards the implementation of the One Health approach, which has been highlighted in importance because of the recent outbreaks. It is only through strong international cooperation, coordinated action, following the principles of inclusivity, equity, and solidarity, we will be able to protect and advance the health and well-being of present and future generations.
Thank you, France. And now I invite Panama, followed by Republic of Korea.
Gracias, señor presidente.
Thank you, Chair. We welcome the presentation of the report and would like to reaffirm our commitment to the 2030 agenda, saying that health is a goal in itself, but also a motor for sustainable development. We agree that the progress towards SDGs needs solid, resilient, and people and primary care-centered health systems. For us, the coverage of essential services, primary care, and systems for data which improve decision-making and follow-up of SDGs is essential. We agree with the need to harmonize regulatory approaches, governance, standards for data, digital health, and artificial intelligence in the health sector to avoid fragmentation in systems and to have interoperability across systems. This is a key opportunity to strengthen health systems. Our country has been developing a progressive agenda for digital transformation by implementing remote consultations across more than 130 health centers and using drones in hard-to-reach areas, as well as using artificial intelligence in remote triage and also using it for mammogram analysis. We are aiming to have a fairer, more sustainable and health system. Thank you.
Thank you, Panama. I now give the floor to Republic of Korea, followed by Botswana.
Thank you, Chair. Regarding the item 12.6, the Secretariat's report describes a sobering reality that the world is off track to meet the SDGs. Cooperation between WHO and member states is more urgent than ever. In the area of protecting health, the Republic of Korea has consistently maintained a high level of performance under the IHR State Party Self-Assessment Annual Report. We also achieved world-leading results in the joint external evaluation conducted last year. As the report notes, sound policy begins with reliable health data. Accordingly, in cooperation with the WHO WIPRO, the Republic of Korea is supporting member states in assessing their health information systems. We are also helping to integrate AI into health management information systems. Through the Dr. Lee Jong-wook Fellowship Program, we continue to strengthen the capacity of health officials and medical professionals from the partner countries. Turning to item 12.10, the Republic of Korea supports the vision outlined in the Secretariat's report. We deeply agree that the digital transformation is essential for addressing global health challenges. Furthermore, through the discussions on the Global AI Hub with the WHO and other international organizations, the ROK stands ready to share our experience in data standardization and interoperability with fellow member states. We emphasize that ethical principles and equity should be embedded from the early stage of digital health development. And we also call for offline-first solutions. These solutions are necessary for environments with limited communication infrastructure, such as island nations. The Republic of Korea will remain a reliable partner in achieving SDGs and supporting the WHO leadership in digital health. Thank you.
Thank you, Republic of Korea. I now give the floor to Botswana, followed by New Zealand.
Botswana endorses the statement delivered on behalf of the African member states.
We recognize that digital health, artificial intelligence, and strong health data systems are essential enablers for resilient, responsive, equitable, and people-centered health systems. We commend the WHO's leadership in advancing harmonized regulatory approaches and global standards to support safe and ethical digital transformation. In Botswana, we continue to strengthen digital health systems as part of a broader health sector reform, with a focus on improving interoperability, strengthening governance frameworks, and enhancing the quality and use of health data for evidence-based decision-making. Botswana particularly supports WHO's emphasis on strengthening national ownership of health data and digital governance systems to ensure sustainability and context-appropriate innovation, developing harmonized regulatory and ethical standards for artificial intelligence in health, including validation, benchmarking, and oversight mechanisms that protect patients and build public trust, ensuring equity remains central to digital transformation. Botswana welcomes the decision to extend the global strategy on digital health. We support this extension as it provides member states with critical additional time to consolidation implementation efforts, strengthen foundational digital health systems, and draw lessons that will meaningfully inform the development of the successor strategy. So, as the WHO develops the draft global strategy on digital health, Botswana calls for a practical and implementation-focused framework that builds on the progress made during the extended strategy period. I thank you.
Thank you, Botswana. And now I'll give the floor to New Zealand, followed by Nigeria.
Tēnā koutou katoa. Thank you, Chair. New Zealand welcomes the Director General's report on harmonisation of regulatory approaches, governance and standards for data, digital health and artificial intelligence in the health sector. We support WHO's direction to treat health data, information systems and AI as interconnected pillars of digital transformation and to prioritise standards and interoperability so that investments translate into safer, more effective care. We support WHO's focus on ethics, regulation and bias mitigation to protect public trust and promote equitable innovation. In New Zealand, our approach to precision health technologies such as AI is guided by principles that they must be accessible, safe and effective, accountable, good value, equitable, and implemented transparently. Key actions underway include a national AI and algorithm expert advisory group to strengthen governance and assurance for AI initiatives, investing in stronger digital foundations through a 10-year health digital investment plan, and the establishment of the Centre for Digital Modernisation of Health to coordinate critical investments. Progressing regulatory modernisation through the upcoming Medical Products Bill. New Zealand encourages the WHO to continue focusing on the 2028 to 2033 strategy on interoperability, practical implementation support, and regulatory and workforce capacity building to help countries move from siloed initiatives to resilient, trusted digital health systems. We also urge faster progress on linking ICD-11 and SNOMED CT to enable seamless data use across the health data lifecycle. While early signals following the World Assembly 76 were positive, visible progress has been limited.
Thank you, New Zealand. Time is up. I now give the floor to Nigeria, followed by Mexico.
Nigeria aligns with the statement delivered by the Democratic Republic of Congo on behalf of the African region. We have passed the midpoint of the 2030 agenda, and the picture is sobering. Around 4.5 billion people still lack access to essential health services. This is compounded by the financial pressure. In 2025, official development assistance fell by about 23%, the largest annual decline on record. Nigeria therefore calls for renewed acceleration towards the health-related goals anchored in primary health care and universal health coverage, in stronger domestic financing, and in the principle of leaving no one behind. We must progress at the country level, even as the financial and environment tightens. On digital health and artificial intelligence, digital transformation is not optional for Nigeria. It is essential to our health system and to universal health coverage. We have adopted a national digital health strategy, enacted the Nigerian Data Protection Act, and scaled disease surveillance tools nationwide. As WHO prepares the next global strategy, Nigeria highlights these priorities: stronger foundational data system and interoperability, sound regulatory and ethical governance of artificial intelligence, equity at the core of precision medicine, investment in the digital and AI workforce, and sustainable financing to reduce fragmentation. We further emphasize the importance of strong regional consultation so that the strategy reflects diverse contexts. Thank you.
Thank you, Nigeria. And now I invite Mexico, followed by Norway.
Gracias, Presidente.
Thank you, Chair. Mexico maintains a firm commitment to the UNAIDS 95 goals and bringing an end to communicable epidemics by 2030, recognizing that there are still territorial inequalities and social inequalities that limit effective access to prevention, diagnostics, and integral care. The response to HIV and other communicable diseases must be approached on the basis of human rights, equity, and social determinants to ensure that we have stigma and discrimination-free services. In order to prevent NCDs, we agree with the guidelines for healthy school meals, the healthy diet and sustainable projects such as the Live Healthy, Live Happy programs. In the area of digital health, technological transformation must take place under the principles of equity, technological sovereignty, and protection of personal data without becoming a new factor for exclusion. Mexico is driving this agenda through the digital health reform, which was published in January 2026, with platforms such as Salvar, which give us real-time follow-up of the HIV care cascade and viral suppression, which ensures that there is confidentiality for populations that historically were stigmatized. We call on progress within the achievement of harmonized international frameworks which strengthen interoperability and the ethical use of artificial intelligence in health, respecting sovereignty of states and national legislation. Thank you.
Thank you, Mexico. I now give the floor to Norway, followed by Russian Federation.
Norway is concerned by the lack of progress on SDG 3, and more specifically on UHC, PHC, protection from out-of-pocket expenditure, and lack of progress on coverage of basic services like vaccination and reproductive, maternal, and child health services. Norway is, however, encouraged by significant progress in health information systems in the past 6 years and encourages the WHO to support countries and continue to enhance capacity, respond to the reduction in household surveys, and to responsibly and ethically use AI for advances in data analysis and timely response. Norway supports the WHO's consolidated approach to digital health, data governance, and AI. We emphasize the need for globally aligned regulations in this field, starting with the Nomenclature Regulation of 1967 and the WHO FIC code systems, promoting collection of global data and common digital foundations. Norway supports interoperability, ethical safeguards, and equity as core pillars of the upcoming 2028-2033 Global Digital Health Strategy. Thank you.
Thank you, Norway. I now give the floor to Russian Federation, followed by Philippines.
Thank you, distinguished chair. Colleagues, digital health plays a key role in achieving comprehensive health coverage, increasing the quality, accessibility, and effectiveness of medical support. Russia registered 54 medical devices that use AI technology. In 2025, the Ministry of Health, with the participation of the scientific community, developed a code of ethics for the use of AI in health. This regulates ethical aspects of the development and use of these technologies. To ensure interoperability and unity in digital decisions, Russia has a federal register of normative guidelines in the field of health. These have unified classifiers, guidelines, and nomenclature. We're introducing unified standards for electronic medical documents, which facilitates safe exchange of medical information, increasing the quality of data and the development of a unified digital contours. We are working on standardizing and harmonizing medical developments with AI in the framework of the broader Eurasian Partnership, and we are training medical staff. With respect to AI, we need to base our work on protecting personal data, observing ethical standards and safety of patients. We're prepared to continue professional dialogue and an exchange of experience at the WHO platform. Thank you.
Thank you, Russia. I now give the floor to Philippines, followed by Malaysia.
Thank you, Chair. The Philippines notes the report on health in a 2030 Agenda for Sustainable Development and affirms the urgent need for stronger health systems, wider primary health care, access, sustainable financing, and better use of data. As we approach 2030, member states must make deliberate choices to focus on high-impact interventions, safeguard essential health services, and ensure that limited resources are used efficiently, financially, and technically to improve health outcomes. For countries with decentralized or devolved health systems, aligning national priorities with local implementations remains a key challenge. This requires accountability mechanisms, predictable and sustainable financing, and strong health information systems that support timely decision-making, resource allocation, and evidence-based policy. On item 12.10, the Philippines underscores that harmonized regulatory approaches for data, digital health, and artificial intelligence are essential to achieving the SDGs. Trusted, interoperable, and ethically governed digital systems are critical for improving service delivery, strengthening surveillance, and enabling evidence-based policy. We support global efforts to establish standards that uphold privacy, safety, and equity in the use of emerging technologies. We encourage WHO Secretariat to continue supporting member states in translating SDG and digital health commitments into implementable national actions, particularly through guidance on priority setting, monitoring, country data systems, and structured exchange of practical lessons across regions. The Philippines remains committed to advancing efficient, equitable, and accountable health systems as we collectively strive towards the 2030 targets. Thank you.
Thank you, Philippines. I now give the floor to Malaysia, followed by Papua New Guinea.
Thank you, Chair. Malaysia reaffirms its commitment in accelerating progress towards the health-related targets on the 2030 Agenda through a comprehensive and equity-driven approach. In light of insufficient global progress, we underscore the need to strengthen PHC as the foundation of health for health promotion, prevention, early detection, and integrated person-centered care, alongside intensified action on key NCD risk factor and strengthened legislative and regulatory framework. We emphasize advancing UAC as a key accelerator of SDG health targets, including enhancing financial protection and ensuring equitable access to quality services. This is supported by sustained provision of subsidized public health care and efforts to strengthen sustainable financing mechanisms to reduce financial barriers to care, while promoting public-private collaboration. We also highlight the importance of reaching vulnerable and underserved populations to ensure that no one is left behind. We recognize the importance of strengthening health system resilience including preparedness, surveillance, and response capacity for emerging health threats and climate-related risk, and has achieved a high level of capacity in implementing core international health requirements. Similar to many other member states, Malaysia is working to address off-track in the SDG indicators, particularly NCDs that are closely linked to the social determinants of health. To benefit all member states, we request WHO's assistance in developing structured platform for sharing knowledge and proven best practices. It is also vital to strengthen country-led health information system and support the responsible use of digital technologies to enhance data quality and decision-making. Malaysia remains committed to collective action to advance equitable and sustainable health outcomes. Thank you.
Thank you, Malaysia. Now I give the floor to Papua New Guinea, followed by Poland.
Thank you, Chair. I have the honor to deliver this statement on behalf of the Pacific States on May 20th. The UN General Assembly adopted the resolution endorsing the ICJ advisory opinion. This marks a historic step forward for climate justice and multi-sectoral action. It sends a powerful message to the world. Climate change is a direct and unprecedented threat to health, human dignity, and survival. The states have legal right, legal and moral obligation to act. For the Pacific, climate change is the single greatest threat to health and sustainable development. It compounds our triple burden of communicable diseases, NCDs, and health impacts of climate change. Our countries operate in a highly vulnerable economic context with limited fiscal buffers and health workforce constraints. These structural vulnerabilities amplify our exposure to external shocks, including climate-resilient disasters, outbreaks. These outbreaks, global inflation, and fluctuations in development financing. The multidimensional vulnerability index reinforces the need for global system to better recognize these structural vulnerabilities of small island developing states to improve access to sustainable financing for climate-resilient health system. With the multi-sectoral health system under increasing strain, health security depends on stronger international cooperation, collective action, predictable financing, and target support to build a climate-resilient and sustainable health system and achieve a health-related SDGs. We recall the historic adoption of the Global Action Plan on Climate Change and Health 2025-2028. Its effective implementation is important, consistent with 2050 strategy for the Blue Pacific continent and the Healthy Islands Vision 2050. Pacific people can live healthy and prosperous lives only if we have climate-resilient health systems supported by a skilled and adequately resourced health workforce. We call on WHO and development partners to provide predictable, accessible, and sustainable financing to support the implementation of the Global Action Plan and to work with regional mechanisms, including the Pacific Network for Health and Climate Change, to strengthen regional action and capacity building. Building resilient and low-emission health systems, including true sustainable and renewable energy solutions for health facilities, is critical to ensuring continuity of care during disasters and to advancing our collective ambition to limit global warming to 1.5 degrees Celsius. This year's Pacific pre-COP31 provides an important opportunity to place health at the center of climate action and to strengthen recognition of the profound and disproportionate impacts of climate change of the health and well-being of Pacific. I thank you, Chair.
Thank you, Papua New Guinea. I now give the floor to Poland, followed by Togo.
Thank you, Chair. On item 1210, Poland welcomes this discussion and the clear message from the Executive Board that stronger harmonization of governance and standards for data, digital health, and artificial intelligence is essential for resilient and trustworthy health systems. Digital technologies shape care, decisions, and trust. But technology alone is never the answer. Technical progress has no value in itself. Its value depends on what it serves. For Poland, health data and robust health information systems are the foundation, while artificial intelligence must remain a tool built on reliable, interoperable data and governed by clear ethical and legal frameworks. Fragmented systems undermine scale, safety, and trust. Addressing them must be a priority. We strongly support human-centered, transparent and safe use of AI in health, with strong data protection and meaningful human oversight. Trust for patients and health professionals alike is not automatic. It is built through good governance. Looking ahead to the next WHO Global Strategy on Digital Health, Poland supports a strong focus on digital public infrastructure, interoperability, and practical support for countries at different levels of digital maturity, so that technology truly serves people and healthier societies. Thank you.
Thank you, Poland. I now give the floor to Togo, followed by constituency statement.
Thank you, Chair. Togo aligns itself with the statement made by the DRC on behalf of the African Group. Togo is making progress towards the achievement of Target 3 of the SDGs. We've been working on insurance, inter alia, and we're continuing to improve health coverage with new hospitals and specialized hospitals. We have technical efforts and the recruitment of 2,000 more professionals each year. On 12.6, Togo recognizes that 12.10, digital health is an indispensable operational need to improve the quality of care and the performance of our information and health systems. Togo has undergone a high-quality data audit according to the ERDQA framework. We also have an eRef health project in the Kara region, which digitalizes systems for reference and counter-reference of patients. We call for greater cooperation to draw up common standards for interoperability, for shared benchmarks on data quality and ethical frameworks for AI in health, as well as robust mechanisms for cybersecurity. We take note of the report and we support the adoption of the proposed measures. Thank you.
Thank you, Togo. Two constituencies of non-state actors in official relations with WHO have requested the floor. I will give them the floor alternating from time to time with member states, according to the privileges conferred by relationship with WHO. I have pleasure to give the floor to the constituency of non-state actor presented by Women in Global Health.
Thank you, Chair. The statement is delivered on behalf of Women in Global Health and co-signed by the Center for Reproductive Rights, International Council of Nurses, Multiple Sclerosis International Federation, Water Aid International, World Heart Federation, International Diabetes Federation, World Organization of Family Doctors, Health Action International, World Federation of Hemophilia, Medicines for Malaria Venture, Global Health Partnerships, International Alliance of Patients Organizations, World Vision International, World Federation of the Sporting Goods Industry, Site Savers, Pasteur Network, International Hospital Federation, World Federation of Chiropractic, the Global Diagnostic Imaging Healthcare IT and Radiation Therapy Trade Association. We recognize the world is not on track to achieve the health and gender-related sustainable development goals by 2030. As member states shape the post-2030 framework, this is a critical moment to place health, equity, and care systems at the center of sustainable development. Health is a fundamental to economic and social resilience, gender equality, climate adaptation, and well-being. Widening inequalities, dwindling official development assistance, unsustainable debt burdens, conflict, and climate-related shocks continue to undermine countries' abilities to invest in health and social protection systems, leaving billions unable to access health services without financial hardship. We emphasize resilient, people-centered primary healthcare systems and essential health services across the life course, including prevention through water, sanitation and hygiene, nutrition, timely diagnosis, rehabilitation, palliative care, and sexual, reproductive, maternal, newborn, child, adolescent, and older persons' health. Looking beyond 2030, we urge member states to advance sustainable health financing grounded in domestic public investment and fair fiscal policies, invest in resilient, gender-responsive health systems and primary care to achieve universal health coverage, strengthen accountability through inclusive data system, gender-inclusive research, and actionable access to health technologies, promote meaningful social participation in health governance, and increase investment in the health and care workforce, the majority of whom are women, including leadership, equitable pay, and safe working conditions. Thank you.
Thank you. I now give the floor to Singapore, followed by Morocco.
Thank you, Chair. Singapore commends the Director General on the comprehensiveness of both reports and agrees with the need for robust health information systems, data governance, ethical frameworks, and adaptive regulation to support digital transformation and healthcare innovation. We started on our health data sharing journey in 2011 with the establishment of the National Electronic Health Records, also known as NEHR, which receives and consolidates selected health information to support care coordination. We started with voluntary participation, but will soon require all licensed healthcare providers to contribute patients' key health information to the NEHR with the passing of the Health Information Bill in January 2026. To build trust, the bill has also put in place robust safeguards to ensure tight control over access. To enable innovation, we have also established several platforms and initiatives. These include the Health Empowerment through Advanced Learning and Intelligent Exchange Platform, also known as HELIX, and the Trusted Research and Real-World Data Utilization and Sharing Tech, also known as TRUST. These enable secure data sharing for research and AI development. We have also updated our AI in healthcare guidelines and implemented regulatory sandboxes to enable safe development and deployment of AI, ensuring robust clinical oversight and governance. Our philosophy is that in healthcare, AI needs to augment and not replace clinical judgment. Singapore remains committed to working with WHO and member states to share our experiences in these areas. Further details are in our written statement. Thank you.
Thank you, Singapore. I now invite Morocco, followed by Thailand.
Monsieur le Président,
Chair, the Kingdom of Morocco thanks the Director General for the presentation of the report on health in the Agenda 2030 for Sustainable Development. We reiterate that health is a key pillar for sustainable development and a cross-cutting lever for implementing the SDGs. We also underscore the importance of strengthening innovation in health systems, the resilience facing in the face of health crises, and work to accelerate the implementation of health-related SDGs. International cooperation is key in this respect. We have undergone structural reforms seeking to strengthen equity, improving access to health care, and improving prevention, especially in primary health care, and we're also working on universal coverage. We are working in particular on the health of young people, adolescents, and children. This is strategic for the future. School and university programs have been strengthened, including well-being programs on risk behavior and prevention, as well as educational programs with a focus on health. We will continue efforts to accelerate the implementation of health-related SDGs by 2030, and we underscore the importance of adopting integrated approaches relating to social, economic, and environmental determinants of health, and adopting targets taking into account inequalities and disparities. Thank you.
Thank you, Morocco. I now give the floor to Thailand, followed by Cuba.
Thank you, Chair. Thailand thanks the Director General for the comprehensive report, and Thailand supports Maldives' statement on behalf of the region. Thailand's digital health transformation demonstrates the economic of health for all by investing in data infrastructure to promote health equity, universal health coverage, and sustainable development. However, data silos remain significant barriers. Thailand supports cross-sectional integration by linking health, employment, social protection, and geolocation data to enable evidence-based policies and equitable resource allocation. More than 900 hospitals in Thailand are now digitally connected. Together with standardized health data, this digital foundation has enabled responsible AI innovation, such as AI-powered tuberculosis screening for all populations, supported by Thailand's national AI strategies. The future of digital health requires harmonized standards, transparent governance, strong data protection, and meaningful participation from data owners. Thailand supports the Global Strategy on Digital Health 2028 to 2033 and calls on the WHO to develop operational guidance in 3 key areas. Minimum standard for data interoperability. Second, AI governance framework for health. Third, the best practice guidance for integration digital technologies into primary health care. Harmonization means building a shared foundation for responsible innovation, not imposing uniform models. Thailand invites member states to collaborate toward an equitable, safe, and beneficial digital health future. Thank you, and we look forward to collective action.
Thank you, Thailand. I now give the floor to Cuba, followed by constituency statement.
Señor Presidente.
Chair, despite the progress in controlling on a global level the COVID-19 pandemic and other threats, we cannot forget that we could have a new global epidemic in the future. We also do not know which new pathogen could be the origin of it and where it will strike. So we need to look at health once more with a widening of ensuring that we meet the Agenda 2030 for sustainable development. That is why the world has set out the One Health global strategy, and this shows the strategic value of the new paradigm faced by humanity. We must really fully understand the relationship between people, animals, plants, and the environment. So we have concepts which are intrinsic to the traditional health processes, which are focused on surveillance, diagnostics, and treatment. But we also need to look at adopting advanced technologies such as artificial intelligence, big data, and remote medicine. We also are looking at governance of digital health and artificial intelligence in the areas of health. In Cuba, we have set up several tools which allow for the registering and using of statistical data to follow up on health of the population, which is helpful for ministerial decision-making. And we are working for this. Despite the many impositions of the blockage on our country, we are working to strengthen our health systems, which are ever more integrated and aim to reach a universal health coverage, in particular the adoption and inclusion of policies that guarantee equitable access to.
Thank you, Cuba. I now give the floor for constituency statement by World Heart Federation.
Thank you, Chair. This statement is delivered by the World Heart Federation on behalf of the Global Alliance for Tobacco Control, HelpAge International, the International Alliance of Patients Organizations, the International Society of Nephrology, the International Council of Nurses, the International Diabetes Federation, Sightsavers, World Obesity Federation, World Stroke Organization, the World Organization of Family Doctors, the World Federation of the Sporting Goods Industry, and Global Diagnostic Imaging, Healthcare, IT, and Radiation Therapy Trade Association. Honorable Chair, distinguished delegates, We note with concern that the world is significantly off course to achieve the health-related SDGs, especially Target 3.4 and 3.8. NCDs, including cardiovascular disease, stroke, cancers, hypertension, diabetes, kidney disease, and other circulatory health conditions, represent the leading cause of death and disability worldwide. Yet, NCDs remain largely under-prioritized across global, regional, and national health, financing, and political agendas. The unequal distribution of NCD incidence, prevalence, and outcome reflects deep and persistent inequities shaped by social, economic, commercial, geographical, and environmental determinants of health, whose consequences they extend across all SDGs. Populations in LMICs and disadvantaged groups, including women, children, persons with disabilities, and older persons, face serious barriers across the continuum of care. The COVID-19 pandemic has further exposed critical vulnerabilities in health systems, public health preparedness, and societal resilience through global health crisis. Essential NCD services must be fully integrated into health emergency preparedness, response, and recovery plans to ensure continuity of care through crisis, including in humanitarian crisis. Universal health coverage must be built on strong primary health care, financial protection, and access to comprehensive, integrated services for NCD and their main drivers, such as obesity, across the full continuum of care, including prevention, chronic care, essential medicines, diagnostics, and technologies. Strengthening PHC remains essential, as it could deliver up to 90% of the interventions needed to achieve UHC, and if scaled up across LMICs, could save 60 million lives by 2030. Beyond 2030, SDG Target 3.4 should better reflect demographic realities and address NCD-related death and disabilities across all ages. Thank you.
Thank you. And now I give the floor to Gambia, followed by Oman.
The Gambia recognizes the progress on the health-related SDGs remain uneven as we approach 2030. For the Gambia, advancing universal health coverage is central to achieving the 2030 agenda and ensuring equity resilience in our health system. We have made important progress. Guided by our National Health Policy 2021-2030, we have expanded access to essential services, strengthened governance, and improved health system performance. The enactment of the National Health Insurance Act in 2021 represents a major step towards financial protection and equitable access to care. At the same time, we have faced persistent challenges, including limited physical space, shortages in the health workforce, infrastructure gaps, and the rising burden of both communicable and non-communicable diseases. Climate change and emerging health threats further highlight the need for a resilient health system. The Gambia urges acceleration toward UHC achievement through strengthened primary health care and strategic investments in the health workforce. Integrating health security into routine service delivery to enhance preparedness and response, and increasing domestic resource mobilization while strengthening partnerships to close financing gaps. The Gambia called on the international community to support country-led efforts through predictable financing, technology transfer, and capacity development. Thank you.
Thank you, Gambia. And I'll give the floor to Oman, followed by Cambodia.
Thank you, Mr. Chair. We stress our unwavering commitment to promote digital transformation in the field of health through implementing the digital strategy for 2026-2035, which is an integrated national framework to build data-driven health system to promote the quality of healthcare and its efficiency and to support evidence-based decision-making. The Sultanate of Oman has made much progress in this field. This has included modernizing digital infrastructure, expanding e-health records, and Mr. Chair, The accelerating developments in the field of health data, digital health, and AI require promoting international cooperation to build regulatory frameworks and common benchmarks, ensuring the safe and responsible and ethical use of these technologies while respecting national sovereignty of states over their health data and national priorities. Despite progress made, there are common challenges. This is related to promoting the effective implementation of regulatory frameworks and also improving data governance. Add to this, data quality issues and interoperability. There are also challenges linked to cross-border exchange of health data. In this framework, the Sultanate of Oman stresses that we need to develop harmonized global framework for health data to ensure data quality, complementarity, and trustworthiness. We also need an AI governance system in the field of health with a focus on safe and responsible use. We also need to adopt regulated international mechanisms
Thank you, Aman. I now give the floor to Colombia, followed by Germany.
Thank you, Chair. Colombia considers that the 2030 agenda can only be achieved if health is seen not just as an outcome of development, but also a condition to make it possible. However, current progress shows that inequalities continue to limit our achievement of joint goals. So Colombia has been working towards a territorial, preventive, people-centered model. More than 12,000 basic health teams and 100,000 workers work across the country, reaching a historically excluded communities. This shows that when response reaches people, progress is no longer a statistic, but a real transformation. In the area of digital health, data, and artificial intelligence, Colombia agrees with the WHO that we need to have clear rules, interoperability, and an ethical and responsible governance. Nevertheless, we also consider it just as important that digital transformation remains people-focused and is understood from a perspective based on human rights. The conversation cannot just simply be about what technologies we use, but who can access them, who benefits, and under what principles it is governed. The future of health cannot consist in replacing old-fashioned inequalities with digital inequalities. The innovation is only making sense when the benefits reach all people and communities. Thank you.
Muchísimas gracias, Colombia.
Thank you very much, Colombia. I now give the floor to Germany, to then be followed by Switzerland.
Dear colleagues, progress towards the health-related SDGs is insufficient and threatens sustainable development beyond health. To get back on track, we need a stronger health in all policies and whole-of-government approach carried forward by a reformed global health architecture with a strong WHO at its center. Recent disruptions to demographic and health surveys further underscore we need nationally owned and independent health data systems to generate timely, disaggregated, high-quality data for targeted action towards the 2030 SDGs. Germany commends WHO for its continued work with member states to strengthen core digital public infrastructure for health. Strong coordination, technical and normative guidance remain critical to help translate global commitments into national actions. Going forward, AI tools and digital health services carry great potential for improving access, equity in care, and data-driven decision-making across health systems worldwide. However, their safe and effective use depends, among other preconditions, on high-quality representative data. This is why Germany supports WHO's essential work on data standards, governance, and interoperability. responsible partnerships with the private sector will play a crucial role in supporting resilient, essential data and digital health infrastructure. Particularly in times of resource constraints in many countries, WHO's mandate under the Global Strategy on Digital Health is essential to align global and national digital partners and ensure coherent action. At the same time, standards for oversight and governance of AI should be based.
Gracias, Filipe.
Thank you. Switzerland has the floor, and then Tunisia.
Health data, interoperable information systems, and AI are closely interconnected. Digital health should remain focused on improving quality of care, patient safety, and equitable and sustainable health systems. Switzerland therefore welcomes the continued work on the development of the new global digital health strategy. In this regard, we encourage that AI readiness be addressed to ensure health systems can safely and effectively adopt AI-driven solutions. Switzerland further emphasizes the importance of trusted official health data and of addressing misinformation and disinformation in the health sector. High quality and reliable health data is essential for evidence-based health policy and for maintaining public trust. For the ongoing work on the subject, meaningful cooperation with all relevant organizations and stakeholders is key to leveraging synergies and ensuring alignment with national contexts and international priorities. Among those stakeholders, it is important to recognize young people. We encourage all delegations to include the voices of those who are growing up alongside AI tools and digital technologies and who are increasingly navigating health through digital systems. In line with this continued commitment to advancing digital health and trusted data, Switzerland is honored to host the Global AI Summit here in Geneva in 2027. This summit will provide a concrete impetus for globally sustainable AI governance, which is also critical to global public health. Thank you.
Thank you, Switzerland. And I'll give the floor to Tunisia, followed by Indonesia.
شكرا سيد الرئيس. ترتكز السياسة الوطنية للصحة بتونس على تعزيز الرعاية الصحية الأولية.
We are aiming to strengthen our work in Tunisia, which has allowed us to reach the third SDG despite COVID-19. Recent data shows Tunisia's capacity to maintain its progress made and to improve work in health, and we have reduced maternal death rates to 35.3 deaths per 100,000 births, and we have reduced the mortality rates for children under 5. Tunisia maintains a vaccine coverage of more than 97%. HIV rates is under 0.1 because of free availability of treatments. We are nevertheless aware that we face major challenges. We believe it is important to harmonize regulatory approaches, governance standards for data, digital health, and artificial intelligence by developing interoperable data systems so that we can implement the 2028 to 2033 strategy. We give particular importance to interoperable health systems with an unique identification number for patients and a network of national work according to the international disease classifications and the improvement of health systems. Thank you.
Thank you, Tunisia. And now I invite Indonesia, followed by Brazil.
Thank you, Chair. Indonesia thanks WHO for the report and further reaffirms our commitment to achieving sustainable development goals in health. We recognize that with only a limited time remaining to achieve the 2030 agenda, accelerated and transformative actions are urgently needed to address persistent gaps and ensure that progress reaches those furthest behind. We therefore welcome the resolution to accelerate the efforts by advancing international collaboration and encouraging WHO to give technical assistance to countries in need. At the same time, Indonesia believes that achieving the 2030 health agenda will require not only stronger health system, but also greater use of digital innovation to improve access, quality, and continuity of care. Indonesia welcomes the resolution and aligns with the report by Director General. We therefore encourage member states to strengthen digital health ecosystem and develop robust AI governance that are interoperable, inclusive, and people-centered. In this regard, Indonesia has also strengthened its national digital health ecosystem through Satu Sehat, which serves as the national health information exchange platform and integrates fragmented health system into an interoperable ecosystem. Indonesia is also advancing governance for digital health and artificial intelligence through the development of regulatory sandbox and the establishment of Health AI Committee. Finally, Indonesia stands ready to work with the WHO and fellow member states to accelerate progress towards the 2030 agenda. Thank you, Chair.
Thank you, Indonesia. I now give the floor to Brazil, followed by Nauru.
Chair, Brazil thanks the Secretariat for the reports. Regarding the consolidated report on health in the 2030 agenda, we can conclude that further progress depends on predictable financing, structured knowledge sharing, and resilient information system. We should modernize surveillance and strengthen civil registration, guaranteeing disaggregate data for actual policy making. Under item 1210, Brazil firmly supports harmonizing regulatory approaches for data, digital health, and artificial intelligence. The proposed global digital health strategy must treat data information systems and AI as interconnected pillars guided by systemic governance rather than isolated technological adoption. The strategy should advance inclusive financing, shared standards, and meaningful participation from the Global South, ensuring that digital health becomes a driver of universal coverage, accountability, and reduced structural inequalities. Brazil has successfully operationalized this vision through initiatives that elevate digital transformation into a strategic sovereign objective for all citizens. Brazil is cementing an unwavering commitment to resilient public infrastructure, sustainable domestic financing, and equitable data governance. Initiatives like InovaSUS Digital demonstrate how state-led innovation can deliver real solutions. Thank you, Mr. Chair.
Thank you, Brazil. I now give the floor to Nauru, followed by Kenya.
Thank you, Chair. Nauru reaffirms its commitment to the 2030 Agenda. Health remains central to sustainable development, but the multi-dimensional vulnerability index tells us what income alone cannot. That for small island states, vulnerability persists even as we graduate to high income status. Our remoteness, size, and exposure to shocks do not disappear with a statistic. If the 2030 Agenda is truly to leave no one behind, financing for health must reflect vulnerability, not just GDP. For Nauru, progress on the SDGs depends on resilient health systems that can deliver despite geographic isolation, limited resources, and climate pressures. We emphasize three priorities: strengthening primary health care, supporting the health workforce, and ensuring reliable access to medicines and diagnostics. International cooperation, predictable financing, and practical technical assistance remain essential for vulnerable states with limited capacity. We encourage WHO to continue its leadership through knowledge sharing and multi-sectoral collaboration. I thank you.
Thank you, Nauru. I now invite Kenya, followed by Vanuatu.
Thank you, Chair. Kenya aligns itself with the statement delivered by DRC on behalf of the 47 member states of the WHO region. On agenda item number 12.6, Kenya notes the report on the health in the 2030 agenda. for Sustainable Development and reaffirms its commitment to achieving the health-related SDGs. We remain concerned by the global slowdown in progress and emphasize the need for accelerated collective action. Kenya continues to strengthen primary health care as the foundation of universal health coverage, expand financial protection through social health insurance, and maintain strong emergency preparedness and response capacities. To improve maternal and newborn health outcomes, Kenya is implementing the Every Woman, Every Newborn, Everywhere framework and strengthening maternal and perinatal health surveillance and response systems to enhance quality of care across the continuum. On agenda item 12.10, Kenya is advancing ambitious digital health reforms to improve efficiency, accountability, and evidence-based decision-making. We have established a digital health authority, strengthened legal regulatory frameworks, and are leveraging artificial intelligence in health financing and interoperability systems to enhance governance and service delivery. Kenya underscores the urgent need to strengthen health information and data systems to address persistent gaps that hinder digital transformation. We call upon the WHO and partners to prioritize support for sustainable, locally led digital health systems and institutional capacity building to ensure robust and disaggregated data for all populations. I thank you.
Thank you, Kenya. And now I invite Vanuatu, followed by Ethiopia.
Thank you, Chair. Vanuatu aligned itself with a statement delivered on behalf of the Pacific states by Papua New Guinea. Vanuatu is proud to note that on May 20, just 2 days ago, the United Nations General Assembly adopted a resolution endorsing the ICJ Advisory Opinion on Climate Change. We warmly welcome this important development, which reinforces that climate change is not only an environmental challenge, but a defining sustainable development issue with profound implications for human health, equity, livelihoods, and realization of the 2030 Agenda. For countries such as Vanuatu that are on the front line of climate crisis, climate change continues to erode development gains, deepening inequalities, and place immense pressure on already fragile health systems and economies. Rising sea level rise, severe cyclones, flooding, and other climate-related disasters damage critical infrastructures, disrupt essential services, threaten food and water security, and undermine resilience and well-being of our communities. As a small developing state on the front line of climate crisis, Vanuatu faces the compounded burden of communicable and non-communicable diseases, limited fiscal space, geographical dispersion, and exposure to external shocks. These interconnected challenges demonstrate clearly that sustainable development cannot be achieved without urgent climate action and resilient health system. We therefore call on WHO, development partners, and international community to scale up predictable and sustainable financing, technical assistance, technology transfer, and capacity building to support small island developing states in achieving the health-related sustainable development goals and strengthening inclusive, climate-resilient, and sustainable health system that advance health equity and resilience for all. I thank you, Chair.
Thank you, Vanuatu. I now give the floor to Ethiopia, followed by Burkina Faso.
Thank you, Mr. Chair. Ethiopia aligns with the African Regional Statement delivered by DRC and thanks the Secretariat for the reports. Ethiopia notes with concern the slowing or regression of progress in meeting the health indicators for the 2030 Agenda for Sustainable Development. We wish to emphasize the need to focus on primary health care, predictable financing, including through pooled domestic resources, as well as investment in country-owned health information systems that are crucial for credible SDG monitoring and for surfacing inequities that aggregate figures conceal. On agenda item 12.10, Ethiopia has taken concrete steps to advance the digital health agenda. Ethiopia enacted the Personal Data Protection Proclamation, a legal framework directly addressing the regulatory and governance foundations called for in the report. In addition, the government adopted a national artificial intelligence policy in 2024, mandating the Ministry of Health to establish AI-ready data management systems. We take note of the report, but remain concerned about fragmentation across parallel data systems and rapid proliferation of AI applications already outpacing regulatory capacities. Ethiopia thus supports the harmonization agenda and looks forward to a well-developed global strategy on digital health. Ethiopia further calls on WHO to support member states with practical, context-adapted WHO guidance on AI benchmarking, transparency, accountability, and data protection, At the same time, digital transformation must be firmly grounded in national data sovereignty and aligned with local contexts and priorities. Digital transformation can accelerate progress towards universal health coverage, but only if the foundations are right. Trusted data, interoperable systems, ethical governance, and genuine country ownership. Ethiopia is committed to building those foundations at home and to contributing constructively to a global digital health agenda that serves every health system equitably. I thank you.
Thank you, Ethiopia. I now give the floor to Burkina Faso, followed by Zambia.
Merci, Monsieur. Thank you, Chair. Burkina Faso aligns itself with the statement made by the Democratic Republic of the Congo on behalf of the African region. We thank the Secretariat for the caliber of the documents provided for our consideration. Burkina Faso considers that digital transformation is a major strategic lever for accelerating the implementation of UHC and health-related SDGs. In this respect, my country has implemented several reforms seeking to strengthen the governance of health data, the interoperability of digital systems, and the responsible use of emerging technologies, in particular artificial intelligence. A national roadmap on AI is being implemented, along with a regulatory framework with a law on the protection of personal data and a general frame of reference for interoperability. In the health sector, Burkina Faso adopted a strategic plan for digital health, a strategic plan for the National System for Health Information, and a national digital health architecture which seeks to promote a harmonized system that is secure and interoperable. Significant progress has been made in the digitalization of health services, the development of national registers, and the strengthening of digital infrastructure. However, we're still facing challenges, especially with respect to connectivity, cybersecurity, technical capacities, and the sovereign hosting of health data. Burkina Faso thus underscores the importance of sincere and robust international cooperation in order to reduce the digital divide, support the transfer of technology, and promote ethical, inclusive, and sovereign governance of health data. Thank you.
Thank you, Burkina Faso. I now invite Zambia, followed by Nepal.
Thank you, Chair. Zambia aligns itself with a statement delivered by the DRC on behalf of the Afro region. As a country actively implementing national digital health strategy and health data governance frameworks, Zambia recognizes the urgency of harmonized regulatory frameworks, particularly as artificial intelligence and data-driven technologies reshape health service delivery across our region. In Zambia, over 2,000 health facilities are connected to our locally developed National Electronic Health Record System. We wish, therefore, to emphasize three priorities. First, interoperability and standards must be at the core of the next global digital health strategy. Fragmented systems remain a significant barrier across Africa, undermining the continuity of care and limitation of the value of health data investments. Secondly, ethical and safe use of AI requires governance mechanisms that are not only globally harmonized, but locally adaptable. Low and middle-income countries must be supported to develop regulatory capacity necessary to govern AI in ways that reflect their own health system contexts, data realities, and population needs. Third, sustainable financing for digital public infrastructure is non-negotiable. Zambia calls on member states, WHO, and development partners to increase investments in foundations, including national health information systems, as a prerequisite for any meaningful AI and data governance agenda. I thank you.
Thank you, Zambia. I now give the floor to Nepal, followed by Saudi Arabia.
Thank you, Chair. Nepal reaffirms its strong commitment to the 2030 Agenda for Sustainable Development and recognizes health as a fundamental human right and a foundation for inclusive and resilient development. Nepal continues to advance health sector reforms focused on strengthening primary health care, expanding social health protection, improving service delivery, and promoting equity. Despite geographic and resource challenges, there have been important progress in reducing maternal and child mortality, improving immunization coverage, eliminating and controlling diseases, and strengthening outbreak preparedness through the collective effort of health workers, communities, and development partners. At the same time, Nepal recognizes the need to accelerate efforts towards achieving the SDG targets. In particular, equity, high out-of-pocket expenditure, and healthcare quality are major concerns. Nepal further welcomes the strategy on artificial intelligence for health system transformation. AI can help address gaps in diagnostics, surveillance, service delivery, and workforce shortages. However, its use must be guided by strong ethical, legal, and equity safeguards. We are taking gradual steps towards responsible adoption of digital health and AI in health. Nepal calls for the international cooperation, technology transfer, and capacity building support for low and middle income countries for digital health transformation. WHO has an important role in providing normative guidance and fostering equitable access so that the benefits of AI and digital health are shared fairly and inclusively. We remain committed to working closely with WHO, member states, partners, and community to advance equitable and resilient health system for universal health coverage. Thank you, Chair.
Thank you, Nepal. And I'll give the floor to Saudi Arabia.
Mr. Chair, we stress that it is time to move from commitments to tangible achievements. We need to intensify efforts to support countries to reach SDGs through high-impact interventions in public policies and through accountability and financing mechanisms. We have made achievements. Under our Vision 2030, we have made paradigm shifts when it comes to SDG 3. We are moving towards realizing the goal 95 to address HIV, and we are malaria-free for more than 4 years, and we also reduced diseases by 40%, and we improve our workforce. TB has reduced, and the rate of UHC is now 83% due to expanded PHC and digital transformation. On health data, we stress that it is important to have flexible ecosystem, one that is integrated, take into consideration civil registration statistics. We need data governance and responsible use of AI. We also call for aligning governance frameworks of digital health and AI and ensuring healthcare quality while taking into consideration the specificity of each state when developing its own systems. We look forward to continuing cooperation with this organization and member states to develop international standards to support the safe and equitable use of technologies in the health sector. Thank you.
Thank you, Saudi Arabia. The Secretariat of the World Health Organization Framework Convention on Tobacco Control has asked for the floor. I have pleasure to give the floor to the acting head of the Secretariat of WHO, FCTC.
The world remains off track to achieve the health-related SDGs. In this context, implementing the WHO FCTC is not only a health priority, but an accelerator of sustainable development. Strong tobacco control reduces NCDs, protects household incomes, safeguards the environment, and supports domestic resource mobilization. The global tobacco epidemic continues to impede SDG progress, killing more than 7 million people each year, with a growing burden in LMICs. It's essential to sustain strong global action to implement the WHO FCTC and the protocol to eliminate illicit trade in tobacco products. I urge all governments to prioritize preventing nicotine addiction among young people. Convention secretaries stand ready to support parties. Thank you, Chair.
Thank you. Several non-state actors in official relations with WHO have requested the floor on this agenda item. According to the privileges conferred by the relationship with the World Health Organization, I have pleasure in giving the floor to the representative of World Medical Association.
Good afternoon. The WMA, together with the members of the World Health Professions Alliance, representing 47 million dentists, nurses, pharmacists, physicians, and physiotherapists, commends WHO's leadership in advancing global standards for interoperability and governance. Artificial intelligence must support, not replace, the patient-health professional relationship, and as per the Executive Board's report, it must be used safely and ethically. Regulatory frameworks must ensure that licensed health professionals retain final clinical authority with clear, harmonized standards for accountability and liability. Equity must be built in by design, including the assessment of bias before deployment. Digital transformation will only succeed if the health workforce is adequately educated in AI literacy and if patient confidentiality and data privacy are fully protected. Precision medicine must remain human-centered and equitable. Thank you.
Thank you. I now give the floor to the Global Self-Care Federation.
Chair, GSCF supports Agenda Item 1210 and welcomes the continued focus on strengthening regulatory systems. We support greater use of regulatory reliance as an evidence-based, efficient and scalable approach to improving timely access to safe, effective and quality-assured health products. Reliance enables national regulatory authorities to make strategic use of limited resources while maintaining full independence and accountability, particularly relevant for self-care interventions such as non-prescription medicines, which have well-established safety and efficacy profiles supported by decades of use and regulatory oversight. As countries progress towards UHC, reliance pathways can reduce duplication, accelerate access to essential self-care interventions, and support more efficient use of health system resources. We encourage member states and WHO to support clear reliance frameworks, greater regulatory convergence and harmonization, and enhanced information sharing mechanisms to strengthen equitable access to essential medicines globally. I thank you.
Thank you. I now give the floor to International Association for Dental Research.
IADR welcomes the report and its focus on harmonized governance for data, digital health, and artificial intelligence. Digital tools and AI can strengthen research, surveillance, early detection, access to care, but they must be safe, ethical, interoperable, and equitable. IADR's Ethics in Artificial Intelligence in Dental, Oral, and Craniofacial Research Policy Statement emphasizes responsible use grounded in transparency, accountability, privacy, equity, and human oversight. We call on member states to include oral health in national digital health strategies, standards, workforce training, and research investments. Governance should ensure AI-enabled tools are built on representative data, validated in diverse populations, guided by clear accountability, and monitored over time. Thank you.
Thank you. I now give the floor to International Association for Suicide Prevention.
The International Association for Suicide Prevention welcomes the focus on harmonized governance and the development of the next global digital health strategy. Digital tools and AI hold genuine promise for suicide prevention, but they also carry serious risks. Algorithmic systems can amplify harmful content, exposing vulnerable people to suicide and self-harm material. Current AI governance and online safety frameworks do not yet adequately reflect suicide prevention evidence, guidelines, and legislation, and the design of platforms, chatbots, and algorithmic systems is now a public health issue, not just a technology one. We urge member states to ensure that the forthcoming digital health strategy explicitly addresses mental health and suicide prevention. We also call for the meaningful inclusion of people with a lived experience of suicide, civil society, and voices from low and middle income countries in the design, governance, and evaluation of digital health and AI systems, so that these tools genuinely serve those most at risk rather than deepening existing harms. Thank you.
Thank you. And now I invite International Federation of Medical Students Associations.
Honorable Chairperson, esteemed delegates, IFMSA recognized that digital transformation without harmonized governance risks widening disparities rather than reducing them. Algorithmic bias, fragmented data systems, and the absence of cross-border standards continue to undermine safe, people-centered care. As future physicians, we know that digital health and AI have outpaced regulation, creating risks to patient safety and equity, especially in low research settings. Furthermore, an IFMSA survey data shows gaps in digital health education, underscoring that transformation cannot succeed without a prepared workforce. We call on member states to adopt enforceable global standards for AI safety, data privacy, and accountability, invest in health infrastructure and workforce, and to engage youth as co-creators, because no digital future in health should leave anyone behind. Thank you.
Thank you. And now invite International Federation of Pharmaceutical Manufacturers and Associations.
Noting the previous work on digital health transformation, AI, and data governance and the first WHO global strategy, IFMA believes new health technologies have the potential to benefit all stages of research and development. While public health surveillance and patient outcomes can be further strengthened by AI-enhanced insights in digital health, it is paramount to ensure patient trust in ethical and secure use of these technologies to support innovation. Well-defined frameworks for leveraging robust data are critical to support data-driven healthcare. IFMA strongly believes that the complexity of this topic will necessitate a meaningfully collaborative and complementary approach. Different stakeholders, including the innovative pharmaceutical industry, should be consulted on work related to data, digital health, and AI. We look forward to constructively contributing our unique expertise to this process. Thank you.
Thank you. I now give the floor to International Lactation Consultant Association.
Thank you. ILCA welcomes the global strategy on digital health, emphasizing the need for a safe, equitable, ethical, and sustainable approach to ensuring that digital technologies are used to enhance health while protecting people's safety and privacy. ILCA advocates for a rights-based approach, prioritizing inclusion and universal health coverage, and ensuring that technology complements and does not replace human interaction and empathy in healthcare. Breastfeeding counseling and support can be provided by a combination of in-person and digital means. Last year, the Assembly adopted a resolution on regulating the digital marketing of breast milk substitutes. For meaningful progress, the monitoring and regulation of digital marketing of BMS and other health products should be integrated within the implementation of the global strategy.
Thank you. And now I invite International Pharmaceutical Federation.
Honorable Chair, distinguished delegates, accelerating progress towards the health-related UN Sustainable Development Goals, SDGs, requires integrated, equitable, and sustainable health systems and workforces. Pharmacists are essential to advancing universal health coverage to ensuring safe, effective, and equitable access to medicine, strengthening prevention and primary care, and supporting vaccination and digital health services. The International Pharmaceutical Federation, FIP, calls on member states to fully integrate pharmacists into national SDG implementation strategies, including workforce, planning, and sustainable health system transformation. Investing in pharmacy strengthens health system, accelerates progress towards the 2030 agenda, ensuring no one is left behind. Thank you for your attention.
Thank you. And now I give the floor to International Pharmaceutical Students Federation.
Mr. Chair, distinguished delegates, IPSF recognizes the transformative potential of digital health, data governance, and AI in advancing the SDGs and equitable healthcare systems. This year, IPSF drafted a global declaration on the responsible use of AI in healthcare for the period 2026 and 2027, engaging members from over 50 countries through national position papers on ethical, inclusive, and patient-centered AI governance. The declaration will be adopted by 136 member organizations across more than 100 countries, translating global policy into local action through a network of over than 600,000 pharmacy students and recent graduates worldwide. IPSF invites partners and member states to support meaningful youth engagement and advocacy in responsible digital health and AI governance. Thank you.
Thank you. And now I invite Knowledge Ecology International.
The European Health Data Spaces Regulation, published in 2025, is an astonishingly ambitious framework for expanding access to data relevant to health, including patient records, genomic information, prices, invoices, regulatory and clinical trial data, and other information. Secondary uses of health data are specific or particularly significant, allowing use for R&D on new products, training artificial intelligence systems, and policy analysis. There's a federated, decentralized architecture. The regulation states the secondary use of health data for research and development purposes should contribute to benefiting society in the form of new medicines, medical devices, and healthcare products and services at affordable and fair prices for Union citizens. Thank you, Chair.
Thank you. And now give the floor to Medical Women's International Association.
Thank you, Chair. Distinguished delegates, despite progress in immunization and perinatal care, the 2030 targets for maternal, neonatal, and under 5 mortality remain off track. To accelerate progress towards health-related SDGs, the Medical Women's International Association recommends 3 actions. Firstly, amid challenged multilateralism, governments must reaffirm commitment to stronger global health architecture and increase domestic health financing. Second, member states should strengthen engagement with parliamentarians to co-create evidence-based and sustainable health policies and budgets. Third, health-related SDGs cannot be achieved without prioritizing sepsis, which affects 26 million women, 20 million children under 5 annually, and accounts for 20% of global deaths. Thank you, Chair.
Thank you. And now I give the floor to Medicus Mundi International, Network Health for All.
Well, thank you very much, Chair. This Medicus Mundi International statement is supported by the People's Health Movement. We want to express major concern about the influence of the technology industry across several agenda items, particularly when the vast majority of the tech giants are headquartered in a non-WHO member state. It's not clear to us how outcomes from this agenda item will apply to these companies. The development of a culturally sensitive, environmentally friendly, and needs-based set of digital health solutions demands strong regulation and the development of a digital public stack, independent from large corporations and led by states through international cooperation. Health data in particular should be understood as a common good that cannot be appropriated by a handful of private actors. Thank you.
Thank you. And now I invite Movendi International.
Thank you, Chair. Brand new WHO projections show a 2% rise in population-level alcohol consumption by 2030. This directly contradicts the target of Global Alcohol Action Plan, where member states committed to achieving 20% reduction, and it jeopardizes the progress towards 15 of 17 SDGs. Movendi International members are deeply alarmed. Higher population-level alcohol use means more cancer and cardiovascular diseases, more violence against women, more children deprived of safe and enabling childhoods, more families losing loved ones to preventable diseases. It means more costs in health systems and severe loss of GDP. This situation puts a spotlight on the alcohol industry. They're deploying systematic political interference to delay, dilute, and derail public health action on alcohol harm. The world needs some protections against industry interference for alcohol that exist for tobacco. We call on member states.
Thank you. And now I give the floor to NCD Alliance.
Thank you, Chair.
The NCD Alliance welcomes the Director General's update, including progress in SDG indicator data coverage and the revision of UHC indicators in 2025. While we commend Member States for being on track to reduce per capita alcohol consumption by 20% by 2030, we remain concerned that the world is off track on all health-related SDGs. Insufficient action on non-communicable diseases continues to slow progress towards the target of a 1/3 reduction in premature NCD mortality. And in some contexts, we are witnessing stagnation or reversal. We urge Member States to accelerate action on NCD risk factors by investing in prevention, strengthening accessible health systems, and reinforcing health information systems, accountability, and real-time disaggregated data used to support meaningful stakeholder engagement and SDG implementation. Thank you.
I thank you. And give the floor to Public Services International.
PSI notes the poor SDGs progress with concern. This shows the need for fundamental reforms based on international solidarity, public services, accountability, decent work, and community engagement. WHO and member states must back technical competence with the political will to transform the global financial architecture and public health. AI expansion in global health must be located within this context. It must not be based on the private sector logic of efficiency, which undermines health workers' rights. The manner in which AI is being applied is not reducing work. It is making work more intensive and precarious. AI uptake in the health sector should not lead to the expansion of health workers' responsibilities without commensurate improvement in wages and working conditions. We call on member states to ensure the draft global strategy on digital health protects and promotes workers' rights in line with SDG 8. Thank you, Chair.
Thank you. And now I invite Rare Diseases International.
Thank you, Honourable Chair and distinguished delegates. We welcome the report and emphasise that achieving the 2030 Agenda requires progressing several SDGs that address the multidimensional challenges of 300 million people living with a rare disease worldwide. Living with a rare disease puts patients and families at risk of impoverishment and hinders access to quality education, which negatively impacts finding adequate work. Women are disproportionately impacted as patients or as primary caregivers. To reduce inequalities, the needs of the rare disease community must be addressed. We also recognise that rare diseases represent an area of great potential for scientific innovation. Ensuring health for all must include people living with a rare disease. Partnering with the SDGs will achieve UHC for rare diseases, leave no one behind, and advance equitable health systems and sustainable development for all. Thank you.
Thank you. And now I give the floor to Corporate Accountability.
Thank you. This statement is supported by the People's Health Movement. With the current framing of the digital health and AI agenda, health systems risk becoming dependent on the same corporations that are causing massive health harm, the big tech industry. Just like Article 5.3 of the Framework Convention on Tobacco Control protects health policy from the influence of the tobacco industry, we demand that the same principle needs to be applied to the big tech industry. We say that the big tech industry contributes to mental health problems, especially amongst younger generations. In this sense, big tech corporations can be defined as a harmful commodity industry. Therefore, we call on the WHO and member states to develop digital capacities regulated by public accountability mechanisms and to avoid partnering with corporations that are harming health. Thank you, Chair.
Thank you to all distinguished delegates. We have now concluded the list of the statements. I shall now give the floor to the Secretariat, Dr. Boehme, Officer in Charge, Southeast Asia region. The floor is yours.
Thank you, Chair, Director General, distinguished delegates. I have the honor to deliver this statement on behalf of all WHO regions. We strongly support bringing digital health, artificial intelligence, governance, and precision medicine together within a single agenda, because all three depend on the same foundations: trusted data, interoperable systems, and strong governance. Across all regions, progress is accelerating. 129 member states now have national digital health strategies. The Global Digital Health Certification Network already serves nearly 2 billion people across over 80 countries. Yet, fragmentation remains a major challenge. Without strong foundations, artificial intelligence risks amplifying inequities rather than reducing them. Chair, 3 principles should guide the next global strategy on digital health. First, foundations before frontiers. Countries need interoperable systems, digital public infrastructure, and effective digital and data governance before advanced technologies can deliver impact safely and at scale. Second, harmonization must not mean homogenization. Global standards should support countries while respecting national legal, ethical, and resource contexts. And third, and most importantly, equity must be designed in from the beginning. Countries are increasingly moving from pilots to population-scale implementation, as we've heard. India's strategy on artificial intelligence in healthcare and our regional Open Digital Health Summit are good examples of the growing momentum and strong South-South collaboration. Together, as one WHO, we stand ready to contribute our experiences and lessons learned and to help member states translate global guidance into country-level implementation and measurable impact. I thank you.
Thank you, Dr. Boehme. I shall now give the floor to Dr. Nakatani, Assistant Director General, Health Systems, Access and Data.
Thank you, Chair. Thank Member States for your valuable interventions, which highlight the urgent challenges and potential solutions. Last week, we published the latest World Health Statistics. They reinforce 3 key messages. First, health SDGs are off track. We must step up our efforts. Second, health information and data infrastructure are at risk. If we don't act, many countries will be less able to plan and deliver health care or monitor progress. Third, we need sustainable financing for resilient, equitable health systems. This is the basis for the health sovereignty, include health data sovereignty. As we work to strengthen health systems in today's world, effectively leveraging digital strategies and AI is essential, not optional. As we've heard today, the responsible health systems-wide digital transformations can enable best use of the constrained resources, but if not applied well, digital and AI can widen inequities, even harm patients. This assembly brought unprecedented interest. Member states raised the digital and AI in almost every agenda items. My team supported the more than 40 events just this week. We are reinforcing a consistent message. To benefit from digital and AI, countries need robust foundations. We must build governance standards, quality assurance, interoperability, and cybersecurity. We must also build human capacity on that. We are working with member states and partners to build digital public infrastructure, ensure safe and science-based digital tools, and address dis- and misinformation. We completed the first round of the consultations on the successor global strategy on digital health. We look forward to your input to the zero draft. It will be ready next month. WHO is ready to support the member states. Let's build modern, people-centered health system to achieve health for all. Thank you, Chair.
Thank you, Dr. Nakatani. Let me now give the floor to our Director General, Dr. Tedros.
Thank you, President of Committee A, and thank you to our member states for all the inputs. I think you're almost close to closing this session, so I'm glad that I have the opportunity to speak in Committee A before you close. This agenda item is very, very important. It started as part of our transformation. As you may remember, the Digital Health Department, the first director was Bernardo Mariano. Of course, he was promoted to New York, and then, of course, succeeded by Alan Labrick. Two very able directors who were making a difference, and the department doesn't look like new, actually, and we're very, very glad. So I want to thank Alan Labrick and his colleagues for the commitment and for their hard work. At that time, during transformation, what we said is the future of health services is digital, whether we like it or not. So investing in digital health is critical, especially for WHO, because it's only through focus on digital technology and AI that we can be part of the changing world, and if possible, even to be ahead of the curve and try to help countries on digital health and AI. Of course, now there is a crisis, unprecedented global challenges, and health financing emergency that demands actually to seize digital health and AI as opportunity. So there is crisis equals opportunity. So how can we turn this into opportunity? That's number one message, I think. And that's what we're trying to do. And I think digital health and AI could help in turning the crisis into opportunity. Like what we have been doing, by the way, with our restructuring. We faced the challenge as opportunity. And then the second is foundations first. I think it's having a foundation, which is very important when you build a house or anything. That's why the robust data systems, governance, standards, and interoperability, and so on are very important, and also avoiding fragmentations. So the foundation first is, I think, key, and that's what many speakers have already said, foundation first. And then, of course, there is the governance issue. Governance protects us, and that's the message you have passed. And WHO will do everything to really focus on ethical AI governance, transparency, accountability, and human rights. Because governance, when you say governance protects us, it covers all this. And then, of course, the other message, which I saw in the summary, although I was not here in the room, from the notes our colleagues were taking, is the equity drives investment. Digital health must serve universal health coverage, leaving no one behind. So when you do the equity, actually drives investment. And that's, I think, very, very clear. And the other important issue is it has to be country-led and people-centered. Because if it's not led by countries, owned by countries, it won't work. But when we say country-led, though, it should be people-centered. So you stressed the two, which is important. So strengthening national capacity, and especially focusing on or delivering for underserved populations, and building local ownership and skills will be critical. Then, of course, we have the new strategy ahead of us. That's the 2028-2033. And thank you for your inputs. This will inform the successor strategy presented to the will be presented to the executive board and the assembly next year. So thank you so much for your support. Thank you so much for your guidance. This issue is part of our transformation. We take it seriously, and we're very glad to hear your inputs as well, which very much aligns. We're on the same page. And from here, with the guidance you gave us and with the support, we move on. So thank you. And Mr. President, Rahmet, back to you.
Thank you, Dr. Tedros, for your thoughtful
By the
remarks.
way, the president is my Huda. He's my in-law. I call him Huda. You know what? So Kazakhstan is my country.
Thank you. Thank you very much, Dr. Tedros, for your continued leadership. Is the committee now ready to note the reports pertaining to this discussion as contained in document A79/5? The reports are noted. This grouping of agenda item is now closed. Before we can close this meeting, we must adopt the final draft report of Committee A. I shall therefore give the floor to our rapporteur, Mr. Basimwa, who will read the report in question. Mr. Basimwa, you have the floor.
Thank you, Chair. Committee A held its 11th and 12th meetings on 23rd May 2026, chaired by Dr. Timur Sultan Ganziev of Kazakhstan. It was decided to recommend to the 79th World Health Assembly the adoption of the attached resolution and decision relating to the following agenda items. Provide health. 12, review of and update on matters considered by the Executive Board. 12.8, report of the Expert Advisory Group on the WHO Global Code of Practice on the international recruitment of health personnel. One resolution entitled WHO Global Code of Practice on the international recruitment of health personnel. 12.9, draft updated global action plan on antimicrobial resistance. One decision. Thank you, Chair.
Thank you, Mr. Basimwa. I understand the committee is willing to adopt this report as read out. Are there any objections? I see none. The report is adopted. Well, distinguished delegates, Secretariat, ladies and gentlemen, we have now completed all the work entrusted to Committee A during the 79th World Health Assembly. Over the past few days, we have engaged in extensive discussions across a wide range of health issues of global importance. Member states reaffirmed their commitment to advancing universal health coverage through stronger primary health care, sustainable financing, resilient health systems, and supported healthcare workforce, while continuing efforts on communicable and non-communicable diseases, including mental health. We also addressed critical issues related to the health emergencies, pandemic preparedness and response, recognizing the importance of continued cooperation and trust in strengthening global health security. Despite the many challenges facing the world today, this week's discussion showed a shared determination to continue advancing health for all together. I sincerely thank all delegates for their constructive engagement, patience, and flexibility throughout what has been a very intensive week of work. As someone coming from Kazakhstan, I was particularly encouraged to hear throughout many discussions the continued importance that member states attach to primary health care and health equity, principles that remain at the heart of the Alma-Ata Declaration and continue to guide our collective efforts today. It has been a great honor and privilege to serve as a chair of Committee A during this assembly. I would also like to thank my vice chairs and rapporteur for helping guide our work smoothly throughout this very busy week. Many thanks also to the DG, to the regional directors, the assistant director generals, and the WHO Secretariat as a whole for their engagement and representativeness during our deliberations. I would like to express my sincere appreciation to the Secretariat of Committee A, the legal office, our interpreters, translators, conference officers, technical team, and all WHO colleagues working tirelessly behind the scene to ensure the smooth conduct of our meetings. Let me thank my country's colleagues, the delegation of Kazakhstan, and the permanent mission in Geneva for their support throughout this assembly. Distinguished delegates, I now declare all businesses allocated to Committee A closed. Thank you very much, and I look forward to seeing you all shortly in plenary.
Meeting is called to order. A very good morning, ladies and gentlemen. We shall start our work this morning with the review and the adoptions of our third report. You may refer to document A79/40 draft. I would like to give the floor to our rapporteur, who will read out the draft report. Mishalaka Kujur, you have the floor.
Good morning, everyone. 23 May 2026, draft A79/40, third report of Committee B, draft. Committee B held its 5th and 6th meetings on 22 May 2026, chaired by Dr. Kwabena Minta Akando, Ghana. It was decided to recommend to the 79th World Health Assembly the adoption of the attached one decision and one resolution relating to the following agenda items. Power and performance. 20. Collaboration within the United Nations system and with other intergovernmental organizations. 20.1. Reform of the global health architecture and the UNAT initiative. One decision. 20.2. Communications of the United Nations Secretary General as depository of the Constitution of the World Health Organization. One resolution as amended. Thank you.
Thank you, Ms. Kujur. Are there any comments or observations from the floor? I see none. May I then take it that the committee adopts its third report? I see no objection. It is so decided. This report will be submitted to the next meeting of the plenary. Now, we'll now resume discussions on sub-items 15.1, 15.3, and 15.4 under Promote Health. We will continue with the established list of speakers from yesterday's afternoon session as projected on the screen. I give the floor to Guatemala.
Gracias, señor vicepresidente.
Thank you, Vice Chair. We're referring to 15.3, the health of indigenous peoples. We reaffirm our commitment to the right to health for indigenous peoples and the strengthening of a model based on equity, relevance, and interculturality. We've developed policies to deliver health services in socio-cultural and linguistic contexts of Xinca, Maya, and Garifuna peoples, including the development of specific guidance capacity building programs, participative governance models, and the recognition of the traditional practice and knowledges in health. However, there are still challenges related to the interface between the public healthcare system and the health systems of the indigenous peoples, strengthening human resources with cultural relevance and knowledge, the relevance of information, and intercultural context, as well as multi-level focuses in institutions and strategic planning, are key. We're continuing to strengthen governance mechanisms, intercultural dialogue, social participation, and intersectorality, moving towards an intercultural model of health which is inclusive, respectful of diversity, and in particular, the cosmovision of the indigenous peoples. Thank you.
Thank you, Guatemala. I would like to invite the delegate of Nigeria, followed by Ethiopia.
Chairperson, on Agenda 15.4, Nigeria aligns with the statement delivered on behalf of the African region. Nigeria remains concerned that all 6 global nutrition targets are off track. This reflects our national situation, where stunting stands at 36%, wasting at 7%, and exclusive breastfeeding at 29%, despite ongoing effort. With declining development assistance for nutrition, the risk of reversing hard-won gain is significant for high-burden countries like ours. Nigeria underscores that primary health care must be the organizing principle for nutrition action. Nutrition should be fully integrated into primary health care service packages, quality standard supervision system, and performance measurement, not treated as a vertical program. Nigeria encourages WHO to expand structured learning platform, regional peer learning, virtual communities of practice, and implementation research partnership to accelerate progress on breastfeeding, dietary diversity, and anemia reduction. On Agenda 15.1, Nigeria welcomes the continued prioritizing of rehabilitation as a core component of the universal health coverage. We commend WHO for progress in defining effective coverage, identifying tracer conditions, and developing global indicators. The focus on chronic primary low back pain and the integration of service need, utilization, and quality provides a practical framework for monitoring rehabilitation performance. Nigeria encouraged WHO to focus on high-impact areas, including strengthening national capacity for rehabilitation data collection and reporting, integrating rehabilitation into primary health care where most Nigerians seek care. Nigeria remains fully committed to advancing rehabilitation and nutrition as essential components of universal health coverage and look forward to continued collaboration with WHO and partners to ensure accessible, affordable, and high-quality services for all who need them. I thank you.
Thank you, Nigeria. I would like to invite Ethiopia, followed by Mexico.
Thank you, Chair. Ethiopia aligns with the Africa Regional Statement delivered by Angola. We thank the DG for the consolidated report and stress the importance of sustaining the global focus on rehabilitation as an essential component of comprehensive health systems. Ethiopia wishes to highlight 3 key issues. First, rehabilitation must be explicitly embedded in national health information systems and within the WHO-UHC Service Coverage Index. We request WHO to disseminate the rehabilitation indicator set. Second, targeted investment is warranted to address the rehabilitation workforce deficit, especially in developing countries, including through targeted investment in pre-service training, task-shifting frameworks, and retention strategies. Third, strengthened support for national adaptation of guidance on rehabilitation. We call on member states and partners to treat rehabilitation as a measurable, fundable component of UHC investment. Regarding agenda item 15.4, Ethiopia commends the Secretariat for the support on maternal, infant, young child nutrition and supports the call to intensify implementation of the comprehensive implementation plan. We achieved a 73% of early initiation of breastfeeding rate and 57% exclusive breastfeeding coverage and wasting among children under 5 declined from 11 to 5%, demonstrating the impact of this investment. Ethiopia calls for leveraging nutrition-sensitive social protection mechanisms and exploring new, non-traditional and innovative sources of financing for nutrition. Together, we can fulfill our shared commitment under UHC and realize a healthier, more equitable future for all. Thank you.
Thank you, Ethiopia. I would like to invite Mexico, followed by Nepal.
Gracias, señor presidente.
Thank you, Chair. The future plan of action for the health of indigenous peoples should reflect the diversity, context and cosmovision of these communities. It should be built on their active participation and comprehensively address the social determinants of health, including education, nutrition and water, sanitation and social protection. You need to drive this from a perspective of human rights, interculturality and linguistic and cultural groups. 364 linguistic variations exist in Mexico, and linguistic barriers are still a structural barrier to social inclusion. In 2006, Mexico carried out a national consultation for a law on indigenous peoples, which would be under Article 2 of the political constitution, which has recently been reformed. With regard to 14.5, we are driving comprehensive approaches in the first 1,000 days of life, including breastfeeding, supplementary appropriate nutrition, nutritional monitoring, early detection of risks from pregnancy. We have the national strategy for breastfeeding, the cooperation of the Hospital of Children with 250 hospitals part of that program. We have a national network of breast milk banks, which is expanding. We're taking measures with regard to commercial alternatives, which are undermining breastfeeding, and also with regard to ultra-processed produce. We're taking legal steps. And that's in accordance with the strategies, for example, Resolution WHA 7418, sponsored by Brazil, Mexico, and other member states, which is committed to the public health of our populations. Thank you.
Thank you, Mexico. I would like to invite Nepal, followed by Brunei Darussalam.
Thank you, Chair. Nepal appreciates the Director General for the report under this agenda item. Nepal has expanded community-based and decentralized rehabilitation services, enabling equitable access for underserved and remote populations. Our efforts are focused on enhancing multidisciplinary service delivery in primary health care and enhancing access to essential diagnostics, medicines, and technologies that underpin quality rehabilitation. On agenda item 15.4, we believe that improving maternal, infant, and young child nutrition is fundamental to achieving universal health coverage and the Sustainable Development Goals. However, climate change, food insecurity, and socio-economic inequities continue to threaten the hard-earned progress. Malnutrition in all its forms, including the undernutrition, micronutrient deficiency, and the rising burden of overweight, continues to undermine our health, development, and well-being across the generations. Nepal has made consistent progress in reducing malnutrition rate and expanding access to essential nutrition interventions, while further strengthening efforts in anemia prevention and early childhood development. Nutrition is being systematically integrated into the primary health care, and digital tools are being harnessed to enhance service delivery as well as monitoring. Nepal encourages WHO to prioritize the following 3 strategies to strengthen rehabilitation services: developing clear guidelines for integrating rehabilitation across all levels, including in emergencies; strengthening country capacity for the early prevention and multi-sectoral action together with global and regional support; advance digital tools to further reinforce rehabilitation measures as well as ensure adequate maternal. Nepal remains committed to strengthening rehabilitation and advancing maternal and child nutrition for the equitable, resilient, and sustainable health systems. Thank you, Chair.
Thank you, Nepal. I would like to invite Brunei Darussalam, followed by Tanzania.
Thank you, Chair. Brunei Darussalam recognizes that rehabilitation and nutrition are fundamental investments in resilient, equitable, and people-centered health systems across the life course. As populations age, non-communicable diseases rise, and health emergencies become more frequent and complex. The need for accessible rehabilitation services and strong nutrition policies has never been greater. On rehabilitation, we support efforts to integrate rehabilitation within primary health care, universal health coverage, and emergency preparedness and response. We welcome the development of global targets and indicators towards 2030 and underscore the importance of indicators that are practical, measurable, and adaptable across different national contexts, supported by a strong and realistic baseline. On maternal, infant, and young child nutrition, Brunei Darussalam remains committed to strengthening early life nutrition as a foundation for healthier societies and sustainable development. We remain concerned that progress towards global nutrition targets remain uneven, particularly in relation to anemia in women, low birth weight, childhood overweight, and exclusive breastfeeding. Accelerated and sustained action is therefore essential. Brunei Darussalam is currently developing its national maternal, infant, and young child nutrition strategy for 2026 to 2035, with priority focus on strengthening health system, creating supportive environments, enhancing monitoring, research, and evidence-based action. At the same time, we also recognize emerging challenges, including digital marketing and misinformation, which require stronger regulatory responses and continued international cooperation and technical support. Chair, Brunei Darussalam reaffirms its commitment to advancing rehabilitation and nutrition as essential pillars of universal health coverage and sustainable development, so that all people at every stage of life can live healthier, more dignified, and productive lives. Thank you.
Thank you, Brunei Darussalam. I would like to invite Tanzania, followed by Pakistan.
Honorable Chairperson, in Tanzania, the demand for rehabilitation services has been increasing due to the growing burden of non-communicable diseases, injuries, congenital conditions, aging populations, and other chronic conditions. Efforts have been made to integrate rehabilitation services into all levels of healthcare. Rehabilitation services at the community level are provided mostly by community-based rehabilitation centers. We have continued to strengthen the rehabilitation data collection system under supervision of WHO expertise, whereby the Rehab HMIS system was developed and was integrated into the electronic medical record used for data collection in secondary and primary healthcare facilities. In addition, to ensure the availability of assistive products is taken into account, we have prepared the National Priority List for Assistive Technology, which aligns with the WHO Priority List for Assistive Products. Tanzania has included rehabilitation services into health insurance schemes, and this has reduced out-of-pocket payments for therapy sessions and purchasing of assistive devices. Tanzania stands firmly in favor of embracing the political declaration on strengthening rehabilitation along with its ambition targets. We call upon the Secretariat to steadfastly support Member States in tackling the growing challenge posed by injuries from road traffic accidents, aging population, and non-communicable diseases. I thank you, Chair.
Thank you, Tanzania. I would like to invite the delegates of Pakistan, followed by Ukraine.
Merci, Monsieur le Président. Le Pakistan prend la parole sur...
Thank you. We're taking the floor on item 15.4. We recognize maternal and infant nutrition as a key in child development. National data reveals a considerable burden. 40% of children under 5 are stunted, 17% are affected by wasting. More than 12 million are affected by chronic malnutrition. 41% of pregnant women are anemic, and 20% of newborns are underweight at birth. So Pakistan has taken a multi-sectoral, integrated approach throughout the life cycle, allocating the priority to the first 1,000 days from conception to the age of 2. Our national frameworks, notably the Multi-Sectoral National Strategy for Nutrition 2018 to 2025 and the National Strategy for Nutrition for Mothers to 2027, are aligned with the SDGs and aligned also to elections at the regional and national level. We are committed to further investment, multi-sectoral coordination, as we seek to enhance the delivery of community services. However, at the global level, the lack of nutrition financing is threatening the hard-won gains and also the lives of millions of women and children. So we call on the international community to maintain and grow investments in nutrition, strengthen support for nutrition systems that are piloted by countries, and promote resilient food programs in the face of climate change. Thank you very much indeed, Chair.
Thank you, Pakistan. I would like to invite Ukraine, followed by Eswatini.
Thank you, Mr. Chair. On item 15.4, maternal, infant and young child nutrition, Ukraine thanks for the report, which clearly demonstrates that global progress towards nutrition targets remain uneven, particularly in fragile and conflict-affected settings. For Ukraine, protecting maternal and child nutrition is an essential component of health system resilience and recovery. We strongly support integrating nutrition targets into primary health care and maternal and child health services. Essential nutrition intervention must remain accessible even during emergencies and disruption, especially for vulnerable women and children. At the same time, many countries face the double burden of malnutrition, where nutrient deficiencies and childhood obesity coexist. Addressing this challenge requires not only counseling, but also a healthier food environment and practical prevention measures. In this regard, schools remain a key platform for promoting healthy nutrition habits from an early age. Ukraine continues implementation of the school nutrition reform, including updated nutritional standards, healthy school meals, and expansion of free meals, particularly in frontline and border regions. We support WHO guidance on healthy school food environment and school food and practical measures that make healthy choices easier and more accessible for children and families. Finally, we emphasize the importance of technical support and capacity building for countries under pressure, including support for early prevention of malnutrition and integration of nutrition across health and food systems. Ukraine remains committed to cooperation with WHO and partners to accelerate progress and reduce inequalities in maternal and child nutrition. I thank you.
Thank you, Ukraine. I would like to invite now Eswatini, followed by Suriname.
Thank you, Chairperson. The Kingdom of Eswatini reaffirms its commitment to health equity across all populations. Under our National Health Sector Strategic Plan of 2024 to 2028, Eswatini has mandated that all health facilities deliver rehabilitative services across all the 4 regions of our country, while our National Disability Plan directly targets the decentralization and expansion of rehabilitation services to persons with disabilities. On Indigenous health, we continue integrating culturally grounded care and community participation into our national frameworks. Regarding maternal, infant, and young child nutrition, Eswatini has made measurable progress in reducing stunting and sustaining exclusive breastfeeding, while partnering with FAO and WHO to strengthen nutrition-sensitive food systems within persistent food insecurity. We urge the WHO and partners for a sustained targeted technical and financial support to small, climate-vulnerable nations as we accelerate progress towards universal health coverage. I thank you, Chairperson.
Thank you, Eswatini. I would like to invite Suriname, followed by Palestine.
Thank you, Mr. Chair. Suriname welcomes the report on the health of indigenous peoples and reaffirms its steadfast commitment to leaving no one behind in our collective pursuit of universal health coverage. In recent years, Suriname has significantly intensified its efforts to improve the health and well-being of our indigenous communities. Recognizing the unique geographical and socio-economic challenges faced by these populations in our interior, our national strategy focuses heavily on securing equitable access to healthcare, abuse prevention programs, and the structural reinforcement of primary healthcare services. Mr. Chair, these achievements are the result of strong national execution by our Ministry of Health, the Regional Health Service, and the medical mission effectively complemented by invaluable international solidarity. In particular, we highly appreciate the strategic support of PAHO and WHO for their indispensable technical guidance and health system strengthening, the CARFA for enhancing our public health surveillance capabilities. While we celebrate this progress, we remain fully aware of the persistent health disparities that indigenous peoples face both globally and locally. Effectively protecting their health requires not only medical intervention, but also the active safeguarding of their traditional knowledge, cultures, and environments. Suriname remains deeply committed to working alongside the WHO and our international partners to build resilient, culturally sensitive health systems that guarantee health and dignity for all. Thank you, Chair.
Thank you, Suriname. I would like to invite the delegation of Palestine.
Thank you, Mr. Chairperson. On item 15.4, in Palestine, particularly Gaza Strip enclave, the catastrophic situation due to the Israeli occupation, genocidal war, and blockade result in extreme food insecurity. Over 90% of young children and pregnant breastfeeding women face severe food poverty, with minimal and extremely limited dietary diversity. Nutrition is compromised by lack of hygiene, clean water, safe feeding, and acute malnutrition, increasing the risk of mortality. Pregnant and breastfeeding Palestinian women face high risks, including severe malnutrition. Poor nutrition is coupled with extreme stress, trauma, and the horrific conditions of life, living in crowded IDP shelters. Approximately 126,000 children under 5 are at risk of failing to meet their full developmental potential due to starvation and poor nutrition imposed by the Israeli colonial regime. The intense Israeli aggression has disrupted health systems, restricting access to antenatal, postnatal care for women. Acute malnutrition is still rising, and many infants face developmental delays. To conclude, Palestine takes note of the report of maternal, infant, and young child nutrition. I thank you, Mr. Chairperson.
Thank you, Palestine. As I have no more delegations on my list, I would like to invite the representative of the United Nations and international organizations to give their remarks. And I invite International Atomic Energy Agency. Okay, I would like to continue. IAI is not in the room. Several non-state actors in official relations with WHO have requested the floor on this sub-item. I shall first give the floor to a representative of Federation Handicap International. You have the floor.
Thank you, Chair. Handicap International Federation, supported by the World Rehabilitation Alliance, recognizes the 2023 Rehabilitation Resolution as a historic milestone. Since 2017, over 90 countries have strengthened rehabilitation through national strategies and regional frameworks. Recent funding cuts threaten progress, particularly in low and middle income and crisis-affected settings. We urge Member States to deliver on commitments through political engagement, financing, and timely reporting against agreed indicators, recognizing functioning as a third dimension of population health alongside mortality and morbidity. We urge WHO to publish the timeline for the global status report on rehabilitation. The 2.6 billion people who need rehabilitation cannot be left behind. We stand ready to collaborate. Thank you for your attention.
Thank you. I would like to invite Helen Keller, International.
Thank you, Chair. Progress towards global nutrition targets has slowed or stalled, with anemia now affecting nearly 1 in 3 women and millions of children still experiencing stunting and wasting. These trends reflect persistent gaps in diet quality, health services, and equitable access to care. Proven cost-effective interventions, including breastfeeding promotion, maternal micronutrient supplementation, improved complementary feeding, and early detection and treatment of malnutrition, must be delivered at scale through primary health care systems and high-quality food systems. We urge member states to accelerate investments in integrated nutrition services, strengthen protections for breastfeeding, and prioritize vulnerable and crisis-affected populations to reach global nutrition targets. Thank you.
Thank you. I would like to invite International Associations for Dental Research.
IADR, with support from FDI, welcome the focus on accelerating progress, strengthening primary healthcare integration, and reducing inequalities in maternal, infant, and young child nutrition. Oral health is closely linked to early life nutrition and remains underrepresented in current frameworks. Early feeding practices are key determinants of early childhood caries risk, including protective practices such as breastfeeding and limiting exposure to free sugars. Aligned with the Global Oral Health Action Plan, we emphasize prevention, life course approaches, and integration within primary health care. We encourage member states to shape healthy early life environments by protecting breastfeeding and restricting the digital marketing of breast milk substitutes and unhealthy foods with high levels of free sugars. We also underscore the importance of implementation research and improved data systems to track nutrition and oral health outcomes. Thank you.
Thank you. Now, International Baby Food Action Network.
Chair, a new threat of infant health is disaster capitalism. Firstly, the intrinsic contamination of formula, a child's first ultra-processed food, has led to legal actions on infant deaths and illness. A single contaminated ingredient was distributed to 130 countries, causing unprecedented recalls. Poor surveillance, lack of transparency, fraud, and poor crisis management have eroded public trust in the current food system, dependent on a handful of corporations. Secondly, Codex Alimentarius may soon allow weaker labeling of food products in emergencies. This opens the door to commercial exploitation, double standards, and unethical dumping of products in the global south. Member states should please send delegates, health delegates to Codex who can ensure that products for babies are excluded from this proposal. I thank you.
Thank you. I would like to invite now International Lactation Consultant Association.
Thank you, Chair. ILCA emphasizes breastfeeding as a life and cost-saving intervention, having the largest impact on child mortality of any preventive intervention. The DG's report shows improvements in breastfeeding rates, though still below targets. It's critical to increase investment in breastfeeding, including training the workforce and ensuring the minimum recommended 6 counseling contacts. Formula marketing undermines breastfeeding. Effective implementation and monitoring of the code, including digital marketing, remains imperative. Contamination-related recalls were exacerbated by cross-border digital marketing, causing serious illness and family distress, often with a lack of clear information or sufficient resources for families and health systems. Breastfeeding is a human right and a powerful driver of health equity, improving health outcomes for the dyad, communities, and populations worldwide. Thank you.
Thank you. Now, International Pharmaceutical Students Federation.
Honorable Chair, distinguished delegates, speaking today on behalf of the International Pharmaceutical Students Federation, representing over 600,000 members, and as a young mother, able to be here today because supportive systems were within reach. IPSF recognizes that many individuals, particularly within the health workforce, continue to face barriers to adequate maternal and child care support. We affirm that maternal, infant and young child nutrition is fundamental to healthier futures and resilient health systems. The education, leadership, and professional contributions of many young mothers depend on inclusive and supportive systems. We therefore call on member states to strengthen breastfeeding support, ensure access to affordable, nutritious food, and adopt family-friendly policies protecting the health, dignity, and well-being of mothers and children. Thank you.
Thank you. Now, Knowledge Ecology International.
Here. Relevant to work on the health of indigenous peoples is a 2005 standard published by the Institute of Electrical and Electronic Engineers, or IEEE, on the recommended practice for provenance of indigenous peoples' data. This was developed by a committee of the IEEE Society of Social Implications of Technology. The standard addresses disclosure of indigenous peoples' relationships and/or links to data and information that facilitates indigenous peoples' governance, decision-making, participation, collaboration, and engagement in and for current and future uses of indigenous peoples' data. This is known as IEEE Standard 2890-2025. Thank you.
Thank you. Now, Medical Women's International Association.
Thank you, Chair. The Medical Women's International Association, representing 45 national associations across 8 geographical regions, is concerned by the slow progress towards global maternal, infant and young child nutrition targets. We emphasize that nutrition is fundamental to universal health coverage and healthy life course outcomes. We urge member states to strengthen integration of nutrition targets into national health policies and primary health care systems, particularly in fragile and conflict-affected settings. We further support stronger protection of breastfeeding and regulation of unmonitored digital advertising of breast milk substitutes. Greater investment is needed in prevention of malnutrition, maternal nutrition, and resilient food systems to reduce inequalities and protect the health of women, infants, and young children. I thank you, Chair.
Thank you. Now, Medicus Mundi International Network Health for All.
Thank you, Chair. This statement is supported by the People's Health Movement. We welcome the request to extend the period of consultations for 1 more year to ensure a broader reach of Indigenous peoples' participation in the development of a draft global plan of action. We call on the WHO to provide adequate funding for this consultation to ensure effective participation and inclusivity. In particular, funding should enable the following: more extensive awareness raising of the consultation process amongst Indigenous peoples, opportunities for in-person consultations in all WHO regions, and language support services that allow Indigenous peoples to make their contributions in their preferred languages. We stand in solidarity with Indigenous peoples worldwide currently resisting a capitalist, extractivist system that is destroying Mother Earth and therefore their livelihoods. Thank you.
Thank you. Now, Medicine for Malaria Venture.
Thank you. On item 15.3, Medicines for Malaria Venture is supportive of a participatory plan to protect the health of indigenous peoples, including addressing the high malaria burden affecting several communities due to disruption of ecosystems, difficult access to health services, and climate change. MMV is proud to have contributed to the development and recent rollout last month of an innovative medicines among the Yanomami children of the Amazon. This is pediatric tafenoquine, a new single-dose and child-friendly treatment which is supposed to close the gap in the treatment of Vivax malaria. MMV is supportive of underserved population in the effort to malaria eliminations and is committed to continue to support equitable access to medical innovations for indigenous peoples. Thank you.
Thank you. Now, Mofendi International. He's not in the room. I'd like to invite NCD Alliance.
On item 15.4, NCD Alliance, supported by the World Obesity, welcomes Member States championing WHO's acceleration plan to stop obesity and those adopting legislation aligned with the International Code of Marketing of Breast Milk Substitutes. We express concern that only 33 countries have substantial legal alignment, risking the achievement of breastfeeding targets. Moreover, with estimates showing 35.9% of young children consuming sweet beverages on the previous day, action is critical. We urge member governments to integrate nutrition targets into national health strategies, enforcing fiscal policies like sugar-sweetened beverage taxes, restricting marketing of unhealthy foods, adopting mandatory front-of-package food labels, promoting breastfeeding, and safeguarding policy from conflicts of interest. Implementing these evidence-based measures is critical to reversing the childhood obesity epidemic and reducing future NCD risks globally. Thank you.
Thank you. Now, Rare Diseases International.
Thank you, Chair, distinguished delegates. On item 15.4, Rare Diseases International welcomes the report and highlights the importance of including rare diseases within maternal, infant, and young child nutrition efforts. Many rare conditions, particularly metabolic and genetic disorders, depend on timely nutritional interventions, including specialized diets and supplements, to prevent severe disability or death. Yet, access to these often simple, life-saving interventions remains uneven, especially in low and middle-income countries. Integrating rare diseases into nutrition programs, newborn screening, and primary care can enable early diagnosis, early intervention, and greatly improve outcomes. We call on member states to strengthen equitable access to essential nutritional products and ensure that nutrition policies address the needs of children living with rare diseases. Thank you.
Thank you. Now, the Global Alliance for Improved Nutrition. They're not in the room. Now, the Save the Children Fund.
Thank you, Chair. A deepening child nutrition emergency is unfolding. Almost half of countries with progress data are off track to achieve the World Health Assembly wasting target. Only 90% are on track to achieve the 2030 exclusive breastfeeding target, and less than 1% are on track for the anemia target. We ask member states to prioritize strategies to address wasting, anemia, and breastfeeding. Include children aged 10 to 19 in the anemia and overweight targets to address the growing burden of malnutrition among adolescents. Integrate nutrition in policy and budgets across all sectors so children can survive and thrive. Ensure the resolution on digital marketing of breast milk substitutes and the code are translated into national law. Thank you.
Thank you. Now, the Worldwide Hospice Palliative Care Alliance. Not in the room. Okay, please.
Representing Worldwide Hospice Palliative Care Alliance, item 15.1, rehabilitation is a neglected but essential part of universal health coverage. Today, together with palliative care, rehabilitation aims to improve functioning and quality of life for individuals experiencing illness-related suffering. Globally, more than 2.4 billion people would benefit from rehabilitation, yet as many as 50% do not receive the care they need. There must be an increased focus on rehabilitation as a core component of UHC, a service delivery model that combines palliative care and rehabilitation can improve workforce and cost efficiencies. We urge member states to strengthen their commitment to rehabilitation as part of essential health services for people with disabilities and others whose illness-related suffering compromises function. Thank you.
Thank you. Now, Wonka Association.
WONCA welcomes the WHO Global Plan of Action for the Health of Indigenous Peoples, especially its focus on rural populations, multidisciplinary teams, and support for indigenous-led health services. To turn this plan into action, we ask member states to focus on 4 critical actions. Explicitly recognize family doctors and rural generalists as essential for culturally safe, continuous care. Create policies and plan for workforce sustainability and retention of indigenous health workers. call for immediate, decisive action to eliminate structural racism and correct inequitable access to care in remote communities. Committed digital health tools and AI must be co-designed with Indigenous peoples and ensure Indigenous data sovereignty to actively support self-determination. Thank you.
Thank you. Now, World Cancer Research Fund International is not in the room. Now, I would like to invite World Federation of Public Health Associations. Is not also in the room. Now, World Heart Federation.
Thank you, Chair. Rehabilitation is an essential health service that delivers evidence-based, cost-effective interventions to reduce recurrent events and hospitalizations, as well as support individuals to live longer, healthier, and more productive lives. In this context, WHF calls for cardiac rehabilitation to be reframed as a broader approach to lifelong cardiovascular health, one that provides ongoing, people-centered care and ongoing support for people living with cardiovascular disease. Yet, we note with concern that access remains limited, especially in LMICs. We urge member states to ensure availability, affordability, and equitable access to quality and timely cardiovascular rehabilitation across the continuum of care and at all levels of the health systems, including in local communities, and integrate cardiovascular rehabilitation into NCD strategies, UHC, PHC, and emergency preparedness plans. Thank you.
Thank you. Now, World Stroke Organization is not in the room. I would like to invite World Vision International.
Thank you, Chair. World Vision International welcomes the continued work to advance progress towards the global nutrition targets and their operational indicators, as well as implementation of the Breast Milk Substitutes Code. With stagnating progress, health ministries must urgently take ownership of nutrition and champion it multisectorally, especially with finance ministries, to ensure harmonized financing for nutrition across multiple sectors. Taxes on unhealthy food products can increase revenue for nutrition and enable strengthening of the health workforce, data systems, and supply chains at the community level. These actions must be done in tandem with other government ministries to ensure the affordability of healthy diets. Financing must be unlocked to implement national nutrition plans multisectorally and comprehensively deliver the essential nutrition actions. Thank you.
Thank you. Now, Global Self-Care Federation.
Chair, distinguished delegates, GSCF welcomes the progress reported under document A79/26 and particularly notes the explicit recognition of macronutrient supplementation in the 2025 WHO topical briefs as essential to staying on track with the 2030 global nutrition targets. Vitamin mineral supplementation is a high-impact, cost-effective public health investment. It is particularly visible in 4 areas. Number 1, equity and inclusion. It supports vulnerable groups, including pregnant women and children, as well as persons of older age. Number 2, UHC contribution. It lowers healthcare costs through preventative use. 3, NCD prevention. Iron, folate, iodine, and calcium reduce anemia, maternal mortality, and preterm birth, lowering lifelong NCD risk. And number 4, health system resilience. It strengthens population immunity and crisis preparedness. We highlight that vitamins, minerals, and supplements are evidence-based self-care products that complement fortification and support health across all life stages. I thank you.
Thank you. Now, Ayudin Global Network. Not in the room. I'd like to invite Movendi International.
Movendi International welcomes the work on the Global Plan of Action for the Health of Indigenous Peoples and consultative. Movendi International members are from and work with indigenous communities who are living with experiences of severe harm alcohol is causing. Through our consultations with the indigenous communities in the Americas, Africa, and Asia Pacific, the harm caused by the products and practices of alcohol companies consistently emerged as a major driver of violence, injury, and mental ill health. Alcohol harm in indigenous communities is disproportionately high and is a result of colonial exploitation, corporate exploitation, and commercial determinants, as well as policy failure. We call on the Secretariat and all member states to fast-track alcohol policy action for health promotion in indigenous communities. Thank you.
Thank you. As there are no more speakers on my list, I would like to give the floor to the Secretariat to respond to any questions raised. I'd like to invite ADG Jeremy Farrar. The floor is yours, Jeremy.
Thanks very much, Chair, and good morning all. Very honoured to give this on behalf of, with a regional perspective from the regional directors and also from HQ. And thank you for all your comments over the last couple of days, advice and support. As you've all made clear, rehabilitation needs are rising worldwide, driven by a growing burden of non-communicable diseases, disability, conflict and injuries. Effective rehabilitation is essential for quality of life, independence, self-esteem, and also in reducing long-term healthcare costs. However, millions of people are left with unmet needs, as you have commented. Resolution WHA 76.6 highlights the importance of integrating rehabilitation into health systems, integrated into universal health coverage, including in emergency response and preparedness, and also in palliative care. We encourage all Member States to strengthen workforce capacity, including in partnership with the WHO Academy, improve data and indicators, and leverage digital and innovative solutions. We welcome the support for the first Global Rehabilitation Status Report to be launched in 2028. Those unmet needs reflect broader health system inequalities, as again many of you have mentioned. Indigenous peoples, numbering almost 500 people globally, are custodians of rich cultures, knowledge systems, yet face persistent inequalities in the realisation of their right to health, including barriers to quality and culturally appropriate health services. Resolution 76.16 called for a global plan of action for the health of Indigenous people, developed through an inclusive approach with Indigenous people and a broad range of partners to ensure the plan is informed by diverse perspectives and grounded in lived experience. This plan will provide a framework to promote equitable services, strengthen participation, and support Member States in advancing the right to health of Indigenous people. We appreciate the multiple actions Member States are taking and your very strong support over the last 2 days to accelerate towards 2030 targets for maternal, infant and young children nutrition. These actions are increasingly integrated with a life course approach, and we recognise the critical importance of the first 1,000 days to the rest of an individual's life, as so many of you have commented on, including strengthened maternal, infant and child nutrition, quality antenatal and postnatal care, promotion of exclusive breastfeeding and targeted evidence-based nutrition, micronutrition supplement, while addressing underlying barriers such as food insecurity and strengthening regulation of digital marketing of breastfed milk substitutes. We appreciate the stronger focus on overweight and obesity, healthy and sustainable diets, and by prioritising early nutrition, we can break the intergenerational cycle of malnutrition, disease, poverty, and supporting healthier and productive populations. We'd also like to thank the many WHO collaborating centres who've contributed so much to this work. Thanks. Back to you, Chair.
Thank you, ADG Jeremy Farrar, for the response provided. Is the committee ready to note the reports contained in the document A79/5? I see no objection. The reports are noted. Is the committee ready to approve the draft decision entitled Draft Global Plan of Action for the Health of Indigenous Peoples, contained in the decision EB 15810? I see no objections. The decision is approved. This grouping of agenda items is now closed. We will now take up the grouping of the following agenda items under Promote Health. Sub-item 15.2, Wellbeing and Health Promotion, as its bullet point. Outcome of the WHO Commission on Social Connection, and sub-item 15.5, Draft Strategy on the Economics of Health for All. The relevant documents are A79/5 and A79/5 at 1. Under sub-item 15.2 and 15.5, we are invited to consider the draft resolution and decision recommended by the Executive Board in decisions EB 1589 and EB 1588, respectively, contained in the document EB 158, 2026, Rec. 1. The floor is open for discussion. I would like to invite the delegations from Colombia to be followed by France.
Muchas gracias, señor presidente. Excelencias.
Thank you, Chair. It's an honor for me to make this statement on behalf of an interregional group of 61 member states, including Albania, Germany, Armenia, Australia, Austria, Barbados, Belgium, Benin, Brazil, Bulgaria, Cabo Verde, Canada, Cuba, Denmark, Ecuador, Spain, Estonia, Finland, France, Georgia, Greece, Ireland, Iceland, Marshall Islands, Italy, Latvia, Lithuania, Luxembourg, North Macedonia, Maldives, Malta, Mauritius, Mexico, Moldova, Monaco, Montenegro, New Zealand, Norway, Netherlands, Panama, Papua New Guinea, Peru, Poland, Portugal, United Kingdom, Romania, San Marino, Slovenia, South Africa, Switzerland, Suriname, Sweden, Thailand, Ukraine, Uruguay, Vanuatu, and my own country, Colombia, amongst others. This is a summarized version of our statement, whose entire version will be published on the website of the Assembly of the World Health Organization. The slogan of the global health of this year, Together for Health, that supports science, is a powerful reminder of the role and the importance of the WHO, and plays an important role in understanding how important well-being and health are. Since the creation of the WHO, scientific progress and multilateral cooperation have revolutionized the health outcomes throughout the world. The eradication of smallpox and the incredible reduction of maternal mortality rates. WHO has a central role to play in the world and will play a significant ongoing role in the development of roles and standards and the generation of data. We recognize the importance of well-being and the promotion of public health. These are efforts that should include efforts that are driven by communities. Healthcare systems should be supporting persons with an evidence-based approach that promotes their health, their human rights, and the dignity throughout the course of life. The right to the highest level of mental and physical health, including sexual and reproductive health rights. However, that is still something that is beyond the reach of millions of peoples. 350 million people throughout the world contract one of the 4 major sexually transmitted diseases each year. 1 out of 6 suffers infertility throughout their life. 1 out of 3 women is victim of physical or sexual violence. And 1.7 billion women throughout the world are in need of family planning. Evidence shows that when women and children have control over their body and their reproductive decisions, there are benefits for health, such as the reduction of non-desired pregnancies, mortality and morbidity for mothers, and neonatal mortality, and the levels of sexually transmitted diseases. A comprehensive approach to sexual and reproductive rights would improve well-being and health, allowing girls to stay in school, increasing the participation of women in the active population, and driving the Sustainable Development Goal achievement while reducing poverty. This is an assembly which marks the beginning of a transition to the reform of the global health architecture and moving towards the election of a new DG next year. It's more important than ever that the WHO and member states guarantee that science and evidence are at the core of this organization's work. With science at the center of our work, we can strengthen this organization and the global health architecture through cooperation, mutual respect, and a shared commitment to evidence-based solutions. In that way, we can guarantee the health, the well-being, and dignity for all.
Thank you, Colombia. France, followed by Burundi.
Merci, Monsieur le Président.
Thank you, Chair. France welcomes the work of the WHO relating to social connection, well-being and the economics of health for all, which emphasize the growing importance of social, economic and environmental determinants in public health. Well-being should be considered as an objective of public policy beyond simple traditional economic indicators. Social connection in this light is a key determinant of health. Loneliness, isolation, and other have huge impact on mental, physical health and cohesion in society. Fighting social isolation is an important lever for preventing poor health and promoting good health. France considers that health and well-being should be fully integrated into economic decisions and global public policies. At the national level, health policies have an increasing impact on socioeconomic determinants for well-being. This is a development that is strengthened by prevention policies, the development of social policy, and structuring intersectorial government institutions. At the European level, France is participating actively in Prevent NCD, Mentor, and PRISM, which are contributing to improving determinants of health. We support the guidance proposed by the WHO, notably the development of cross-cutting public policies, the strengthening of pan-government or whole-of-government approaches, the intersectoral approach, which creates an interface between public policy, social inclusion, sustainable development, and economic policy, strengthening the research and solid, robust evidence, and the development of harmonized assessment tools. It emphasizes the importance of establishing consistency and harmony between existing international frameworks and guaranteeing a strong public policy approach and investment. Thank you very much indeed.
Merci, France. Burundi, followed by Thailand. Microphone for Burundi, please.
Monsieur le Président.
Chair, Excellencies, distinguished delegates, I have the honor to take the floor on behalf of the African Group, representing 47 members of WHO Africa region. On the report on social connection, the Africa Group welcomes the report of WHO Commission on Social Connection that highlights a vital determinant of public health and collective well-being. Loneliness and social isolation have significant impact on physical and mental health, aggravating chronic diseases and weakening social cohesion among young people, the elderly and vulnerable groups in particular. African Group sees the strengthening of social connection and a strategic investment to build more inclusive, resilient and healthier societies. We welcome the political guidelines, measurement tools and solutions based on evidence proposed in the report. We support the integration of social connection in public health policies, sustainable development programs, and community initiatives. We encourage WHO to strengthen intersectoral cooperation and support to member states in order to promote social cohesion, mental health, and collective well-being. Regarding the strategy on economics of health for all, 2026-2030, the Africa Group welcomes the strategy proposed on economics of health for all that recognizes health as a strategic investment and a driver of inclusive prosperity, sustainable development, and resilience. In a context marked by inequalities, economic crises, and climate change, and increasing health challenges, this strategy underscores the need to guide economic policies towards the well-being of populations and strengthen health systems. The Africa Group supports the whole-of-government approaches, equity, gender equality, social participation, as well as investment in health. We reassert our commitment to economic policies based on social justice, solidarity, sustainability, and universal health coverage in line with the 2063 Agenda of the African Union and Sustainable Development Goals. Thank you.
Thank you. I would like to invite Thailand, followed by Pakistan.
Thank you, Chair. Thailand delivered this statement on behalf of SEA member states.
We appreciate the Director General for preparing the report included under these agenda items. Across the region, member states are advancing healthy and active living through whole of government and whole of society approaches. This leads to policy development in addressing environmental, social, commercial, and economic determinants, with the goal to promote inclusive, equitable health for all through multi-sectoral partnerships. Moreover, health must be integrated into all policy. Our region implements health-focused economic policy, along with including sugar, sweetened beverage, or SSB tax, along with taxation on alcohol and tobacco. Similarly, Bhutan Gross National Happiness Framework emphasizes human happiness and well-being over economic growth alone. Chair, we highlight the 3 points to accelerate the progress. First, universal health coverage is recognized as an investment in human capital and sustainable development. Additionally, primary health care, equitable health financing, digital health, and evidence-informed policy making are important components to achieve health and well-being for all. Second, social connection is fundamental to holistic health to population across life cycle. Strengthening social participation in health-related policy development alongside public health action that enhance health literacy, comprehensive health promotions, and participatory governance are essential to building healthier and more socially connected communities. And third, the region is advancing healthy cities and community-based approaches that integrate urban planning, transport, and public spaces. Chair, we request the WHO to revitalize the agenda on healthy and active cities. Health in all policies and healthy setting includes schools, workplaces, and health facilities by providing technical support and practical options to accelerate the implementations. Finally, the Southeast Asia region stands ready to work with all member states, WHO, and international partners to advance a sustainable, inclusive, and value-based health economy for all. Thank you, Chair.
Thank you, Thailand. I would like to invite Pakistan, followed by Ecuador.
Thank you, Chair. Pakistan has the honor to deliver this statement on behalf of the Eastern Mediterranean region. The Eastern Mediterranean region faces unique challenges, including conflict, mass displacement, and economic instability, which place vulnerable groups such as refugees, migrants, and young people at severe risk of social disconnection. Loneliness and isolation in these contexts are both social issues and significant risk factors for early death, cardiovascular disease, and diabetes. Conflict-driven displacement, destroyed services, poverty, stigma, and digital mismatch and divides disrupt social support, widen mental health treatment gaps, and intensify isolation, particularly among young people. We recommend that member states formally include social connections in their national health strategies to promote health and well-being and strengthen the social fabric of urban environments. We advocate the Healthy Cities program as a sustainable multi-sectoral platform to formally integrate social connections into national and local health strategies. We welcome the draft global strategy on the economics of health for all as requested by WHA 77.13. The strategy aligns with the DG's call to reorient economies towards equity, resilience, and well-being, and complement WHO's transformation agenda by positioning health as a productive social and economic investment. Countries of the region have begun to operationalize key components of this approach, with many advancing dialogue between their health and finance ministries to protect health spending and macro fiscal pressures. Several have embedded health within national development, recovery, and climate agendas, recognizing its role in human capital and social stability. Despite progress, Chair, the region faces structural challenges, including constrained fiscal space, debt vulnerabilities, large informal sectors, and repeated shocks from conflict, displacement, and climate change. These conditions reinforce short-term decision-making and limit investments in prevention, resilience, and common goods for health. We call for adoption of the strategy with strong implementation support for fragile and middle-income countries, systematic engagement with finance and planning authorities, alignment with international financial institutions, and sustained WHO financial, normative, and technical support. We also urge investment in country capacity to translate this approach into concrete fiscal and policy reforms. I thank you very much.
Thank you, Pakistan. I'd like to invite Ecuador, followed by Dominican Republic.
Señor Presidente.
Chair, distinguished delegates, Ecuador recognizes that health does not just depend on medical care. It is built in communities, in schools, in families, and the opportunities that people have to live with dignity and hope. That's why we're driving policies to strengthen the promotion of health throughout the course of life, promoting physical activity, mental health, sexual and reproductive health, and creating safe and healthy environments. All this is being developed with a community-driven approach which is inclusive and equitable, particularly for those populations facing vulnerabilities. Further, we recognize the importance of social connection as a fundamental health determinant. Isolation has a huge impact on the physical and mental health of our population. Creating support networks and connections is a way of preventing disease and building stronger and more resilient societies. In relation to the economy of health for all, investing in health, we believe, should not be seen as a cost, rather an investment for sustainable development, productivity, and the reduction of equality gaps. Strong healthcare systems generate well-being, protect families, and contribute to the growth of our countries. And finally, Ecuador would reiterate its commitment to international cooperation, solidarity, and shared work between member states to guarantee that health and well-being become a reality for all. Thank you.
Muchas gracias, Ecuador. I would like to invite Dominican Republic, followed by Iceland.
The Dominican Republic supports the draft strategy on economic aspects of health for all and shares the central vision, namely that the economy should be serving health and benefit from it. Health and healthcare systems are not just a cost. They constitute an essential investment to build inclusive, resilient, and sustainable economies. This is a logic which also leads us to conclude, in the context of the promotion of health and well-being, that the progress of societies is not something that can just be measured by traditional economic indicators. The well-being of individuals should be the central thrust of public action, integrating coherently social, economic, and health actions, including the environmental dimension in decision-making. Both of these areas are supported by the guiding principles which we value, seeing people at the center and ensuring that the approach of a whole government encompasses equality, a holistic approach, national leadership, and a clear basis. We believe it's a priority to carry out assessment impacts on health policies which have an impact in the area of labor, trade, etc., incorporating well-beings which understand the impact of investment in health simply beyond economic indicators. We cannot restrict ourselves by a tight financial framework. We need a full understanding of what aligning with our national priorities looks like. For these measures to be able to bear fruit, we would emphasize the importance of having intersectoral mechanisms which strengthen the guiding role of the health sector as a key strategic player in the policy development. We need measures which can be adapted to the context of each individual country's situation. Thank you.
Thank you, Dominican Republic. I would like to invite Iceland, followed by Slovakia, apologize.
Thank you, Chair. Iceland supports the draft strategy on the economics of health for all. We welcome its recognition that health is not a cost, but an investment in resilient, inclusive and sustainable economies. This aligns closely with Iceland's long-standing commitment to a well-being economy approach, where policy decisions are guided not only by economic growth, but by the health and well-being of people and communities. In this context, Iceland has for several years convened an annual Well-being Economy Forum, bringing together governments, experts and stakeholders to advance practical approaches to integrating health and well-being into economic policy. We emphasize three priorities. First, whole of government and whole of society action. We must strengthen collaboration across sectors and promote social participation. Secondly, practical implementation, including tools and evidence that support decision-making across ministries. Third, equity and long-term value, ensuring that investments improve both health outcomes and broader societal well-being. Ultimately, health for all cannot be achieved by the health sector alone. It requires political commitment, international cooperation, and long-term investment in people and communities. Let us work together to build societies where everyone has the opportunity not only to survive, but to live a healthy, dignified, and fulfilling life. Thank you.
Thank you, Iceland. I would like to invite Slovakia, followed by United Arab Emirates.
Thank you, Chair. Slovakia welcomes the outcome of the WHO Commission on Social Connection and strongly supports the recognition of social connection as a fundamental determinant of physical and mental health. As a youth representative, I speak to this issue from direct experience. Social isolation and loneliness are not abstract public health concepts for my generation. They are a daily reality that shapes mental health, academic performance, and long-term well-being in ways that health systems are only beginning to measure. Slovakia is taking early steps to address this. Our national project on mental health and prevention in schools, running through 2026, introduces systematic monitoring of youth mental health and builds prevention tools directly into the education system. However, we recognize that domestic efforts need global frameworks to build on. We welcome the Executive Board's call for a whole-of-society approach and for coordination among primary health, social and community services. Slovakia calls on WHO to develop concrete indicators to track social connection and loneliness in national health information systems and to ensure that youth social isolation is explicitly recognized as a public health priority in WHO guidance. We have not yet built health systems that treat social connection as something worth protecting. The WHO Commission work gives us the foundation to change that. Thank you, Chair.
Thank you, Slovakia. I would like to invite United Arab Emirates.
Thank you, Chair. The UAE commends WHO leadership on both the health promotion and health economics agendas and welcomes the draft strategy on the economics of health for all. The UAE firmly believes that health is not a cost but a strategic investment, guided by our national framework for well-being and longevity, centered on start well, live well, and age well. We take a lifespan approach that addresses social determinants and prioritized people-centered integrated care. This commitment is translated into action through national policies on mental health, healthy lifestyle, women's health, and health of people with determination, supported by AI and digital health. The UAE values the economics of health strategy, emphasis on policy coherence, equity, country leadership, and cross-sectoral collaboration. We recognize the WHO's essential role in technical assistance and knowledge sharing and call for clearer operational guidance to strengthen member states' capacities in health economics and intersectoral actions. The UAE remains committed to the WHO Global Framework on Well-being and Health Promotion and to supporting the full implementation of both strategies. Thank you.
Thank you, UAE. Distinguished delegates, several constituencies of non-state actors in official relations with WHO have requested the floor on this grouping of agenda items. According to the privileges confirmed by relations with WHO, I have the pleasure to give the floor to the constituency of non-state actors presented by International Council of Nurses.
Thank you. Before I start reading the constituency statement, these are the non-state actors co-signing the statement. FIP, International Pharmaceutical Federation, ICN, International Council of Nurses, WMA, World Medical Association, World Confederation for Physical Therapy, International Association for Dental, Oral, and Craniofacial Research, Women in Global Health, International Society of Nephrology, International Alliance of Patients Organizations, IAPO, International Society for Prosthetics and Orthotics, World Federation of Societies and Anesthesiologists, International Federation of Biomedical Laboratory Science, World Organization of Family Doctors, WONCA, Global Health Partnerships, World Federation of Chiropractic, Alliance for Health Promotion. 4 of the supporting organizations, FIP, ICN, WMA, and World Physio, are in the World Health Professions Alliance, with 47 million health professionals and an MOU with the WHO. An economy of health for all is impossible without sustained strategic investment in the people who deliver health. There is no economic prosperity or population health without a skilled, supported, protected, and adequately resourced health workforce. Health workforce is an essential pillar of sustainable, effective healthcare systems. With accelerating population aging, demand for healthcare services will increase. Addressing the global health workforce crisis requires long-term, sustainable strategies that prioritize workforce well-being as a core investment, put more women in leadership roles, and address health worker mobility equitably. Investments should be guided by research evidence and the health workforce's perspective to identify effective workforce policies. The health and well-being of health personnel directly influence quality of care, patient safety, and economic productivity. Neglect leads to higher turnover, absenteeism, preventable errors, or unavailability of medical devices, imposing significant and recurring costs on national economies. In contrast, investing in workforce well-being and education improves care quality and safety, strengthens retention, enhances system resilience, and delivers substantial economic returns. The economic evidence is clear. Every dollar invested in health system generates returns of $2 to $4 US. Higher health workforce density is associated with longer life expectancy, improved productivity, and sustained economic growth. Health innovation and macroeconomic strategies must prioritize public health value, equity, and population needs, strengthening primary health care, health promotion, and workforce capacity globally. This statement's signatories support the adoption of the draft strategy. I thank you.
Thank you. I would like to invite Saudi Arabia, followed by Singapore.
شكرا. تؤكد المملكة العربية السعودية.
Thank you very much. We would like to affirm that the economy of health for all is a transformation as we see our approach to health. The economics of health for all is understanding that it's not just a case that health is a burden on the economy. We need to take into account social determinants of health, integrate them into public policy on the basis of clear evidence for decision-making, which would enable us to improve the outcomes of our health interventions. We should emphasize the role of health in all areas of policy. That would constitute a governance reform across sectors, taking into account social and economic factors. As we look towards our plan, our vision for the country in 2030, we will ensure that our governance model takes into account the principles of equity in all areas of legislation so that we can adopt laws based on evidence and establish a more equitable, more sustainable healthcare system. We've also made progress in the area of health policy, the prevention of, or rather the inclusion of digital technologies, the program we have for health personnel and partnerships between the public and private sector are all parts of this. Our view is that investment in the link between health and social and economic development is something that can achieve better health outcomes and also move us towards achieving the SDGs. Thank you.
Shukran, Saudi Arabia. I would like to invite Singapore, followed by Iran.
Singapore thanks the Secretariat for the reports on well-being and health promotion and the outcome of the WHO Commission on Social Connection. As populations age worldwide, addressing loneliness and social isolation becomes increasingly critical for health system sustainability and individual well-being. We strongly support integrating well-being into public health. To support and promote successful aging, Singapore launched Age-Well-SG, a national program in November 2023 that aims to support our seniors to age actively, stay socially connected, and be cared for within their communities. This represents a nationwide transformation across housing, transport, active aging, and care services to anchor aging in the community. Central to Age-Well-SG is active aging centres that serve as key community nodes, leveraging common spaces and community-wide efforts to engage seniors. AACs offer active aging programs across 5 key domains: social, physical, health, cognitive, learning, and volunteerism. We support the WHO's proposal for a Global Social Connection Index and welcome guidelines to reduce isolation. We remain committed to sharing practical lessons from our experience and working with WHO and member states to embed social connection in our approach to public health. Further details are in our written statement. Thank you.
Thank you, Singapore. I would like to invite Iran, followed by Slovenia.
Thank you, Chair. Iran's health programs are grounded in 3 decades of community-based whole-of-government and whole-of-society approach. Toluca Health Promoting Council at neighborhood and institutional level, household intersexual action has been estranged to severe all population, including host communities for foreign nationals. Iran has trained over 8 million health volunteers and community health ambassadors supporting sustained community engagement and resilience. During the COVID-19 pandemic, this network played a critical role in response and continuity to health service. Iran calls for enhanced political commitment, enhanced multi-sectoral resource mobilization, and expanded WHO facilitated exchange of regional experience. The economic of health for all represent a transformative approach that recognizes health as both a drive and an outcome of sustainable development. By placing health and well-being at the center of economic decision-making, it promotes more equitable, resilient, and people-centered economic. Its key strengths include whole-of-government action, equity, social participation, and the alignment of fiscal, trade, and industrial policies with health objectives. Respect for national ownership and community-led implementation is essential to ensure effectiveness and sustainability. I thank you.
Thank you, Iran. I would like to invite Slovenia, followed by Poland.
Honorable Chair, distinguished delegates, Slovenia wishes to highlight that the Ottawa and the Geneva Charter are now more important than ever before for ensuring health and well-being for our populations. They provide a basis for tackling a range of issues facing healthcare systems, from health inequities and commercial pressures to challenges posed by AI, and enable us all to better focus health promotion on empowerment, inclusivity, equity, and meaningful participation. They also encourage member states to adopt a whole-of-the-government approach to address health determinants that are beyond the reach of the health sector. Slovenia has adopted a development strategy by 2030 grounded in well-being, which supports the importance of social solidarity, care for all, reducing inequities, and recognizes the importance of equitable public policies outside the health sector and engagement of all population groups through social participation for health and well-being. We are committed to contributing to achieving the goals set out in Ottawa and Geneva Charter, but are also convinced that this nationally and globally can only be done if health and well-being are recognized as priority when deciding upon financial investments at all levels. Thank you.
Thank you, Slovenia. I would like to invite Poland, followed by Brazil.
Chair, ladies and gentlemen, the well-being of individuals depends on a balance between physical and mental health, both of which are essential foundations of a resilient society. In today's rapidly changing world, ensuring psychophysical well-being requires a whole-of-government approach and strong social awareness. Prevention remains one of our highest priorities. Last year, Poland introduced a nationwide program, My Health Adult Health Check, aimed at strengthening early detection of chronic diseases and promoting healthier lifestyles. The program is available through primary healthcare clinics and offers regular preventive assessments for all adults. In less than 1 year, almost 4 million people joined it, which shows importance of prevention-oriented healthcare policies. Ensuring equal access to healthcare also requires reducing barriers for vulnerable groups. Through the Accessibility Plus program, Poland is improving physical, digital, organizational, and communication accessibility in healthcare facilities. It supports especially senior citizens, persons with disabilities, with mental health challenges, reflecting WHO recommendations on health equity and inclusive systems. Beyond healthcare services, it is essential to promote healthy lifestyles and strengthen public awareness of mental health as an integral part of overall well-being. People should know where and how to seek psychological support, while communities should foster strong social ties that reduce isolation. Governments also bear responsibility for creating conditions that support a healthy work-life balance, including policies that reduce excessive workload and promote rest and recovery. Only through a comprehensive, prevention-oriented and inclusive approach can we effectively safeguard the psychophysical well-being of our citizens. Thank you.
Thank you, Poland. I would like to invite Brazil.
Mr. Chair, we convene at this pivotal moment to advance global health promotion. Well-being demands a whole-of-government approach, transcending clinical indicators to actively address social and environmental determinants. Brazil embraces this vision, recognizing that sustainable outcomes require cross-sectoral collaboration and community-driven solutions. Under President Lula's leadership, Brazil has translated these principles into concrete action. The Viva Mais Brazil strategy mobilizes citizens around preventive habits, emphasizing physical activity and nutritious diets. We revitalize community health academies to reduce psychotropic dependency through guided exercise, while strategic partnerships promote workplace and school-based wellness. Integrative practices like meditation and acupuncture are expanding within our public system, and primary care nutrition services addressing obesity have increased significantly. Mental health support remains anchored in strengthened psychosocial networks. In regard to Agenda Item 15.5, Draft Strategy on the Economics of Health for All, we must recognize that health is a cornerstone of national prosperity, not a fiscal burden. To ensure universal coverage endures, member states must commit to advancing three simultaneous fronts. First, stable and counter-cyclical financing must protect health systems from economic volatility. Second, strategic purchasing guided by value and efficiency will optimize resource allocation. Third, primary care must be strengthened as the central coordinator and cost anchor of the entire system. Drawing upon the Executive Board's emphasis on robust data and multi-sectoral engagement, we urge all nations to scale preventative investments and align domestic frameworks with international standards. By establishing concrete mechanisms that link economic policy and human dignity, we collectively strengthen global resilience. Let us champion holistic well-being and equitable financing, ensuring sustainable development leaves no one behind. Brazil stands ready to share experiences and foster a comprehensive environment where every individual thrives. I thank you, Mr. Chair.
Thank you, Brazil. Now I would like to invite NCD Alliance.
Supported by Women in Global Health, the Global Health Council, International Diabetes Federation, Society on Thrombosis and Hemostasis, World Cancer Research Fund International, World Heart Federation, World Stroke Organization, International Alliance of Patients Organizations, Vital Strategies, Multiple Sclerosis International Federation, and the Union for International Cancer Control. WHO's strategy on the economics of health for all offers a vital shift. positioning health as an investment, not a cost. This is urgent. Non-communicable diseases, NCDs, the world's biggest killers, will cost the global economy an estimated $47 trillion between 2010 and 2030. Conversely, NCD best buys have a high return on investment. We urge Member States to adopt this strategy and commend its feasible immediate actions, strong normative foundations embedding social participation, equity, sustainability and science, the call for policy coherence, integrating health into tax, trade and industrial policies, and connecting social policies with universal health coverage. However, a critical gap remains: the necessity of distinguishing economic determinants of health, like austerity, from commercial determinants. Public and private economic interests are distinct. We urge Member States to, 1, recognise the impacts of commercial determinants of health and restrict private sector collaboration to relevant actors and strict safeguards modelled after the principles of the WHO FCTC Article 5.3. 2, develop a health taxonomy extending beyond private investment supporting systems-wide actions. 3, promote cross-sectoral budgeting reflecting health impacts across sectors. 4, strengthen fiscal policy coherence, including health-promoting subsidy reforms. 5, elaborate further on trade policy and health, protecting access to medicines. 6, strengthen attention to market dynamics for health products. 7, ensure international cooperation to support countries with structural constraints, such as small island developing states. As global health architecture reform continues, this agenda must align health financing with disease burdens and address broader determinants to ensure a resilient, equitable future. Thank you.
Thank you. I would like to invite the distinguished delegates from Malaysia, followed by Philippines.
Thank you, Chair. Malaysia notes the report and reaffirms our whole-of-government approach to well-being. The National Cabinet Committee on Health sets strategic priorities and oversees the national agenda for Health in Malaysia 2020 to 2023. We would like to highlight the following best practices, such as community empowerment with 21,900 My Champion volunteers serving as grassroots health agents. We also have a wellness service delivery and outreach, which is a network of 38 wellness hubs, supported by 16 Wellness on Wheels and 6 WOW Zoomers mobile units, which delivers integrated services including risk screening, behavioral interventions, and referrals. Malaysia's National Health Literacy Policy and National Blueprints for Behavioral Insights in Health anchor an evidence-based culture of healthy living. We seek WHO's technical support in volunteer retention models, monitoring and evaluation systems for behavioral outcomes, and cross-sectoral digital data interoperability. Malaysia welcomes the emphasis on pro-health taxes and commercial determinants of health. In addition to excise duty on tobacco and alcohol, we have implemented sugar-sweetened beverage tax with evident impact on reformulation by the industry. Malaysia is also working towards implementing a mandatory front-of-pack labeling grading system to further empower consumers to make informed dietary choices and create market incentives for the reformulation of food and beverage products towards healthier profiles. We welcome the commitment to strengthening country capacity and cross-sectoral collaboration as the foundation for delivering health for all. For middle-income countries navigating complex health financing transitions, WHO's technical support must be practical, context-sensitive, and aligned with national priorities. Malaysia stands ready to share our experience, pledging to be an active partner as this strategy moves from commitment to action. Thank you.
Thank you, Malaysia. I would like to invite Philippines, followed by Bhutan.
Thank you, Chair. The Philippines supports the adoption of the resolution on well-being and health promotion as recommended by the Executive Board. Recognizing that health and well-being are shaped by broader economic, environmental, and social determinants, we emphasize the need for sustained whole-of-government and whole-of-society approaches grounded in multi-sectoral collaboration and meaningful community engagement. Aligned with the Universal Healthcare Act in the Department of Health Health Promotion Framework Strategy 2030, the Philippines continues to strengthen settings-based and life course approaches that integrate health promotion into programs, policies, and local government systems. Our priority actions focus on promoting healthy lifestyles, improving health literacy, in strengthening mental health and psychosocial well-being, and fostering supportive and socially connected environments across communities, learning institutions, and workplaces. We underscore the importance of continued collaboration among member states in advancing evidence-informed, culturally responsive, and community-driven approaches that promote health and well-being across the life course. On Agenda 15.5, the Philippines supports the adoption of the decision on the draft strategy on the economics of health for all. We welcome its central message that health is an investment in inclusive, resilient, and sustainable development. At a time of constrained fiscal space and global uncertainty, it is essential that economic and health policies reinforce one another. For the Philippines, this agenda is closely linked to universal health care. Sustained investment in health systems, primary care, and preventive services, supported by stronger governance and public financial management, is vital to improving outcomes and protecting households from financial hardship. We encourage the WHO Secretariat to support implementation through practical tools, capacity building, and knowledge exchange while ensuring alignment with UHC and SDG work streams. Thank you.
Thank you, Philippines. I would like to invite Bhutan, followed by Iraq.
Thank you, Chair. The draft Global Strategy on Economics of Health for All is a landmark initiative that redefines health not as a cost, but as the foundation of sustainable and inclusive development. It comes at a time as rising inequalities, climate-related health risks, and limited development financing continue to challenge progress towards universal health coverage. The strategy calls for placing health and well-being at the center of economic policy. It highlights as a strategic investment that strengthens societies and economies. Our country faces the dual challenge of strengthening health systems while ensuring inclusive growth within limited fiscal space. The strategy reinforces that investing in health is one of the most effective pathways to strengthen long-term economic resilience. For Bhutan, this vision aligns closely with our development philosophy of gross national happiness, which places people's well-being at the center of development. We have long recognized that true progress goes beyond economic growth and includes physical, mental, and spiritual well-being of our people. In this sense, health is both a moral priority and an economic investment. The draft strategy strengthens our commitment to universal health coverage, equity, and sustainability. In conclusion, Bhutan strongly supports the adoption of this timely and visionary strategy and looks forward to working with the WHO and member states to translate it into action. Thank you.
Thank you, Bhutan. I would like to invite Iraq, followed by Sweden.
Mr. Chair, the Republic of Iraq and the Arab Republic of Egypt are honored to present the draft resolution entitled Radiation Health, Strengthening Protection, Preparedness and Response. This draft comes as response to the increasing health challenges resulting from exposure to ionizing and non-ionizing radiation, whether from environmental sources or professional or medical ones, in addition to the risks related to the radiation emergencies, which exemplifies the understanding by the international community the importance of active response and rehabilitation, and in order to limit the impact on health on the long term and short term. The increasing use of radiological technologies, including medical imaging, radiotherapy, and radiopharmaceutical, imposes on us a collective responsibility to use them safely and to have equitable use of these vital technologies while providing the necessary protection for the patients and those working in the health sector and the public at large. Chair, the draft has been mindful from the outset that the text be balanced, comprehensive, and consensual, taking into consideration the priorities of the member states and their various national needs, especially with regards to capacity building and strengthening preparedness for emergencies and having equitable access to safe medical technology. We express our deep appreciation to the member states that have presented constructive observation during informal consultations. We look forward to continuous positive cooperation to reach a consensual resolution. And Iraq and Egypt would call upon all member states to support this draft resolution in joining and sponsoring it, as this is an important step to protect current and future generations from risks related to radiation. Thank you, Chair.
Thank you, Iraq. Now I would like to invite Sweden.
Thank you, Chair. Loneliness and social isolation are both deeply personal and a concern for the society as a whole. If we truly want to improve public health, we must break loneliness and prioritize social connection. It's just as important for health as diet and exercise. Sweden is glad that WHO has put the pressing issue of loneliness and social isolation on the global agenda. Through the work of the Commission, the groundbreaking report published last year, and the resolution adopted at WHA 78. The Swedish government prioritized work to tackle loneliness and social isolation, nationally as well as internationally. Not least for Minister for Social Affairs and Public Health, Jakob Forssmed's engagement as one of the WHO Commissioners for Social Connection. This work entails important steps forward in showing that social connection is a vital determinant of health and well-being. But we are far from the finish line. We need to move from recognition to action. I therefore welcome the continued work by WHO on this topic. A global index on social connection and the WHO guidelines on interventions to reduce social isolation and loneliness may be further steps in the right direction. Strengthening social connection is integral to realizing WHO's constitutional vision of health for all. We must continue this work and do more. We must, of course, work together to create social connections and break social isolation. I thank you, Chair.
Thank you, Sweden. Now I would like to invite Humatem.
This statement on behalf of International Federation for Medical and Biological Engineering, World Federation of Nuclear Medicine and Biology, Women in Global Health Council, Multiple Sclerosis International Federation, Global Health Partnership, and UMATEM. Honorable Chair, distinguished delegates, we fully align with the draft strategy on economics on health for all, which recognize that health systems are not merely cost, but essential investments for sustainable and equitable development. We wish to highlight the importance of investing in health technology management as a critical lever to strengthen health system efficiency, optimize resource use, and ensure that investments in medical equipment deliver long-term value. When a medical device fails, it results in significant economic losses, especially in low and middle-income countries. Investing in preventive maintenance through the training and recruitment of biomedical technicians reduces the need for costly corrective maintenance, minimizes device downtime, and generates measurable returns. Biomedical engineers play a pivotal role at the intersection of health and economic decision-making by advising hospital managers and health authorities on the design and implementation of medical device purchasing and maintenance policies. For instance, they elaborate technical specifications, avoiding both low-end and oversized devices, and ensure standardization of equipment fleets leading to economies of scale. Investing in maintenance and biomedical professions is essential to achieve resilient health systems. It does not only save costs, it ensures reliability and longevity of medical devices, including diagnostic capacity, ultimately improving patient care and hospital operations. Let us spread together the culture of biomedical maintenance for the benefit of health for all. Thank you.
Thank you. I would like to invite the distinguished delegation from Ireland, followed by Japan.
Honourable Chair, distinguished delegates, Ireland welcomes the report of the Director General on Wellbeing and Health Promotion and its emphasis on a whole-of-government and whole-of-society approach. We recognise that well-being must be embedded across public policy and that social connection is a fundamental determinant of both physical and mental health. Through our Ireland Healthy Framework, we are advancing cross-sectoral action to improve population health and reduce inequalities. This includes strengthening community-based initiatives, supporting social connection, and integrating well-being into decision-making across sectors. Ireland also welcomes the draft strategy on the economics of health for all. We strongly support the recognition that health is both the driver and an outcome of sustainable and inclusive economic development. Ireland supports an approach to economic policy that places health and well-being at its centre, recognising that traditional economic indicators alone do not capture the full determinants of societal progress. We believe that investment in health promotion and prevention delivers long-term benefits and is essential to resilient health systems. We further emphasise a healthy communities approach, supporting local leadership, place-based action and cross-sector partnerships that empower communities, address the wider determinants of health, and create environments that enable people to lead healthier lives. Ireland recognises the importance of strengthening the evidence base and enhancing capacity across sectors to support implementation, and we look forward to continued collaboration with the WHO and other member states. Thank you, Chair.
Thank you, Ireland. I would like to invite the distinguished delegation from Japan, followed by Finland.
Thank you, Chair. Japan attaches importance to the areas of social connection, well-being and health promotion, as well as the economics of health for all, and wishes to share 2 points. First, loneliness and social isolation, which are closely related to social connection, are important determinants of health. Japan, as a member country of the WHO Commission on Social Connection, remains committed to promoting social connection and continue to contribute actively to the discussion. In our country, a minister in charge of loneliness and social isolation has been appointed, and comprehensive legislation to promote measures against these issues has been enacted as the first of its kind in the world. In addition, Japan has established a Prime Minister-led all-ministerial headquarters advancing whole-of-government actions. Second, achieving well-being requires integrated efforts not only within the health sector, but also all areas of social policy. It is necessary to strengthen both whole-of-government and whole-of-society approaches. In particular, it is important to consider how public health can be practically integrated with policies in other sectors in accordance with each country's context. Finally, we expect WHO to share practical frameworks and best practices to support countries in advancing cross-sectoral approaches, and we will continue to share our experiences and contribute to the promotion of social connection, well-being, and health. Thank you.
Thank you, Japan. I'd like to invite the distinguished delegation of Finland, followed by Austria.
Chair, I have the honor of speaking on behalf of a group of countries consisting of Belgium, Canada, Ecuador, Estonia, Ethiopia, Latvia, Singapore, Spain, Sri Lanka, Sweden, and my own country, Finland. We welcome the strategy of economics of health for all. This strategy demonstrates the importance of greater policy coherence across sectors. Health outcomes, sustainable economic growth, social cohesion, and environmental sustainability are deeply interconnected. Strong and well-functioning health systems are an essential part of inclusive and resilient economies. They enable participation in education and labour markets for all, protect people from financial shocks, and strengthen social cohesion and trust. Fragile health systems, by contrast, undermine productivity, increase inequality, and leave societies vulnerable both to poverty and to systemic shocks. We therefore welcome the strategy's strong emphasis on the whole-of-government approach and country leadership. It is important that the strategy has been developed with due regard to guiding principles such as social participation, equity, and gender equality. The strategy provides useful guidance for member states for integrating health considerations into fiscal, labour, education, environmental and other public policies, and demonstrating the value of health as an investment through improved evidence and well-being frameworks. Strengthened dialogue across ministries as well as with the civil society, affected communities and the private sector will be critical for the success of this process. This is of particular importance in ensuring that we can effectively address the social and commercial determinants of health and promote more equitable health outcomes across populations. To ensure success of these country-led processes, WHO has a crucial role in supporting member states through normative guidance and technical assistance, and by facilitating exchange of experience across regions. To advance the economics of health for all approach, it is essential to further strengthen the integration of a sustainable economic perspective within the implementation of the strategy. In this regard, engagement with members of the panel of the WHO Council on the Economics of Health for All would provide an important platform for fostering balanced dialogue across different perspectives and reinforcing coherence between health and economic sustainability. We look forward to working with the Secretariat and partners to implement the strategy. To us, it is clear that better well-being of people is beneficial for societies and their resilience, and it is also contributing to sustainable economic prosperity that extends to future generations. I thank you, Chair.
Thank you, Finland. I would like to invite Austria, followed by Sri Lanka.
Thank you, Chair. Austria welcomes the report on well-being and health promotion. To truly promote health and well-being for all, we must address all well-known determinants of health, including social, economic, commercial, and environmental determinants. From a health policy perspective, legislative and regulative policies and actions targeting marketing strategies that encourage unhealthy lifestyles can be important tools to promote health. We need to continue building accessible and equitable public health systems that integrate health promotion as an essential pillar. Austria also welcomes a report by the WHO Commission on Social Connection, since social connection and loneliness are key determinants of physical and mental health. We applaud the WHO for its leadership in this area. Moreover, Austria welcomes the new strategy on economics of health for all. Access to healthcare is a right, not a privilege, and should not depend on income, social status, or personal networks. As the strategy points out, health and inclusive, sustainable economic development are interdependent and inseparable dimensions of societal progress. Therefore, the Austrian Ministry of Health, while bearing in mind the economic and commercial determinants of health, embraces the well-being economy's approach. Health is the foundation of strong, resilient, and equal economies. Health for all is not just a moral obligation, it is the path to sustainable and inclusive prosperity. Thank you.
Thank you, Austria. I would like to invite Sri Lanka, followed by India.
Thank you, Chair. Sri Lanka supports the adoption of the draft strategy on the economics of health of all, recognizing health not merely as an expenditure but as a strategic investment in human capital, social well-being, equity, and sustainable economic development. Sri Lanka has demonstrated its commitment through sustained public investment in universal health care, robust maternal and child health programs, and extensive public health network, and successful health promotion initiatives focused on immunization, nutrition, tobacco control, and communicable disease prevention. These investments have enabled Sri Lanka to achieve commendable health indicators despite limited resources. However, like many middle-income countries, Sri Lanka now faces several challenges, including population aging, the growing burden of non-communicable diseases, rising healthcare costs, climate-related health risks, and fiscal constraints, all of which place increasing pressure on health system. Unhealthy lifestyles, urbanization, and widening health inequalities further underscore the urgent need to strengthen preventive and promotive health approaches. Moving forward, Sri Lanka proposes to further align national policy with the economics of health for all framework by recognizing health promotion as an investment in well-being, equity, and sustainable development. In this regard, Ministry of Health Sri Lanka implements healthy settings-based programs such as healthy promoting preschools, happy villages, mother support groups, and tertiary and vocational education and training sector health promotion programs. Sri Lanka firmly believes that investing in health promotion today will reduce future disease burden, improve productivity, strengthen social connection, and generate long-term economics and social returns. Finally, we reaffirm our commitment in collaborating with WHO and member states to advance a healthier, more equitable and sustainable future for all. Thank you.
Thank you, Sri Lanka. I would like to invite India, followed by Norway.
Thank you, Chair. India aligns with the global framework for integrating well-being into public health and supports its emphasis on whole-of-government and whole-of-society approaches to advance physical, mental, social, and environmental well-being. India supports reorienting public health systems beyond disease control towards health promotion, prevention, and resilience across the life course. India's mental health program adopts a decentralized, community-based approach by integrating mental health and well-being into primary health care. Frontline workers promote awareness, reduce stigma, and strengthen community engagement, particularly in underserved areas. By embedding mental health support into everyday community life, we are making care not just accessible, but also inclusive and connected. Chair, India also recognizes that strategic investment in health is essential for equitable economic development and universal health coverage. India's National Health Policy 2017 facilitates outcome-driven public health expenditure. The Ayushman Bharat PMJ scheme, the world's largest government-funded health assurance program, provides cashless secondary and tertiary care to the most vulnerable. To sustain implementation, India suggests embedding well-being and health promotion into national and subnational planning and budgeting processes and strengthening linkages across public health. India calls for global investment in health promotion infrastructure and community-led wellness platforms as essential components of people-centered health systems. We call for strengthened global cooperation in sustainable health financing, prioritizing primary health care, integrating health impact assessments into policy making, and requests WHO support for developing necessary tools in line with national priorities. Thank you.
Thank you, India. I would like to invite Norway.
Thank you, Chair. Norway has been working with the field of well-being for over a decade. We have a measurement system and a national strategy. Throughout this work, we see especially three areas important to strive for. First, well-being must be anchored as an overarching societal goal across sectors, with strong cross-government coordination. Second, progress requires measurements and monitoring, with attention to vulnerable groups. Third, countries should invest in data infrastructure and capacity to support harmonized measurement and shared learning. Well-being is about feeling safe and included. Loneliness, social exclusion, financial problems, and poor mental and physical health can all reduce well-being. Global developments like geopolitical and economic instability, climate change, and digitalization also affect well-being, causing concerns about the present and the future. As a youth delegate, I emphasize that young people experience these challenges acutely, and our perspectives are crucial in shaping effective responses. In Norway, efforts to reduce loneliness are integrated across well-being policies. We encourage WHO to avoid establishing separate tracks on social connections and instead integrate this across existing processes while strengthening indicators, knowledge, and coordination between health, social, and community-based services. We support the economic of health for all approach and its emphasis on cross-sector collaboration. Chair, Young people are not only beneficiaries, we are also partners in shaping new policies for the future. Thank you.
Thank you, Norway. Now, International Federation of Aging.
Thank you, Chair. The International Federation on Aging delivers this constituency statement on behalf of itself and the following: Multiple Sclerosis International Federation, International Agency for the Prevention of Blindness, HelpAge International, Alzheimer's Disease International, International Alliance of Patients Organizations, International Association for Hospice and Palliative Care, World Heart Federation, World Federation of Mental Health, World Federation of Chiropractic, International Society for Biomedical Research on Alcoholism. We commend the draft strategy on the economics of health for all and its vision of centering health within economic decision-making, and urge member states to adopt this strategy and prioritize healthy aging and longevity-ready societies as a central pillar of implementation. As population age in all regions, the health and functional ability of older persons will increasingly determine the sustainability of health systems and the resilience, productivity, and social cohesion of societies and economies. Investment in healthy aging is a strategic economic and social investment. Supporting people to live longer, healthier, and more independent lives strengthens labor force participation, reduces long-term care costs, enhances international solidarity, and supports inclusive and sustainable growth. In contrast, underinvestment risks deepening inequalities, increasing pressure on health and social systems, and constraining economical potential. We call for stronger prioritization of prevention across the life course, with a particular focus on older age. Investment in health promotion, disease prevention, palliative care, timely access to care across areas such as cardiovascular, eye, brain, and mental health, and action on social determinants of health is essential to compress morbidity and to ensure that other years of life are lived in good health. Member States can prepare for demographic change by integrating a spectrum of services from prevention to palliative care, and ensuring healthy aging is central to economic, financing, and across-sectoral planning. Thank you, Chair.
Thank you, International Federation on Aging. I would like to invite the distinguished delegation from Zambia, followed by Senegal.
Thank you, Chair. Zambia aligns with the Global Core to prioritize well-being and health promotion. Our current National Health Strategic Plan focuses on achieving universal health coverage, strengthening primary health care, and addressing communicable and non-communicable diseases. To unlock the potential power to control and prevent diseases by individuals, Zambia established a functional health promotion and community health unit to focus on promoting health and well-being, which is complemented by 1, health in all policies, 2, a coordinated multi-sectoral action, 3, social and environmental determinants of health committees, and 4, existence of a health promotion strategic framework which guides interventions, including communication strategies for priority health thematic areas for communicable and non-communicable diseases. The Zambian government has embraced broader measures to enable communities to access health promotion information, including stakeholder engagement at all levels through the One Health approach. These measures facilitate the dissemination of accurate health information, dispel myths and misinformation, and support health intervention for prevention, treatment, and rehabilitation. In conclusion, we support the Global Action Plan. We wish to enhance multi-sector engagement to enhance optimal health and well-being through investing in health information sharing, addressing social determinants of health, and supporting access to health information. I thank you, Chair.
Thank you, Zambia. Now I would like to give the floor to Senegal, followed by Italy.
Je vous remercie, Monsieur.
Thank you, President. We will speak to 15.5. Our delegation would like to align itself with the statement made on behalf of 47 countries of the African region by Burundi. We thank the WHO for the quality of the report presented and for developing the 2030 strategy, which is in line with our national strategy for transforming health systems running to 2034, which dedicates human capital and human resources, as well as social equity, as central areas. We don't see health as an expenditure, but rather an investment, which can have a huge economic and financial impact. Reforms underway, such as the program and budget, based on results, allows us to progressively reorient funds towards the promotion of health, the prevention, primary health care, and protection against financial risks linked to disease. Further, the signature of the Health Compact harmonizes the coordination of national and external finances and enhances mutual accountability. Further, Senegal also has a specialized unit for operational health, which produces regularly national health accounts, maps resources, and carries out economic studies. To close, Senegal takes note of the report and would invite the Secretariat to strengthen the support delivered to members, notably through strengthening structured dialogue between these ministers responsible for finance and health, the networking of national expert units, and sharing good practice. Thank you very much for your kind attention.
Thank you, Senegal. I would like to invite Italy, followed by Gambia.
Thank you, Chair. On item 15.2, Italy welcomes the WHO Commission on Social Connection call for systemic action on social connection. We agree that the latter requires an integrated community-based approach embedded within a well-being promotion strategy. As an operational tool, social prescribing offers a promising way to turn recommendations into practice. In Italy, this is gaining traction through grassroots initiatives in primary care, mental health services, and community welfare, while WHO's relevant tools are actively disseminated among professionals to support uptake. Social prescribing is also receiving initial institutional attention. The realization of a social prescription program is now an objective of the newly approved National Plan for Mental Health. A national working group hosted by the National Institute of Health is fostering discussion among practitioners, researchers, and policymakers. Some regions are piloting structured models. In addition, an interministerial agreement on cultural welfare is creating opportunities to promote social connection. Furthermore, the National Institute of Health, with WHO Europe, is showing how art-based activities targeting new mothers can alleviate isolation and depression symptoms in a measurable way. However, in order to transition from isolated initiative to a coherent national framework, many member states, such as Italy, require an enabling environment, including clear policy guidance, sustainable funding, and increasing coordination across health, social, and community sectors. WHO can support these efforts by facilitating peer learning, providing adaptable tools, sustaining policy coherence, and supporting monitoring frameworks. I thank you.
Thank you, Italy. I would like to invite Gambia, followed by Ethiopia.
Thank you, Chair. On Agenda 15.2, the Gambia aligns itself with the statement delivered by Burundi on behalf of the WHO African region. The Gambia commends the Director General for the progress report on well-being and health promotion. We welcome the global framework for integrating well-being into public health, which rightly moves beyond traditional economic indicators such as GDP to prioritize human and global health. In the Gambia, well-being and health promotion aim to foster positive physical, mental, and social states, moving beyond the treatment of disease to the nurturing of thriving lives. Core strategies include addressing the social determinants of health, empowering communities, and building healthy environments as outlined in the WHO framework on well-being. Key actions include community engagement, sustainable development, and investment in equitable health policies. The Gambia is strengthening well-being and healthy promotion through a combination of policy reforms, community-based nutrition programs, and strategic partnerships with a focus on universal health coverage and preventive care in line with the National Health Policy 2021 to 2030. To accelerate implementation at the country level, the Gambia offers 3 practical suggestions in response to the board's call for guidance. First, we recommend that the WHO support member states in establishing interministerial well-being councils to embed well-being metrics into national budgeting and planning processes. Second, ministries of health should establish dedicated leadership units for well-being governance and clear mandates and sustainable long-term funding. Third, we request normative guidance and user-friendly digital tools for measuring well-being and particular for low-resource settings, building on forthcoming UN scoping review. The Gambia endorses this report. Thank you, Chair.
Thank you, Gambia. I would like to invite Ethiopia, followed by Tunisia.
Thank you, Chair. Ethiopia aligns with the African Regional Statement delivered by Burundi and the joint statement delivered by Finland. Ethiopia supports the adoption of the draft global strategy on the economics of health for all. The strategy's vision, an economy that both serves and benefits from a health for all, aligns with Ethiopia's National Development and Investment Plan, positioning health as a driver of economic growth and human capital and not merely a social expenditure. The strategy offers a coherent and actionable framework that's particularly relevant in navigating constrained fiscal space and current financing challenge. Ethiopia affirms the call for strengthened domestic resource mobilization, improved coordination between external and domestic funding, as advanced by the Lusaka Agenda and alignment with one plan, one budget, one report approach. Ethiopia urges member states and the WHO to accelerate efforts to contextualize and implement the global strategy. We call on partners to support and align financing with the strategy's country-led long-term sustainability projects. On agenda item number 15.2, Ethiopia takes note of the report and supports the whole of society and whole of government approach for well-being and health promotion. We have integrated well-being and health promotion into a recently revised health policy and subsequent national strategies. Ethiopia, as a country with a long history of social structure that bound its community through solidarity and social protection, continue to leverage community engagement platforms. We stand ready to strengthen partnerships and share experiences to advance well-being and health promotion. I thank you.
Thank you, Ethiopia. I would like to invite Tunisia, followed by Jamaica.
شكرا سيد الرئيس. تؤكد تونس على
Thank you, Chair. We'd like to reiterate what was already said within the Executive Board on the need to adopt an intersectoral cross-societal approach, given that health is not something that is purely limited to the health sector, but also linked to social, economic, and environmental determinants of health. We also appreciate the outcome of the WHO Commission on Social Connection, seeing that as a key determinant of physical and mental health. It's important to integrate these elements into health policy, promoting coordination between primary healthcare, social services, and societal services so that we can reduce social issues and increase general health. In partnership with the WHO, we have tried to integrate this approach to health in all of our policies through initiatives in covering prevention, sport, culture, autonomy of youth, social participation, all of which are elements that demonstrate that participating in promoting social connection and social determinants is a fundamental way of supporting health, justice, and ensures a more resilient, sustainable base for society. It's important that we develop indicators and data that allow us to monitor the progress made in the area of promoting health and well-being. With regard to the important point on the draft strategy of the economics for health for all, we also support the draft resolution on the standing of health, which we are supporting with Iraq and Egypt, and we ask for the committee to adopt it unanimously. Thank you very much.
Thank you, Tunisia. I would like to invite Jamaica, followed by Ukraine.
Chair, Jamaica commends the WHO for its leadership in advancing the global framework on well-being and health promotion and supports its emphasis on a whole-of-government and whole-of-society approach. Improving well-being requires action beyond the health sector with strong community engagement and partnerships addressing social, economic, and environmental determinants of health. In Jamaica, this approach is reflected through initiatives such as Jamaica Moves, which engages partners and promotes physical activity, healthy eating, and routine health screening across communities, schools, and workplaces. Jamaica recognizes that in the fight against NCDs, a continuous rollout of new, exciting, and engaging initiatives is important as behavior and cultural change takes time. This past year, the Corporate Workplace Wellness Challenge was launched, and several workplaces competed in nutrition and physical activity challenges. The plan is to refocus the community with activities to keep the population motivated and moving toward their targets for physical and mental well-being. The critical role of health promotion in emergency and disaster management was evident in Jamaica's experience with Hurricane Melissa. Health education teams and community workers on the ground were an essential part of spreading information that resulted Jamaica bringing a leptospirosis outbreak rapidly under control and prevented other outbreaks in the face of widespread devastation. This reinforced that empowered communities are essential to building resilience and protecting health. Jamaica remains committed to advancing the global well-being agenda. Thank you.
Thank you, Jamaica. I would like to invite now Ukraine.
Dear Chair, Ukraine thanks the Secretariat for the reports. For Ukraine, well-being and health promotion are directly linked to resilience during war and recovery after it. It affects mental health, education, employment, and long-term human capital. We support a whole-of-government approach to health promotion. Health outcomes depend not only on healthcare, but also on social protection, education, and community support. Policies in these sectors must work together. Ukraine also welcomes the work of the WHO Commission on Social Connection. Strengthening community-based services, mental health support, rehabilitation, and primary health care is essential to reduce these risks and support recovery. We support integrating well-being into public policy and economic decision-making. Investment in prevention, mental health, healthy environments should not be seen as costs, but as investments in economic resilience and recovery. In this regard, Ukraine supports further work on the strategy of the economics of health for all, including stronger evidence, technical support, and sustainable financing mechanisms, especially for countries affected by conflict. Finally, Ukraine underlines the importance of strengthening preparedness and response to radiation and health risks. For countries facing threats to critical infrastructure and nuclear safety, international coordination remains essential. Ukraine remains committed to cooperation with WHO and partners to strengthen resilient, people-centered health systems. I thank you.
Thank you, Ukraine. Now, International Union of Physiological Science.
Thank you, Chair. This constituency statement is delivered by the International Union of Psychological Science and supported by the World Heart Federation, the World Federation for Mental Health, International Association of Suicide Prevention, and Multiple Sclerosis International Federation. Today, we would like to address the economics of health for all. and the critical role of mental health in sustainable development. Health is not merely a social responsibility. It is a fundamental driver of economic growth and national productivity. Universal access to healthcare lowers the financial burden on families, reduces inequality, and enhances human capital. Mental health and suicide prevention must be recognized as an essential component of public health and economic stability. Mental health disorders, including depression, anxiety, and chronic stress, significantly affect workforce performance, educational achievement, and overall social well-being. It affects negatively individuals, families, communities, and societies. The economic consequences include reduced productivity, increased absenteeism, higher healthcare costs, and loss of income for individuals and families. Research consistently shows that investing in mental health and suicide prevention services yields substantial economic returns. Early intervention, accessible treatment, and workplace mental health programs improve productivity and reduce long-term societal costs. However, the response must go beyond cost containment. Supporting mental well-being is not only a healthcare priority, but also an investment in human capability and societal well-being. Achieving health for all requires an integrated approach that values physical and mental health equally. Governments, institutions, and communities must work together to strengthen healthcare systems, promote prevention, and ensure that mental health services are accessible to all members of society. Thank you, Chair.
Thank you. I would like to invite the delegates from Indonesia, followed by Burkina Faso.
Chair, Indonesia shares the view that health and well-being as basic human rights are not social expenses. They are strategic tools and the foundation of economic growth, productivity, and sustainable development. Stronger whole-of-government and whole-of-society approaches are therefore essential in the integration of well-being and health promotion into public policy. Our National Healthy Lifestyle Campaign, GERMAS, engaged stakeholders at all levels, including community collaboration. Through our integrated primary care approach and over 304,000 community-based health posts, supported by 1.5 million volunteers, we continue strengthening community participation, early detection, and social connectedness across the life course. Indonesia also supports economic frameworks that place health at the center of policymaking through domestic resource mobilization, strategic investment, and multi-sectoral action that advance health equity. Health improvement is a national priority backed by substantive financing. Resilient health system must be prepared for all hazards, including radiological risk. Indonesia has taken concrete steps through stronger regulatory frameworks, emergency preparedness, and multi-sectoral coordination. Our experience underscore an urgent strategic priority, cross-border cooperation to prevent the illegal movement and trafficking of radioactive materials must be strengthened now, before the next incident occurs. WHO's role is therefore critical to strengthen technical support for member states, facilitate knowledge sharing on community-driven approaches, and enhance global coordination, including on radiation preparedness. Indonesia remains committed to working with WHO and all member states to build a future where health equity is not the exception, but the norm. I thank you, Chair.
Thank you, Indonesia. I would like to invite Burkina Faso, followed by Panama.
Merci, Monsieur.
Thank you, Chair. Burkina Faso endorses the statement made by Burundi on behalf of the Africa region. We welcome the adoption in May 2025 of the resolution to promote social connection, bearing in mind that social isolation and loneliness are factors that contribute to disease and premature deaths. Burkina Faso welcomes the progress made to integrate mental health in the health services offered by implementing the strategic plan on mental health, supported by a national working group on mental health and psychosocial support that includes 21 organizations. My delegation supports the integrated inclusive approaches that are adapted to socio-cultural context to better respond to the needs of the population. We welcome the draft WHO strategy on economics of health for all which seeks to reposition health as an investment rather than a burden. With this in mind, Burkina Faso organized in March 2026 a national forum on financing of health. Its conclusions seek to increase domestic funding for health efficiency and the alignment of partners to national priorities for equitable and inclusive economy for the benefit of the population. Thank you.
Thank you. Burkina Faso, I would like to invite Panama, followed by Togo.
Gracias, señor presidente.
Thank you, Chair. Thank you also for the reports. We recognise that progressing towards health means that we need to take a focus on the economic determinants which impact sustainability, equity and efficiency of health systems, in particular social connection, whose impact on health, well-being and productivity is increasingly evident. For Panama, investing in our health also implies that we invest in more connected, inclusive and resilient societies. And that's why we've strengthened our public policy, focusing on social connection, universal coverage, primary care and healthy aging as a strategic element to prevent disease, reduce the burden on health systems and strengthen human capital. We believe that we should, as a priority, move towards more equitable and sustainable financing models which reduce the direct financial burden on homes and protect the most vulnerable, and at the same time promote community interventions which strengthen social connections and collective well-being. Our call is that there be a strengthening of international cooperation to share best practice in integrating economic, health and social policies, recognizing that health and social connection are interdependent pillars of sustainable development. Thank you.
I would like to invite Togo, followed by Republic of Korea.
Chair, Togo aligns itself with a statement made by Burundi on behalf of 47 member states of the Africa region. The well-being and health promotion must be integrated in all public health interventions and in drafting multi-sector policies that need the establishment of a global framework for the integration of well-being and public health. Togo welcomes the work done by WHO Commission on Social Connection that highlights that this connection is a key determinant of physical and mental health that must be integrated in public health policies. We're convinced that in the face of the current development of global economy, given the many crises, it is vital to reposition health not as a cost, but rather as a lasting investment by working on innovative approaches beyond the production of wealth to integrate well-being measures for all. Togo recognizes that the principle of a whole government approach and guidance by countries are vital for this model because sustainable development and progress for all must be based on national leadership, coordination between institutions, national governments and international governments. Togo encourages sharing experience and regional cooperation in order to promote approaches adapted to African context, based on values of solidarity, inclusion, and community participation. Togo takes note of the reports and invites the Assembly to adopt the relevant resolutions. Thank you.
Thank you, Togo. I would like to invite Republic of Korea, followed by Nepal.
Thank you, Chair. The Republic of Korea appreciates the report and the draft strategy prepared by the Secretariat. Regarding item 15.2, well-being and social connection, the Republic of Korea shares 2 points. First, embedding the well-being into national governance requires a solid legal and statistical foundation. The ROK enacted the Act on the Prevention and Management of Lonely Deaths to clarify government responsibilities. Additionally, we use the national quality of life indicator to measure social factors beyond GDP and guide policies. Second, utilizing digital and AI technologies is highly relevant. The RK launched the AI Welfare and Care Innovation Task Force to apply AI in social security responsibly. We expect the forthcoming WHO guidelines to incorporate digital methodologies for critical solutions. Turning to item 15.4, 5, Economics of Health for All, the Republic of Korea highlights two considerations. First, securing credible evidence on the economic returns of health investments should be a primary condition. Proceeding without clear evidence could lead to varying policy acceptance among member states. Second, recommendations should respect the domestic policies, autonomy of member states, and avoid excessive regulations. Policies on taxation, trade, and industry should maintain sufficient flexibility to reflect each nation's unique economic conditions. Thank you.
Thank you, Republic of Korea. I would like to invite Nepal, followed by Kenya.
Thank you, Chair. Nepal welcomes the discussion under these agenda items. Nepal's approach to health promotion is guided by the National Health Policy, Strategy and Action Plans, which prioritize prevention, health promotion, and action on the wider determinants of health through the whole of government and whole of society approach. We have a strong network of basic health service center at the community and more than 50,000 female community health volunteers. We are also implementing a school health program, health promotion campaign, including yoga and traditional system of medicine, psychosocial counseling, and health screening. In line with the Public Health Service Act, Nepal has institutionalized a ministerial-level public health committee to strengthen multi-sectoral coordination and policy coherence. Yet, we recognize the need to further strengthen multi-sectoral coordination, evidence generation, and monitoring systems for better outcomes. Nepal thanks the Director General for the draft strategy on the economics of health for all. We have developed a national health financing strategy which envisions progressively increasing public investment in health towards 10% of the national budget. While its implementation remains challenging, the strategy has provided foundation for advocacy, domestic resource mobilization, and reforms. Moreover, we are working to strengthen health insurance program and exploring innovative financing measures. Nepal calls for the continued technical support, knowledge sharing, and international collaboration for the health promotion, multi-sectoral action, and sustainable financing. We remain committed to advancing people-centered, preventive, and equitable approaches that improve health and well-being for all. Thank you, Chair.
Thank you, Nepal. I would like to invite Kenya, followed by Egypt.
Thank you, Chair. Kenya aligns its statement with that delivered by Burundi on behalf of the 47 member states of the Africa region. Kenya welcomes the report on well-being and health promotion and reaffirms its commitment to advancing well-being as a foundation for universal health coverage, sustainable development, and resilient health systems. Guided by national policies and WHO frameworks, Kenya has strengthened primary health care networks, expanded community health programs, integrated NCD and mental health interventions, and advanced digital health systems contributing to significant progress in health promotion. Kenya calls upon WHO to strengthen global partnership, enhance sustainable financing, support standardized well-being metrics, promote digital innovation, and advance multi-sectoral action to address social and commercial determinants of health. Kenya acknowledges the growing evidence linking strong social connections to improved health outcomes and welcomes WHO leadership in advancing social connection as a critical component of health promotion. We remain committed to a whole of government and whole of society approach, recognizing that health promotion is most effective when rooted in strong and connected communities. In this regard, Kenya welcomes the work of the WHO Commission on Social Connection and supports integration of this agenda into the ongoing work on health determinants, well-being, and health promotion beyond 2026. I thank you, Chair.
Egypt has the floor, followed by Palestine.
Mr. Chair, Egypt thanks the Secretariat for the reports under these agenda items. On well-being and health promotion, Egypt welcomes the outcome of the WHO Commission on Social Connection. Social isolation and weak community ties are increasingly recognized as determinants of poor health outcomes. Addressing these challenges requires multi-sectoral action that integrates social connection into primary health care, urban planning, education systems, and digital inclusion policies. With respect to the draft strategy on the economics of health for all, Egypt emphasizes that health is both a fundamental human right and a strategic investment in sustainable development. We underscore the importance of aligning health financing with national development priorities, strengthening public health, national financial management, and improving efficiency in resource allocation. Particular attention should be given to protecting vulnerable populations. Mr. Chair, Egypt is honored to sponsor with Iraq the draft resolution on radiation and health, strengthening global protection, preparedness, and response, and thanks the co-sponsoring countries. This initiative reflects the urgent need for a comprehensive and coordinated approach to radiation-related risks across medical, occupational, environmental, and emergency contexts. Radiation exposure from ionizing and non-ionizing radiation is well established, whether from healthcare, industry, energy production, or accidental and emergency situations, and poses complex and transboundary risks to human health and ecosystems. Furthermore, equitable access to safe technologies and monitoring systems remains a priority. Bridging these gaps is essential to ensure that the benefit of radiation applications are realized safely while minimizing risks to the populations and the environment. Egypt also stresses the need for stronger collaboration among the WHO, relevant international organizations, and non-state actors to ensure coherence in guidance, capacity building, and technical support. Egypt reaffirms its commitment to advancing this agenda and calls all member states to co-sponsor and support the adoption and effective implementation of this resolution to build resilient systems for radiation protection, preparedness, and response. Thank you, Chair.
Palestine, followed by Uruguay.
Thank you, Mr. Chairperson. Palestine aligns itself with IMRO's statement delivered on behalf of the 22 member states, including my country, Palestine. Palestine reaffirms on record its co-sponsoring to all Egypt resolutions and decisions tabled by Egypt for this WHA 79, and we support Egypt's calls for its adoption by consensus. I thank you.
Uruguay, followed by China.
Gracias.
Thank you, Chair. Uruguay would align itself with the strategy proposed by the Executive Board on the promotion of health and well-being through intersectoral cooperation with strong participation of the organized community. Since 2007, we've created an integrated system focused on extending coverage to the whole population with equity and sustainability, ensuring access to all services and medicines necessary, which make a timely and effective care possible for families and their homes. In 2024, the public financing of the healthcare system was 6.7% of GDP. The health system is not only seeking to strengthen healthcare services, but also providing improvements in social determinants. Our country has developed a sustainable strategy in fighting smoking, and we have also worked on reducing the impact of the tobacco industry in 2010. We've also created differentiated investment rules, which assured that public health measures did not violate trade agreements. We've also implemented a warning system for health care for foods in order to promote better eating and general health. Thank you.
China, followed by South Africa.
Dear Mr. Chair, China notes the draft strategy on economics for health for all and agrees with the report's view that health should be incorporated into all policies. The Chinese government is now fully implementing the fifth five-year plan for national economic and social development, which clearly sets out the strategy of prioritizing health development, improving the coordinated development and governance mechanisms in the three areas of medical services, medical insurance, and pharmaceuticals, and achieving positive interaction between health and the economy. We are also working to shift the focus from treating diseases to promoting health and provide the people with equitable, accessible, systemic, and continuous health services. We look forward to exchanging and sharing useful experience and practices with WHO and other countries. We support the draft resolution on radiation and health submitted under this agenda item. As is widely known to all, the sea discharge of radionuclides creates cumulative effects in the marine environment, and its impact on human health and the marine environment is highly uncertain. The Japanese government disregarded the serious concerns and stronger position of the international community, unilaterally and forcibly started the discharge of nuclear contaminated water from the Fukushima accident into the sea, which China has always firmly opposed. Japan is shifting the health risks posed by the nuclear contaminated water onto other countries, seriously infringing upon the right to health of people in all countries. This is extremely irresponsible act that violates international morality. We support WHO in continuous strengthening the research and monitoring radiation-related health outcomes and enhancing global coordination in the field of radiation and health. Thank you.
South Africa, you have the floor.
Thank you, Chair. South Africa welcomes the draft strategy on economics for health for all, and we align with the statement that was read on behalf of the Africa region. We extend our gratitude to the pioneers of this paradigm shift. We strongly endorse the transition from fixing the market failures to actively shaping markets, moving towards state-led mandate that ensures economic safe human health rather than capital accumulation. For South Africa, economic justice is not just an abstract concept, it is a literal prerequisite of achieving health for all. We cannot separate historical structural economic inequities from public health outcomes. In our implementation of national health insurance, we view health not as a social cost to be minimized, but as a foundation economic asset. This is why our health financing progress matrix emphasize social solidarity and domestic resource mobilization over fragmented private equity models. To operationalize this, domestic resource mobilization requires urgent structural action. Progress taxation must be placed at the center of the global and national strategies. Implementing wealth tax and financing transition tax can unlock the billions needed to finance health for all. In our nation, an annual wealth tax of up to 5% of the world's multimillionaires and billionaires alone could raise up to 2.5 trillion annually. Conversely, relying on blended and private financing is not a viable solution. Evidence consistently shows that these mechanisms harm the poor and exacerbate healthcare inequities. Chair, finally, we'd like to raise the issues that the Alma Ata vision of new international economic order remains unfinished, and South Africa is ready to take this forward. And South Africa stands ready to build the institutional foothold necessary to finish the project of economic transformation that is true health justice. I thank you, Chair.
As I have no more delegations on my list, I would like to invite the representatives of the United Nations and international organizations to give their remarks. And International Labour Organization, you have the floor.
Thank you, Chair. The International Labour Organization supports the resolution on radiation and health, strengthening global protection, preparedness and response. The ILO underscores the importance of protecting workers from exposure to ionizing and non-ionizing radiation, and strengthening national systems for prevention, preparedness and response. A safe and healthy working environment is a fundamental principle and right at work. The ILO therefore promotes the ratification and effective implementation of relevant international labour standards, including the Radiation Protection Convention number 115 and Fundamental Conventions numbers 155 and 187. The ILO remains committed to collaboration with WHO, IAEA, and other partners to ensure that worker protection remains central to the global efforts on radiation and health.
Several non-state actors in official relation with WHO have requested the floor on this sub-item. I shall give the floor to the representative of Alliance for Human Promotion.
Honorable Chair, distinguished delegates, the Alliance for Health Promotion welcomes continued efforts to advance health and well-being and prioritize social connection. Achieving equitable outcomes requires addressing the determinants of health through sustained political commitment, stronger governance, evidence-informed policymaking, and coordinated action across sectors. We encourage member states to integrate health promotion across policies, strengthen meaningful participation of communities and civil society, and reinforce action that addresses the underlying drivers of inequities in health outcomes. We further encourage WHO to support countries through practical guidance, accountability mechanism, capacity building, and stronger evidence systems that support investment in health promotion and demonstrate its social and economic benefits. These actions will be important to ensure health promotion receives sustained.
Drugs for Neglected Disease Initiative. You have the floor, please. So I have FDI, World Dental Federation.
Thank you, Chair. FDI, with the support of IADR, welcomed the report on well-being and health promotion, which emphasized cross-sectoral collaboration. With nearly 60% of the working-age population employed, workplaces are vital for disease prevention and health promotion. Oral disease affects 3.7 billion people and costs about $710 billion worldwide annually. Integrating oral health into workplace well-being strategy is both a public health and economic imperative. FDI's new Oral Health at Work report, grounded in country experiences, identified pathways to translate policy into action through cross-sectoral collaborations. We urge member states to engage employers and workplace in health promotion initiatives inclusive of oral health, invest in research and programs to identify scalable models for health promotion and well-being. Thank you.
Federation Handicap International.
Thank you, Chair. Honorable Chairperson, distinguished delegates, the resolution, Radiation and Health, Strengthening Global Protection.
International Association for Suicide Prevention. You have the floor. International Commission on Radiological Protection. You have the floor.
Thank you, Chair. Honorable Chairperson, distinguished delegates, the resolution, Radiation and Health, Strengthening Global Protection, Preparedness and Response highlights the importance of integrated, evidence-based approaches to protecting patients, workers, and the public from ionizing and non-ionizing radiation in both routine and emergency situations. Radiological protection remains a core public and occupational health function. As exposure patterns evolve and new technologies emerge, coherent, health-centered policies, robust risks assessments, effective communication, and harmonized protection frameworks become increasingly essential. Effective national systems are critical for managing radiation technologies, securing radioactive sources, strengthening emergency preparedness, and addressing ionizing and non-ionizing radiation concerns. ICRP stands ready to support WHO and member states in implementing this resolution. Thank you.
International Federation of Medical Students Associations.
Esteemed delegates and honorable chairperson, we assert that the global health crisis is not a failure of individual choice, but a product of broken systems. We must dismantle the structures that profit from ill health. Our current economic systems prioritize market expansion over social protection, deepening inequalities. IFMSA calls upon Member States to institutionalize a health in all policies framework to ensure accountability across all government sectors and transition towards an economy of well-being that measures success through health and equity metrics rather than GDP. We cannot treat our way out of a systemic crisis. We must restructure the foundation to value life over profit. Thank you.
International League Against Epilepsy, you have the floor, please. International Pharmaceutical Students Federation, please, you have the floor.
Monsieur le Président et distingués des...
Chair, distinguished delegates, health systems can only achieve universal health coverage if they prioritize health, well-being, and prevention. My organization represents more than 600,000 pharmaceutical students throughout the world, and we wish to emphasize that when it comes to health promotion, we're talking about something that's also a driver for sustainable development. We are now, in fact, celebrating the 40-year anniversary of the Charter for Health and Wellbeing, and we, in that context, commend and support all relevant public policies. We focus on human-centered, inclusive policies that fully involve young people to build a better future for us all. Thank you.
International Union for Health Promotion and Education, please, you have the floor.
Chair, the International Union for Health Promotion and Education addresses member states as we mark the 40th anniversary of the Ottawa Charter for Health Promotion, more relevant than ever to create equitable societies. We call on member states to reaffirm health promotion as a core function of resilient health systems and honour the Charter's 40th anniversary with a renewed commitment to peace as a prerequisite for health and wellbeing in the current context of polycrisis. Integrate health promotion values fully into health systems, government, design and funding inclusive of strengthening communities and workforce capacity. Uphold multilateral and intersectoral cooperation, investing in whose leadership and recognising the key role of non-state actors in bringing trusted scientific expertise and community perspectives to global health governance. Health is not merely the absence of disease, it is the foundation upon which all forms of life may thrive. Thank you, Chair.
International Union of Psychological Science, you have the... Knowledge Ecology International. If you are here, you have the floor.
Thank you, Mr. Chairman. The draft strategy on economics of health for all calls on states to, quote, ensure social protection policies benefit individuals based on risk across the life course and people experiencing poverty and social exclusion, quote. This includes persons living in states subject to trade sanctions. In principle, many governments recognize that a need for exceptions to sanctions for medicine, medical equipment, and humanitarian goods. In practice, exceptions are often poorly designed. Businesses and nonprofit entities are discouraged from or unable to navigate complex and restrictive procedures. The cost of compliance with trade sanctions and their unintended consequences are an understudied and under-remedied topic and should be discussed at the next WHA. Thank you.
Medical Women's International Association, please, you have the floor.
Thank you, Chair. Medical Women's International Association welcomes the draft strategy on the economics of health for all and its commitments to equity and gender equality. Achieving health for all requires deliberate prioritization of women facing the greatest barriers. Globally, 66% of the poorest women lack access to universal health coverage due to financial constraints, and 20% still require permission to seek health care. We agree that the contribution of non-health workers in health facilities and informal, unpaid family care workers, predominantly women, must be explicitly acknowledged and valued. Women represent nearly 70% of the global health workforce, yet hold only around 25% of leadership positions. Centering the most vulnerable women and female health professionals is essential to realizing health for all. I thank you, Chair.
Oxfam, you have the floor. Public Services International, you have the floor.
PSI expressed concern that the EHFA strategy was inadequate at the last EB. But we also expressed hope that member states could appreciate the historic significance of the EHFA in taking action. The situation since then makes optimism more difficult. Few member states have engaged with the strategy. Their comments include framing actions in the strategy as just a menu of options for gradual implementation, focusing on economic policy and growth instead of shifts in economic systems, and removal of language that limits industry participation in policy making. This will further denude the already watered-down transformative essence of the strategy. The Alma Ata Declaration and COVID-19 show that the economics of health for all requires urgent, radical, systemic changes which put people before profit and prioritizes public services. We thus urge member states to breathe meaning into the strategy for posterity. Thank you, Chair.
Rare Disease International, you have the floor.
Thank you, Honorable Chair, distinguished delegates. On item 15.2, Rare Diseases International, together with the Global Albinism Alliance, commend the different member states supporting the resolution, Radiation and Health, Strengthening Global Protection, Preparedness and Response. Several rare health conditions, including albinism, are characterized by heightened UV sensitivity, placing affected individuals at significantly greater risk of developing skin cancer. Effective preventive interventions exist, but they remain too often unavailable or inaccessible. As climate change increases UV exposure worldwide, this resolution could not be more timely. We urge member states to adopt it and allocate the necessary resources for its implementation. Too often, persons with albinism still die from skin cancer, even though it is entirely preventable through adequate protection, awareness, and access to care. Thank you.
Save the Children Fund, please, you have the floor.
Thank you, Chair. Save the Children welcomes the Economics of Health for All strategy at a moment of historic ODA collapse, with cuts risking millions of preventable deaths, including 5.4 million children under 5 by 2030. Framing health as investment is right, but this is only the start. Implementation requires country-led processes with specific milestones, country-defined domestic health spending targets, and accountability mechanisms. We call on member states to strengthen domestic resource mobilization through progressive taxation, health taxes, action on illicit financial flows, and debt resolution, with equity-driven spending targets for the most underserved. Implementation must be backed by timely, disaggregated health financing data, enabling civil society oversight. Civil society must be institutionalized as a permanent accountability partner in health financing processes, building momentum towards the 2027 UHC high-level meeting. Thank you.
Worldwide Hospice Palliative Care Alliance, please, you have the floor.
Worldwide Hospice Palliative Care Alliance on item 15.5. Thank you. As healthcare costs continue to rise, we urge member states to invest in community-based solutions for healthcare delivery. Home-based palliative care is an important part of the solution, helping avoid unplanned and unnecessary hospitalizations and emergency services for many of the sickest patients. Managing pain and other crises at home has been shown to be effective and replicable at minimal cost when high-quality training and mentoring are provided, particularly for primary care providers. We urge member states to invest in community-based solutions, including palliative care, to advance Health for All. Thank you.
World Federation of the Sporting Goods Industry. Please, you have the floor. Movendi International.
Movendi International members deliver health promotion and social connection daily worldwide. Across both reports, alcohol remains absent as a structural and commercial determinant of health. Movendi International documents the industry's role. It drives harm, deepens injustice, and obstructs evidence-based solutions. The World Health Organization and member states must address this. Effective action requires integrating alcohol policies into well-being and social connection frameworks, while applying the safeguards of WHO's Framework Convention on Tobacco Control, Article 5.3, to protect health policy from industry interference. Moreover, new Movendi International analysis shows countries recover only 13% of alcohol harm costs, making alcohol taxation one of the most underused tools for health, equity, and fiscal sustainability. The political commitments are made. Health for all must be protected. Now, member states must act, protect public health policy from industry interference, and defend the policy space needed for effective public health action. Thank you.
The National Association for Suicide Prevention, if you are ready, you have the floor.
Social isolation, loneliness, and disconnection are among the strongest modifiable risk factors for suicide. Strengthening social connection is a suicide prevention intervention. The International Association for Suicide Prevention welcomes the Commission's call for a whole-of-society approach. Government efforts must be matched by sustained investment, robust measurement, and genuine multi-sectoral collaboration that reaches beyond the health sector into education, employment, housing, and digital environments. Social connection needs to be part of national suicide prevention strategies and broader mental health policy to address the social, economic, and commercial determinants that drive isolation, and to invest in community-led solutions, particularly for young people and other populations at heightened risk. The meaningful inclusion of people with lived experience of suicide in the design and evaluation of social connection initiatives also ensures that policy reflects the realities of those most affected. Thank you, Chair.
As there are no more speakers on my list, I would like the floor to the Secretariat to respond to any questions raised. At this point, may I invite Dr. Jeremy Farrar, Assistant Director General, Health Promotion, Disease Prevention and Care.
Thanks very much again, Chair, and to all delegates, and thank you very much for all the very strong support across all of these areas. In particular, there's very strong support for the wellbeing and social connection agenda, including beyond the traditional health sector and a whole-of-government approach, which we are also now very much reflecting within our work at WHO. Social connection and well-being is going through a period of historic change at the moment, with disruption in many ways that we have been used to working in how we connect and how we communicate, reflected in every society across all ages, but importantly, distinct across those ages. And we need to have a nuanced approach to the way we respond to this, as many of you have said. It's also impacted by rapid demographic shifts, and important we appreciate and anticipate those changes rather than react to them. This is all speeding up, and it is likely that we will see bigger changes in the ways we connect and communicate with each other in the coming years. It's important to think how we will continue to have our humanity in a period of AI and such social disruption. We look forward to the anniversary of Ottawa Charter for Health Promotion later this year, and this charter is even more relevant in today's times than when that charter was developed 40 years ago, at a time when I don't think mobile phones even existed, let alone some of the other social disruptions we are seeing today. The WHO Commission has helped recognise social connection and well-being as central to all of our health, and as this enters its final phase and mandate, WHO will provide practical guidance, including beyond the health sector, to allow the greatest impact of this work. To address the question from Slovakia, yes, we are developing indicators on social connection, and we will reach out to you and others who have commented on that. I thank Poland for the comment about work-life balance, and would apply to all delegates here after a long week, and I hope you enjoy tomorrow off. The draft strategy on economics for health for all builds off the work of the WHO Council on Economics for Health for All, and it is critical that WHO plays a role bringing together our expertise in health and in economics. At a time when disruption in health services and financial constraints means we have to make tough trade-offs in all of your health systems, it is crucial that we bring a science-led approach to that and make sure that those trade-offs are done with the best scientific evidence we have available. The Economics for Health for All strategy will bring together also a practical menu to create stronger, sustainable, equitable societies with health for all. We thank the support for the resolution led by Egypt on the resolution on radiation and health. And again, at this period of conflict, as was outlined from Pakistan and from others, it is crucial that we continue our work on this, both within our division across the 3 levels of the organisation and with all of you member states. I'm pleased to say that we extended our collaboration this week during the WHA with the IAEA and with the ILO, as we heard earlier just now, and we're pleased to work together in partnership across our UN agencies. And finally, as with before, just like to thank all of the WHO collaborative centres with whom we rely so much for the scientific expertise and independent insight, and thank you to your work across all regions and across many of your member states. Thank you.
Is the committee ready to note the reports pertaining to this discussion as contained in document A79/5? I see no objection. The report is noted. Is the committee ready to approve the draft resolution entitled Radiation and Health, Strengthening Global Protection, Preparedness and Response, contained in decision EB 1589? I see no objection. The resolution is approved. Is the committee ready to approve the draft decision entitled Economics of Health for All, contained in decision EB 1588? I see no objection. The decision is approved. Agenda item 15 is now closed. We shall now continue with the review and adoption of our 4th report. You may refer to document A79/42 draft. I would like to give the floor to the rapporteur who will read out the draft report. Ms. Shalaka Junior Kujo, you have the floor.
23 May 2026, Draft A79/42, 4th Report of Committee B, Draft. Committee B held its 7th meeting on 23 May 2026, chaired by Dr. Kwabena Minta Akando, Ghana, and Mr. Bonanza Perwira Tahitu, Indonesia. It was decided to recommend to the 79th World Health Assembly the adoption of the attached 2 decisions and 1 resolution relating to the following agenda items. Promote health. 15. Review of and update on matters considered by the Executive Board. 15.3. The health of indigenous peoples. 1 decision entitled Draft Global Plan of Action for the Health of Indigenous Peoples. 15.2, Well-being and Health Promotion. 1 resolution entitled Radiation and Health, Strengthening Global Protection, Preparedness and Response. 15.5, Draft Strategy on the Economics of Health for All. 1 decision entitled Economics of Health for All. Thank you.
Thank you, Ms. Shalaka Junior Kujo. Are there any comment or observation? I see none. May I then take it that the committee adopts its 4th report? I see no objection. It is so decided. This report will be submitted to the next meeting of the plenary. Distinguished delegates, this brings us to the end of today's work of Committee B. As agreed, we will now give the floor to the delegations who have requested the right of reply. Let me remind you that the time limit for your intervention is 2 minutes, and in the event of subsequent requests by delegations for additional spoken right of reply concerning the same matter as previous replies, I kindly request delegations to limit such spoken statements to 30 seconds or less. I will now give the floor to Japan.
Thank you, Mr. President. Our delegation exercises the right of reply in response to the statement made earlier by the Chinese delegation. There was a referral to the discharge of Alps treated water from Japan into the ocean. Mr. President, in the interest of scientific accuracy, I'd like to clarify that the water in question is discharged only after purification through the Alps system and dilution with seawater. And since 2024, the IAEA has continued to confirm that its impact to be negligible on human health or the environment. It is therefore wholly inappropriate to describe the discharged water as contaminated water and contradictory to the scientific findings by the IAEA. Regarding the discharge of Alps treated water into the sea, since operations commenced in August 2023, the discharge has been carried out safely and as planned, in full compliance with international standards. The safety of the discharge has been continuously confirmed through the IAEA's reviews, as well as through monitoring conducted with participation of analytical laboratories and international experts, including those from neighboring countries. Mr. President, Japan remains fully committed to providing information based on scientific evidence in a transparent manner, offering detailed explanations to the international community, and fully cooperating with agencies' ongoing reviews and monitoring activities. I thank you.
China, you have the floor.
Mr. Chair, the international community, especially Japan's neighboring countries, has expressed legitimate concerns based on science and in the interest of protecting marine environment and human health regarding the discharge of Fukushima nuclear contaminated water. If it were really truly safe and harmless, Japan would not have needed to discharge it in the first place. Moreover, Japan's discharge will continue for 30 years. The results of a few sampling exercises are limited. Many radionuclides contained in this contaminated water cannot yet be effectively treated. Even after dilution, such discharges have non-negligible impacts on marine food safety and human health. The risks associated with the discharge of this water outweigh benefits, in blatant contradiction with the fundamental principle of international radio protection. Japan's repeated nuclear safety incidents further demonstrate that the international community has legitimate grounds for concern regarding the safety of the ocean discharge of nuclear contaminated water. Japan's discharge concerns human health and marine environment. It is not merely Japan's internal affair. We urge Japan to adopt a responsible attitude, respond to and address the concerns of the international community, and ensure that this discharge is subject to strict international oversight. Japan should draw lessons from past experience and act in the interests of the international community and regional safety rather than shifting risks onto neighboring countries in pursuit of its own interests. Thank you, Chair.
Yeah, Japan, you have the floor, but you speak within 30 seconds, please.
Thank you, Chair. In response to the exercise of the right reply by the delegation of China, I will not repeat all my remarks and not address every point that was raised. What we'd like to read here is that the government of Japan will continue to explain its effort to the international community in a transparent manner. In fact, 1 week later, on the 29th, the IAEA, including those countries or neighboring countries, will conduct the 8th such monitoring round with experts of third countries. I thank you, Mr. President.
China, you have the floor. You are also limited within 30 seconds.
Japan's defense cannot deceive the international community. China urges once again Japan to earnestly fulfill its international obligations, effectively manage the risks associated with such discharge, continue to accept international oversight, and make every effort to minimize the harmful impacts of the discharge of nuclear contaminated water into ocean on human health and the marine environment. Thank you, Chair.
Colleagues, let's take note of this announcement. The final plenary meeting of this Health Assembly will resume this afternoon, immediately after the conclusion of Committee A, here in this room. Distinguished delegates, colleagues, I would like to sincerely thank all delegates, the Vice Chair, Rapporteur, Secretariat, Interpreters, Conference, Services, and all colleagues for your dedication and cooperation throughout the work of Committee B. In particular, I wish to express appreciation to Member States for your valuable contributions, constructive engagement, and collaborative spirit during our deliberations. The committee has now completed its consideration of all agenda items entrusted to it. I therefore declare Committee B closed. Thank you.